Okay. Okay. So we'll start in a couple of minutes. We just a couple of minutes. Okay, I think we're ready to start. Okay, so if I get the thumbs up from the desk, then I'll. Yep, great. Okay. So, hello, and whether you're with us in person or are watching online, welcome to this first session of the day at the World Health Organization's Health Pavilion at COP26 in Glasgow. My name is Nick Bradshaw. I'll be your moderator today for a short but hopefully insightful session titled Health in All Climate Policies, Translating Policy Intent into Action in Qatar. Over the next 45 minutes, we'll be getting a range of expert perspectives from panelists here in Glasgow and hopefully via video link from Doha and other parts of the world, in fact. Two issues currently dominate the global news agenda: a health emergency in the form of COVID-19 and an urgent climate emergency that has led to impassioned protests around the world and has brought thousands of delegates in search of effective solutions here to Scotland for COP26. Two vitally important issues, and in this case, two distinct issues. But if we always think of health and climate change as two separate challenges that need to be tackled separately, then we're missing a vital link. Because health and climate change are intimately connected, with the effects of climate change and the drivers of climate change, such as pollution, having a massive impact on people's health. Today, we'll be hearing from a range of speakers from the worlds of government, policymaking, healthcare, the environment, the community, and sport. As the name of this session suggests, we'll be focusing on Qatar's efforts to ensure that health is a key feature of all climate policies and that policy intent is followed by action. But first, let's take a more global view. Chris Carter is Deputy Director for Global Health at the Foreign, Commonwealth and Development Office of the United Kingdom. The United Kingdom, of course, being the host nation of COP26. Chris, thanks for taking time out and joining us here on screen, I can see. Good. From your extremely busy schedule, I'm sure. Can you briefly take us through the health-focused climate action being advocated for at COP26? And also the commitments that are needed as we look beyond this particularly high-profile event.
Yes, thank you very much. My first thing to say is thank you to the Qatar Ministry of Health for organising this important event. It's going to be a really important discussion that we have this morning and afternoon. I will go through the COP26 health programme initiative and talk about the implementation of it. I would like to say, though, that we're very encouraged and we strongly welcome Qatar's own plans and progress in developing resilient and sustainable low-carbon health systems through your Greening the Health Sector programme. And we do look forward to close collaboration in climate and health agenda. And thank you for inviting the UK to speak. As Nick said, I'm the director that covers a lot of our global health work. It includes health system strengthening, as well as all our work on nutrition and climate and health and environment. Let's say a little bit more about why we have the COP26 health programme. We know that climate change is also a crisis for public health. It is estimated that approximately 150,000 people die every year due to climate change. And it is, as often the case, it's the world's poorest and most vulnerable that will experience its negative health impacts the most. So health systems are incredibly important to protect the health of our populations in face of the climate emergency. Impacts such as flooding, heat waves, extreme weather events. But health systems themselves are, of course, vulnerable to the same impacts, and they can be compromised when we're actually going to need them the most. The other element of this is that we have to recognise that health systems themselves contribute to carbon emissions. They actually account for between 4 and 5% of global emissions, which is quite shocking. And they're responsible for air pollution at the local level. So the health sector must show leadership on both of these aspects, both for short-term gain, but in the long term. Okay, let me talk about the actual health program. So through this program, the UK, as president of COP26, has worked with partners, particularly WHO and UNFCCC, climate champions teams, to encourage partner governments to make two commitments. Now, the first commitment is to build climate resilient health systems. And they do that by first carrying out a vulnerability and adaptation assessment of their health system to identify where their health systems are most vulnerable to climate change. The second part is then to publish a national adaptation plan. This forms part of a country's overall national adaptation plan. And that will set out how these vulnerabilities that have been identified will be assessed and addressed. The second element is to commit to developing a sustainable low carbon health system. This includes a commitment to carry out a baseline assessment of greenhouse gas emissions of national health systems, and then develop a roadmap or plan to describe how the health system will develop in a sustainable low carbon way. And then on top of that, for ambitious and high emitting countries, we are calling on them to set a target for net zero health system emissions. There's actually a number of different elements of the program, but one of the, I think, is really powerful element of it is giving healthcare professionals a voice in the climate debate. And for them themselves to advocate to close the gap between what is the research that's going on climate and health adaptation. I'll be here to answer a few questions if anybody has any on that. So far, so good. We have commitments. We're looking at plans and assessments. What about implementation? Well, for us in the UK, climate resilient and sustainable low carbon health systems is one of our strategic priorities. So that's why we have been behind this COP26 health program. It's also why we have a manifesto commitment from our government on this, and linked to our manifesto commitment on ending preventable deaths of mothers, newborns, and 2013. And again, my department leads on that related commitment, that was ending the preventable deaths of mothers, newborns, and children by 2030. We think the UK is in a good position to incorporate both these climate and health objectives into business plans. And we've just gone through a spending review, so we will be developing those business plans where Post will make commitments and look at, we've made commitments, we'll look at how they implement them through that business planning process. And now that we're the Foreign, Commonwealth and Development Office, we'll be using both our development and our diplomatic networks to make progress globally. We also want to leverage substantial investments from both the climate and the health multilaterals. We will be looking at our core voluntary contribution to the World Health Organization, our support to the Green Climate Fund, the World Bank, the Global Fund to fight AIDS, tuberculosis and malaria, and many others. Along with working with multilaterals, we want to continue to work with our partners, including Qatar, around their own commitments and how we learn from each other and turn commitments into costed action to deliver at scale and pace. Yesterday, there was a COP26 meeting with key government and multilateral donors and ODA eligible governments to discuss funding, how we close the financing gap for meeting these commitments. there was a really strong consensus in the meeting um, that it's collaboration, it's working together um, that will solve these issues and tackling the barriers to ensuring the implementation of the COP26 health program initiatives. And as I hope is clear, we will play our part in this and are very serious about it. I think I will stop there. There's quite a lot more we could say, but it would be good if there are any questions or any comments.
Thank you, Chris. Thanks for joining us. I know how busy you are today, so really appreciate that. I think we're going to be moving straight on into the next speaker, actually. So we're going to go from a UK and global perspective to move our attention to Qatar. Even those with little or no interest in sport will know that Qatar are gearing up to play host to the FIFA World Cup at the end of 2022, just over a year from now, and the first Arab nation to do so. The event organisers in Qatar are the Supreme Committee for Delivery and Legacy, and they've committed to making next year's tournament the most sustainable yet. And I'm sure I'm underselling it massively by saying that. Örjan Lundberg is sustainability expert at the Supreme Committee for Delivery and Legacy. Örjan, thank you for joining us here in Glasgow at COP. Can you tell us about the various efforts being undertaken to deliver a carbon-neutral World Cup and the relationship with health of those efforts?
Oh, well, thank you very much, sir. I'll try my best to do that. So you mentioned before that the global health crisis and the global climate crisis in the news. Another thing that's always in the news as well is football. And the Football World Cup is the prime event, the main spectacle, the highlight of the football calendar, I suppose. And yes, we're hosting that in the small but yet mighty nation of Qatar next year. Actually, more or less 1 year from now. The bidding to host the World Cup was undertaken in 2010, so we're well beyond 10 years away from that now. And in those bidding documents, there were commitments to deliver a sustainable World Cup, to have a green program, to do reforms in many different areas, and one of them was climate change, and to have a strong climate program and deliver a carbon-neutral World Cup, which was the terminology used at that point, and we're still sticking with that. And that means that from the day it was put forward as a hosting concept, we have integrated and included these type of concepts in all the planning, in all the designs, in all the construction, and now in the operational planning, and also in the legacy element. So it's been really top-level commitment from the start, and it's enabled us to deliver quite nice programs in this area. Obviously, we are host nation representatives. Our counterpart is FIFA, who is the global governing body for football. And they had a presentation actually here at COP last week where they presented their climate strategy, where they committed to a net zero roadmap for halving their emission by 2030 and net zero 2040. So it's really encouraging to see the football governing body also taking a path in this direction. My previous speaker was talking about how you need to baseline, you need to have a reduction roadmap, and then you need to implement that, and then you can do some offsetting compensation to get to that carbon neutrality point. And that's exactly the approach that we are taking as well. Although our sustainability strategy is wider than just climate, we have a joint strategy between FIFA and ourselves, which is the first time in the history of the World Cup that FIFA has actually bothered to do it together with the host nation. With that, it allows us to actually really focus on the preparations, which is very much the host nation's responsibility, the event itself, and also the legacy. And we're covering environment is one of 5 pillars in that strategy. Carbon being one of 5 priority areas within the environment pillar. So other areas that we cover is water, air quality, sustainable building, and waste management. And I think, yes, the carbon program is very linked to the health aspect, but so is the air quality program that we're doing. So this is the first time that there is an air quality program linked with the World Cup. So we were doing measurements, we're doing mitigation plans, trying to control whichever sources we can control for the athletes, for the people that would be working at the event, and also for the spectators. And part of that is for us to be able to have an inclusive tournament. So anybody, even if you have a respiratory disease, etc., you are able to come, enjoy the match, and be safe and comfortable. So our carbon program is obviously the baselining approach. We have recently published our greenhouse gas inventory, which is available public document, which sets out exactly where the main sources are. And it's from transportation, everybody will come. It's from construction, we built quite a lot. And it's actually from the accommodation sector as well. So we have strong programs in all of those different areas now. Obviously, with the transportation one, flights is flights. So we're trying to do something around that. Qatar Airways has one of the most modern fleets in the world with fuel-efficient planes. But we're also now locally in Qatar, we have recently opened, maybe two years ago or so, a brand new metro system that will connect all the different stadium locations and will be the backbone of the transportation system during the event. This is now being supplemented with electric vehicle buses, which is coming into to use in the next couple of weeks. And in the accommodation sector, we've been working with our next speaker, Michal, from Qatar Green Building Council, to have a strong program with the hotels to reduce their environmental impact during the event itself. In addition to that, we're looking at a lot of temporary solutions for accommodation, because we know the peak is going to be quite massive during that time. So we will have cruise liners coming and act as floating hotels. We will have desert camping. Temperature is quite nice, and it will be a wonderful experience, I think. We're also looking at temporary converting villas and residential towers to hotels at that point in time. And then we are investing in carbon offsetting programs. We have had a point where we were looking at different programs around the world, and we found that there was not that much focus on the Arab world in terms of finding the regional area, I suppose, for Qatar. So we have partnered with one local organization to develop a platform in Qatar that is now recognized by several different UN bodies as a carbon credit issuing body. So this is a institutional legacy, I suppose, of the World Cup, and we will utilize credits from that entity as well, called Global Carbon Council, which is a Qatari-based organization now that will carry on and deliver credits for the long term. But I think, in essence, bringing football and showing off football, we also have a lot of community programs that are promoting active lifestyles, healthy lifestyles, get involved with sports, get out, play, which brings, exercise, but it also brings community, it brings passion, it brings fun, and that's what we're hoping to do with the World Cup as well.
I mean, sport and health are obviously linked, well-being, keeping active, these kind of things. So I can see the link there. But our session today, one of the core things is that we're saying moving from policy to action.
Yeah.
With the World Cup, it's a very specific event that the world's focus will be on, not just focus locally. A really good opportunity to showcase this. How much of it is a pressure? How much is it of an opportunity?
Well, I think one of the things that it also has is a firm deadline. So this is the day when they're going to come and start playing the football. So we've got to be ready at that point. And that's a benefit to many projects as well. Mm-hmm. Yes, I think there was some pressure, but since most of the commitments came from the bidding documents and from the bid commitments, it was, this is what we are planning to do, this is what we will be doing. So there was a drive from the host nation to have these programs. Sure, yes, the FIFA, who is giving the hosting right, have some requirements, but I think the program that we have put in place goes well above and beyond those requirements, for sure. And when it comes to the implementation, it's fine to have the strategy and the policies, but you need to have concrete projects, concrete plans, with deliverables, with responsible people, and it needs to be stuff that is in the background of the event experience, but also things that are right when you come as a spectator. What are you buying when you go to the kiosk in halftime to get your snacks? How's the packaging? Where can I put it? These kind of things as well. So it's the big ones, and it's also the little details.
Thanks, Orin. Thanks for giving us that kind of perspective and good luck with the World Cup next year.
Thank you very much.
So we're going to go back to the video link now to talk about the built environment. And the built environment is the focus of Michal Al-Shamari, Director of the Qatar Green Building Council. And he joins us from Doha, I hope. Good to see you, Michal.
Thank you, Chris. Good to see you too.
I can hear you at least, so that's a good start. And now we can see you. You're going to be talking to us today about a sustainable community of practice and healthy buildings in Qatar, and how this goes beyond the business case that was at the core of what you were doing some time ago. Can you explain what you mean by that?
Yeah, thank you. I'd like to thank Ms. Public Health and Wish for arranging this nice panel. I would like to take you through the journey of the green buildings. As you are aware, Qatar Green Building Council, from its title, it's about green buildings. But after the development of the concept of green buildings and research development in that field, we found so many other benefits for green buildings exceeding the saving water and energy or saving the temperature, and it exceeds to direct impact on the well-being of the tenants of those buildings. So since we started, our target was to realize a resilient residential or building sector in Qatar and protect the well-being for both people and the planet. There is a very strong connection now between climate change, our residential building or buildings in general, and also the well-being, because actually the buildings consumes more than 36% of the produced energy in the world, and they contribute to more than 39% of the CO2 emissions in our planet. So they have a very strong contribution to the climate change, and raising the efficiency or performing better efficiency of those buildings for sure will have a very good impact on the our targets on reducing the impacts on the climate change. And actually, as human beings, we spend more than 90% of our time in our buildings, especially in our area where we have very hot climate. So obviously, either at school or office spaces or buildings or homes, we stay more than in our country more than 95%. Out of that, 65% spent at our homes. And after the pandemic, we realized the importance of having a healthy homes because our time became more than 99% in our homes. So we realized that having a healthy building with all its green and sustainability aspects is very important. And considering that only, for example, in Europe, only 10% of the houses or homes there are designed in a good way. So imagine the level of and quality of having such good buildings from sustainability point of view and health and well-being in other countries. I'm sure that that number will be much less. And also the report shows that 1/3 of the death in the world are because of the lung diseases, which contributes to more than 6 million people every year. So that's a very good, a very strong indication that we should take care of the indoor quality more than outdoor. People think that sometimes indoor is more safe than being outdoor, while sometimes it's the opposite, where if you don't have a healthy indoor environment, that will have a severe impact on your health. And in Qatar also, as water and energy consumption, the cooling system consumes more than 75% of the energy. So having the thermal comfort is very important, and we need to do that in an efficient way. And with the consideration that we are going to have more than 75% of the population in the world will be staying in or living in cities in year 2050, which will have more than 84 gigatons of CO2 emissions by at that time. So our contribution to reduce that impact of our behaviors and buildings' contribution to the climate change is very essential and important. Considering that also, as part of those about 6 to 7 billion people will be moving to or living in cities, it's not only about water and energy consumption, it's about the waste that will be generated, its direct impact on health and well-being, the pollution that will increase because of the need of building those mega cities in the near future. We might have more than 42 cities, and each city will accommodate more than 10 million people at that time. So going back to your question, as efforts of Qatar Green Building Council or local efforts in Qatar that we do, so we developed so many programs in that field to support our efforts in that program. For example, like as Oria mentioned, we work with them in the hospitality sector and how we can make the hospitality sector very sustainable, considering that we have more than 1.5 billion tourists every year. So having them perform in a sustainable way, moving that sector to be sustainable is very important with its direct impact on the climate change. Not only that, also we would like that experience to be healthy. So we from our certification to those hotels, we have a program called Green Key. We also certify the hotel or the hospitality facilities from well-being. So they have to provide organic or healthy foods options, natural and outdoor environment, the level of quality in the room. So we are talking about acoustic level, indoor air quality, and natural ventilation and natural lighting. So all those things are measured within our facilities. The same thing that we do with a program called Eco School. So we try to educate the student from their early life stages about the SDGs and how it's important to link our education system with the SDGs and the eco school being eco-friendly people, and how that also have a direct link to our health. So we evaluate the school from having toxic materials, maybe paints, furniture, or whatever. Also indoor air quality is part of the measures. We apply that in other programs. So we work with the U.S. Green Building Council in the WELL program, which is a certification tool for well-being within the buildings. And it's a very strong program that focus on the well-being of those buildings. And after the pandemic, they have developed WELL for health and safety, which is very important tool also that gives us a good measure of those buildings from well-being perspective. So it's not about having a certificate for the building from energy efficiency perspective only, because everybody cares about energy efficiency, but we should have different measures that goes to well-being. So if I'm going to stay in a building, I would like to know what's the status from health and well-being that building will be, how it's going to impact me and my family. So it is very important to look at that sector. So well-being and is become one of the essential factors. As I told you, now we do like the Eco event or Green Key program, recycling certification program. They focus on different aspects like food and beverage, waste, education, how you educate the visitors or the tenants of your facility about healthy practices within the facility itself, environmental management, and also educating the staff that works in that facility about sustainability and its direct impact to their health and health well-being and climate change.
Thanks,
So it's
Michelle. Michelle, sorry, I'm going to need to cut you off because we've got 3 more speakers and only 10 more minutes left. So thanks so much for being with us. I hope you got to say what you wanted to say.
yeah, that's
Okay, thanks, Michelle. Thanks. Sorry to do that, but we are quite tight on time. So I'm going to move now to Saeed Mohammed, who is also joining us online. He's the Director of Knowledge, Policy and Strategy of the Qatar branch of the Arab Youth Climate Movement. Saeed, much of your focus is on community engagement. Can you give us an idea of how you mobilize young people into action and the role data plays in your efforts? And if I can ask you to be quite succinct, quite brief, please.
All right. Okay. Well, our organization, the primary premises are we focus on evidence-based policies and evidence-based engagement with the community. And unfortunately, in Qatar, that's very difficult to find information. And almost most of the relevant, particularly on environmental related issues, the information is always scattered. It's been dispersed. So we try to kind of always make sense of that information, but try to put together everything and try to make sense and engage that, deliver that information to public. And this is often challenging because it's getting that information from different stakeholders has never been easy. So our effort is always to get the evidence, the right evidence. One of the recent work that we have done is to publish reports on Qatar's greenhouse gas emission inventory, because Qatar has always been accused of one of the highest per capita emitter. But we always see that from different perspective, as a civil society, as an independent organization, we always wanted to kind of try to come up with a different narrative to tell the story that Qatar as a small country can't be just blame accuse in such manner. So we kind of create indicators and based on information, based on the data, and this report particularly targets those information, collects and reports that. And what we try to do is to measure, report Qatar's consumption-based emissions. And along with that, we try to reach out to different communities, like different groups. Like our work focus more on grassroots levels, along with we work with policymakers as well. And one of the programs that we have done, that we are currently undergoing is like Household Carbon Footprint Initiative, where we engage high school students, to capture all the resources that they consume at a household level, and also to report the waste emissions that they have done. We created an app and tool that helps them to kind of monitor their resource consumption. And also along with that, not only just having that information, what are they going to do with that one? We need to kind of find ways to respond to that one. So the following up methods is where we're going to sit with the parents and with their elder members, with the households and with the kids, to try to kind of make sense of that information, and okay, we have this problem, and then how are we going to find solutions? So we always try to kind of not rely everything has to be the technology is a solution for that one. There have been different practices in our the previous generations. We have used practices that are still kind of considered to be much more relevant in 21st century. So how we can try bring those practices together. So these are some of the initiatives that we have done. And other program that we are going to do is on eco literacy for imams, where we're going to train imams to really understand, to talk about science of climate change itself, and to talk about science of climate change. And unfortunately, as a researcher myself, always look about how much research has been done related to climate change in Qatar. I've searched literally all the databases, and you wouldn't find a single article about the Qatar's impact. I mean, Qatar's climate change impact on public health. Not a single article. You've seen about on Iran or whole as a region, and you won't find anything about Qatar itself. So it's a kind of very problematic situation. How are you going to communicate the problems when you don't really know? Yes, you can speak in abstract terms, but when you don't really have a concrete numbers to tell and deliver, okay, Qatar will going to face 50 extreme heat wave days in 2050. You need to have that exact number in order to tell people the severity and the gravity of the problem. When you just tell as a broader the global things happen, when you can't, when a community can't really able to sense and relate to their own personal level, then they're not going to take action to that one. And I guess there's something that a huge gap that currently exists. And I really hope in the next few years, we conduct very strong research and understand the epidemiological impacts of climate change. And this is a kind of a first step that we need to do, baseline. Also, the previous heat waves or the air pollution events, we don't really have a strong relevance, how this different events has impacted public health, particularly in terms of respiratory or other diseases. We don't really have a track record of that one. When Qatar kind of faced floods, we don't even know how much of the impact that happened, both economic and social impact as well. And I guess that's something that the policymakers have to take into consideration. This data needs to be in public, and so that researchers and a civil society like us, manage to kind of convert this data into much more useful for the country itself. And when you when such data doesn't really being kept in public, and then the research community will not able to come up better solutions. And so also the community really need to know where the problem is, and because they're going to live here, as an expat I might leave, but the local community has to it's a responsibility for the for policymakers and academics and researchers to tell where the problem is and how we're going to find solution. And also our organization believes in co-creating solutions rather than being preachy about it. So we always try to work with the community to find win-win solutions. And I hope in the coming days we'll manage to work with all the relevant stakeholders in the country along with the support of community to find better ways forward.
Thanks, Saeed. Thank you for that. Really good to have you joining us. You mentioned the importance there of research, and clearly, as a researcher yourself, that's something to have as the ground rock of everything else that then gets built upon that. I think actually we have some good news with the final two speakers that we have here in terms of policy influence and policy making. I mentioned at the start of this session that I work for the World Innovation Summit for Health, otherwise known as WISH. WISH is based in Doha. It's the global health initiative of Qatar Foundation and was created in 2012 with a very simple remit of helping, simple and yet complex, remit of helping build a healthier world through global collaboration. And that's done through events, research, and community programs to achieve that objective. Last year, WISH published 3 expert-led evidence-based reports that looked at the close relationship between climate change and health, and it's an area that WISH is going to continue working in. The recommendations of one of those reports have been adopted by Qatar's Ministry of Public Health to provide a 10-point checklist for climate change action across government health facilities. Sultana Afdal, seated next to me, is Chief Executive Officer of WISH. Sultana, can you tell us about why WISH decided to put so much focus on climate change and health policy for action, and also guide us through the recommendations of the recently published report, Health in a Climate Crisis?
Absolutely. Can you hear me?
I can.
Yes, well, as you know, Nick, with every summit, we gather the best minds from around the world to tackle some of the most pressing healthcare challenges. And put simply, climate change is a human health emergency that is having a severe negative impact on people's physical and mental health. So the reports that we commissioned focus on key areas that are being affected. And Saeed, I think this is a report you might find of interest. For example, one of our reports, Healthy Dry Cities, takes a look at a very sparsely researched area on how to mitigate the effects of increased desertification and ensure good health in arid, dry regions, a topic that is becoming more and more relevant, not only to our region, but different parts of the world. Our second report, titled Climate Change and Communicable Disease, highlights how increasing global temperatures have already expanded the areas where climate-sensitive infectious diseases thrive, such as malaria and dengue, and how floods and droughts, which inhibits the lack of access to clean water, contributes to the spread of disease. The report that you see here, Health in Climate Crisis, is the third in our series and presents a framework highlighting the threat caused by climate change that is impacting a global burden of death and disease. It's also a call to action, and like all of our reports, presents evidence-based research with clear, actionable policy recommendations. Before I go on to present the 10 action points, I'd like to point out a few key observations, not only of COP26, but of the climate change debate in general. Whilst it's incumbent upon policymakers and practitioners to have a responsibility to address climate change and mitigate its effects on human health, I haven't seen that as a central message of COP26. Often people need clear, concise evidence that climate change is affecting them directly, and I think that opportunity to put that message to the people has been lost. While it's vital we preserve the planet for future generations, we need the messaging to be clearer. Telling people why it matters to their health, to their finances, and doing it in an innovative, targeted way is vital. Secondly, simply providing information to people does not necessarily translate to behavior that will contribute to real change. I'm sure many of you have heard of behavioral insights, a term that refers to efforts made to gain accurate and evidence-based understanding of how people behave and make decisions. With behavioral insights, you can help to reframe and improve communications, identify the need for nudges, overcome biases and barriers to penetrate the rather sometimes vague and often over-messaging of the climate change debate. Next slide, please. So, the 10 key actions for health leaders. The first part is titled Be the Change. Number 1, ensure that climate change resilience plans are in place, funded, and acted upon. Number 2, switch facilities to the greenest possible systems. 3, be uncompromising about reducing waste and minimizing resources in clinical settings and catering. As you heard from Chris, 45% of pollution does actually contribute to 45% of pollution. So number 5, require suppliers to report their environmental footprint and climate resilience to you and set a commitment for improvement. Number 5, publish your organization's impact annually and commit to improve. Next slide, please. Lead the change. Mobilize your workforce to speak up. Speak out about adaptation methods needed to safeguard people's mental and physical health from climate threats. Invest in innovations for climate-smart healthcare and divest from fossil fuels. join or build cross sector coalitions. And finally, highlight and act on the positive health impact of improving air quality, as well as the negative impact of using fossil fuels. Just to say, even gradual change is a positive step forward. Healthcare leaders are among society's most authentic messengers, with public trust currently very high as a result of the COVID 19 pandemic. Added to this, with 170 million workers and $8 trillion in spending, healthcare has tremendous market power at its disposal. They can and they should lead the transition to environmentally sustainable, health promoting societies. Thank you.
Sultana. Thank you, Sultana. Our final speaker today is Dr. Roberto Bertolini, who is Senior Ministerial Advisor for Public Health to Qatar's Minister of Public Health. He joins us via the video link from Doha. Dr. Roberto, hello. You are a champion of the concept of health in all policies, including the focus of today's session, health in climate policies. So can you take us through Qatar's roadmap for greening the health sector?
Thank you, Nick. This is very pleased to be here today. Also because to initiate a discussion and an action on climate change and health in Qatar has been a very important achievement. And I would like to thank also Wish for the leading role that Wish had in this process, and also in the conference of last year, which for the first time introduced the issue of climate change and health into the debate. So I have a few slides to show to you, and I will try to be pretty fast. Can I get the first slide, please? Right, so the next slide, thanks. I'm not sure that everybody in the hall has all the information about Qatar, but just very briefly to say that Qatar is a small country with 2.9 million people, but most of the people are expatriates coming from 150 countries, most are young people, and this also is a special challenge that we have to consider. So the population distribution, the ethnic origin of many people it needs to be very much in our minds, because the messages, the behavioral change that also Sultana was mentioning before, needs to be adapted to this very heterogeneous context. And in the next slide, I have summarized a major development which has taken place recently in Qatar, which is the national climate change agenda and the establishment of a ministry on climate change, which has been done very, very recently. And Qatar has taken some commitment at the national level to reduce by 25% the emissions by 2030. And also, it has summarized in a published National Climate Change Action Plan a number of actions to be undertaken to achieve this goal, which are 36 mitigation initiatives and 300 adaptation initiatives. And out of all of this, I would like to remind the audience that in addition to the commitment which has been mentioned before by a colleague at the Supreme Committee on a carbon neutral World Cup, which is a very important commitment, there is also another commitment, among others, which is to plant 1 million trees by the 2022 and 10 million trees by 2030, contributing to this particular action, as well as differentiating energy use for electricity and introducing massively the solar energy in the country. So these are just some of the issues which has been mentioned, and I mentioned in the plan, but I want to emphasize them because this means that the awareness of climate change in the country is becoming much more relevant than it used to be in the past. And the next slide, I was already mentioned that health contributes substantially to emissions of CO2 and other greenhouse gases in the world. I mean, Chris Carter mentioned that, 4 to 5% of the global emissions. And Qatar has a major, health sector here, with more than 45,000 clinical staff, both private and public, with 13 hospitals, 10 beds per 10,000 population, 27 primary healthcare, and a number of other private healthcare institutions. So this means that we have a big sector in the country here, where effective action to reduce emission can have an important role. So on this basis, we have taken up the commitments and the recommendation coming from which the Sultana just mentioned, and I can get the next slide, please. And we have taken these commitments to as a basis for for initiating action in the area in the health sector and address the contribution that the health sector gives to climate change, both in terms of leading the process, so showing that things can be done, but also acting specifically in order to contribute to a decrease in CO2 emissions. We have just initiated this pathway, and we find it very important also to use it as a first case of a sector committing itself to reduce gas emission. In the next and last slide, I have summarized some of the initial commitment that we are taking. This is a work in progress. We are starting these days together with the colleagues of the HMC and the PHCC and the other institutions here in the country. And we need to significantly reduce environmental impact and CO2 emissions in the health sector, and to act as a role model for all other sectors in the sector, and also regionally in the region of the Middle East. So the first commitment we are taking is to develop a baseline and publish the results of this baseline evaluation to set on this basis concrete objectives for 2025-2030, to systematically monitor and report through a periodic annual reporting cycle the data and the evolution of the data. And this is important, as Syed was mentioning. We have an issue of data circulation and publication here. And also to be uncompromising about the waste. There is already some initiative on reducing waste coming from the hospital, which also contributes to the greenhouse gas emission. To participate actively as the health sector to the community of practice, which was mentioned also before, and we intend to strengthen this with the participation of the health care workers and the health sector in general. And finally, upskill the workforce on climate change related health conditions and implications for clinical practice. Within this, if I want just to make a comment on what Syed was mentioning before, I mean the need for research on climate change and health. This is a very important point. I want just to emphasize once again what has been already mentioned by Syed and Sultana, the issue that we need to get public support on this. And emphasizing the role that climate change can have on the health of the people, not so much in a distant future, which is still a concern, but not in the minds of many people too far away, as it happens for many other issues in the public health arena. I think we need to emphasize the co-benefits of addressing climate change emissions now, in terms of decreasing air pollution, in terms of decreasing the impact of acute and extreme events through also adaptation mechanisms. So this is now happening, starting to happen. We need to fuel this process with data, information, campaigns that I am confident on the basis of what is happening, and also using the platform of the World Cup will actually help us. And I conclude by mentioning a project on sport and health that we have just initiated with WHO. Today we have the first mission on the component on health security. We have a health promotion component also, and a communication component, which will try to use the platform of the World Cup, the opportunity of the World Cup as an opportunity to raise the health promotion activities, the attention to environmental protection, and also using a communication tool to give a message worldwide on this issue. I stop here, Nick. I'm ready to answer any question or remarks that can come.
Thank you so much, Roberto. A really positive note to end on, I think. I think we can really see that the intent is really turning into action in Qatar at the moment. Thanks to all the speakers today. Lots to think about. Really grateful for the opportunity to be here. Thank you, Ministry of Public Health. Thank you, everybody who's taken part. And Those of you here at COP, enjoy the rest of the event. Thank you.
Okay, I can't hear anything in my headphones. I can't. Should I? Huh? Can people hear me? I can't hear myself. Okay, but I might not hear anyone else, but we'll try this. Okay, so thank you so much for joining us. I guess I don't need to hear myself. My name is Elizabeth Robinson. I'm director of the Grantham Research Institute at London School of Economics. And myself and Dr. Shora Dasgupta, along with our rather distinguished panel, would like to talk to you about climate change, health, and food security. And what, oh, I can take my mask off, can't I? That's a little better. Ah, oh my gosh, that's so much better. So, what we're going to present to you is findings from data, secondary data. And so this is going to tell us the what, about what the data reveal about climate change, food security, and health. But I think what we're all really interested about is the so what. And so the panel here is to talk to us about the so what. So the secondary data reveal for us patterns and links between climate change in terms of weather, in terms of heating, in terms of weather shocks, and outcomes directly in terms of health outcomes, and also indirectly through the impact on food production, food insecurity. And so that's what we'll present, and we're started a bit late, so we're going to try and spend about 10 minutes each on that, so we've got a full half hour to talk to the panel, and they'll talk to us about the so what. So I'm going to hand over to Dr. Dasgupta to give the first half of the presentation on climate change and health, and then I will talk about climate change and food security and health. Thank you.
Thank you, Liz. That was fantastic. Thank you, everyone, for joining us. As Liz said, I'm Shora Dasgupta. I work at the Fondazione CMCC, the Euro-Mediterranean Center on Climate Change, based in Venice. Terrible place, but someone's got to do it. So the first part of the presentation is going to deal with climate and child health. Yes. So this is our plan. So we're going to go through climate change and child health. We give you a global impacts first, then we focus on Burkina Faso. Thanks to our friend from Burkina Faso, we have a representative from join us. Then we'll switch to climate change and food security. We'll again give you a global impacts, and then put a spotlight on Ethiopia. And then the focus will be on panel discussion. First part, we have data from about 120 countries in our first paper. So we know climate change affects human health in multiple and complex ways. These impacts vary across time and space, and within countries, not just across countries. So we do need to understand local context, not just in terms of climatic stressors, but also in terms of socioeconomic determinants. And we're going to try and bring in both this into play. This is a complex diagram, but it's important that we at least have something in mind on this. So we control for climatic events, so warming, but also altered rainfall, increase in maximum temperatures in a given day, in a given week, but also monthly maximum temperature. Then we go to direct effects, temperature impacts, precipitation and flooding. I come from Bangladesh, frequent flooding every year. We do need to understand how flooding events affect health, not just in the short term, but also long-term impacts. And then we have droughts. Droughts are becoming more and more frequent. We do need to understand their impacts, consider policy implications. So we have a variety of health impacts going from infectious diseases, kidney-related diseases, respiratory diseases, and so on. We combine, in this paper, a subnational level data from 119 countries, so near global estimates, with high-resolution climatic data. We control for both gradual and extreme events, such as droughts and heat waves. We control for further socioeconomic determinants, such as education, income, access to toilet facilities, access to electricity, and we interact them with our climatic stressors to understand if there are any mitigating effects on this. Our data set comes from 600 subnational, 600 DHS level surveys, or our household level surveys, provinces, states, governors. This is where the data is measured at. 1,300 subnational regions from 119 countries between 1991 and 2018. This is a big data effort, but we hope that this big data effort leads to policy implications. We control for CPI, which is extremely important in countries such as Bangladesh and Burkina Faso, the drought impacts, and heat waves becoming more and more frequent everywhere. Just to show where our data comes from, 1,300 subnational regions from 119 countries. We cover the developing world. Some results. Looking at temperature first, what we see is that with initial warning, there are some positive impacts on health. So as temperature initially increases, we do see child mortality declining. We do see stunting and wasting incidences declining. But the U, the bend of the curve, we compute optimal conditions which minimizes health outcomes. As you can see, these health outcomes, the temperature outcomes between about 16.5 degrees and 19 degrees Celsius, beyond these thresholds, any further increases in temperature results in worsening health outcomes. So we need to consider these thresholds across the subnational regions, across the countries, and understand these impacts. Furthermore, we do see that as droughts increase and as incidences of heat waves increase, child health outcomes worsens. And as these are becoming more and more frequent and will continue to do so, it's not just warming, increasing temperature that we have to worry about. We do have to worry about how droughts are increasing in frequency, how heat waves are increasing in frequency, and their impacts on food policies and food implications. Many of the developing countries that we have in our panel, we do find that their improvements, they have made remarkable improvements in their socioeconomic outcomes, such as education, income, and reducing poverty, increasing access to electricity. These have improved child health outcomes, but these improvements would have been much higher without these climatic events or without the climate impacts. This is what we need to understand and always take into account, the interaction between socioeconomic indicators and the climatic indicators. So some countries beyond, so you can see that most of this map is red, which is problematic. This means that most of the countries in our panel, most of these 119 countries, and most of the subnational regions are already beyond the minimum, the optimal conditions that we have estimated between 16.7 and 19 degrees Celsius. Problematic because as temperature increases, the health outcomes the projected health outcomes will become worse. And we can see them in the slides. As you can see, as temperature is increasing, RCP 4.5, we're already there. About 2.2 degree increase in temperature by 2070. We expect under 5 child mortality to increase by 4.7% by 2050 and more than 6% by 2070 under RCP 4.5. But our more extreme situation, RCP 8.5, which is 4 degree increase in global warming, we expect almost a 10% increase in child mortality by 2070. Devastating impacts. It's going to wipe out all our child achievements or health achievements that were made in the last 50 years all over the world. And similar with underweight, we expect we expect incidence of underweight children or wasted children to increase as the world warms over the next 50 years or so. So some countries that are already on the brink, Saudi Arabia, Chad, Kuwait, and Burkina Faso in the short or the medium term by 2050, but in the longer term by 2070, countries such as Sudan, Ethiopia, Kenya, Niger, Mali, Mauritania, we can go on. The list of countries are too long to consider to stop right now, that are going to have all their health achievements wiped away by warming and increases in extreme events in the next 50 years. We're going to come to the discussion in a little bit, but the main implication from these findings are that countries where heat is already having a negative impact on child health will be further warmed. I have named some of the countries. This will put increased pressure on the health services, and the pandemic has showed us what happens when our health services cannot cope, even in the developed world. Imagine what happens in a country like Bangladesh with still underdeveloped health services. So as we move on to the second part, something I do want to highlight is that we will need both mitigation and adaptation. Particularly in low and middle income countries, with relatively low human development indicators. So as we finish our near global analysis, we're going to now put a spotlight on Burkina Faso. Burkina Faso is particularly susceptible to climate change, increases in temperature, droughts, heat waves, changes in rainfall variability, and other extreme events. We have the evidence suggests that there has been a 0.6 degree increase in average temperature since 1975. That is quite a significant increase. By 2080, between 2 degrees and 4 degrees increase in warming are expected in this country. We have taken data from the Demographic Health Survey, combined it with high-resolution climatic data, and have taken a deep dive into Burkina Faso, to investigate the impact of both climatic and weather shocks on child and maternal health. We can safely say this is the most comprehensive assessment of climate impacts on child health in this country, in Burkina Faso. The map shows how the country has warmed since 1993. In 20 years, significant increase in temperature, as we have said. And one problem in Burkina Faso is that crop yields of the major crops seem to be plateauing. So they were increasing for a while due to increase in technology and adaptation, but now they've sort of flattened out. However, Burkina Faso has made remarkable improvements in child health in terms of stunting and wasting and in reducing child mortality. However, these improvements would have been much higher without climate change. We find in Burkina Faso that increases in temperature, monthly temperature, or monthly temperature that the survey was taken, then increases in the 3-monthly temperature. However, even more, increases in anomaly of the main crop seasons, sorghum, millet, rice, and maize in this country. This warming during the crop seasons has a significant adverse impact on child outcomes in Burkina Faso. So we're not just controlling for warming in month to month, but also in the crop season temperatures. We put all this together and combine this with future climatic data, significant increases in under 5 mortality. We have done something new, methodology-wise, in this paper. We have combined climatic scenarios with socioeconomic scenarios. And what we do find that you can develop or increase your income and reduce the adverse impacts of climate change on health outcomes to a certain extent, but only to a certain extent. So what we find is that under RCP6, which is about 2.5 degree warming by 2070, improvement, and combining this with SSP5, which is fossil fuel developed income, that will result in some improvements in child health outcomes. But this is because you are growing and you are able to invest more in health, but again, only to some extent. Same case of wasting. Devastating impact of warming on Burkina Faso in the context of child health in the next 50 years. Improvements in income and other socioeconomic conditions will help negate some of this, but again, the context matters only a little bit. So, some policy implications before I hand over to Professor Robinson. Health outcomes in Burkina Faso, they are improving, but these improvements would have been much greater without climate change. What we find is that increase in monthly temperature and frequency of months where the average temperature is beyond 26 degrees Celsius in Burkina Faso brings about significant negative impacts on child health. Temperature anomalies in the main crop seasons, sorghum, maize, millet, and cowpea, have further impacts. So it's an additive impact, it's just not just change in monthly temperature, but also the crop season anomalies that are increasing. Our analysis helps us to identify and predict hotspots where child health is most vulnerable, or the regions in Burkina Faso that are going to be most vulnerable due to climate change in the future. We hope our results can be used by policymakers to design tailored policies and improve the improvement of existing policies or efficacy of existing policies. We do hope the goal of our research is to improve child and maternal health in Burkina Faso. With that, I hand over to Professor Robinson for climate and food security. Thank you.
Thank you. So if we just move to the next slide. Yes, so as I said, I'll talk about global and then specific country implications. So I'll try and go through this quite quickly because I know we want to listen to the panel. So on the next slide, we can see I'm just going to show some data to start with at a global level about levels of insecurity. And I just want to highlight here that we're using the Food Insecurity Experience Scale. And so it's slightly different from what some of us used to using the FAO stat data. So this is about people's reported food insecurity across a wide set of dimensions. But, on the next slide. What we can see is there's considerable moderate food security across countries. And so these are just data taken straight off the website. These are quite easy to access. And then if we look on the next slide, we can see the extent of severe food insecurity across countries. On the next slide. Here we go, yeah. And so I think this just puts in context, you know, this is Europe. And here we've got quite a lot of variety in African countries, the Americas, Asia, and just 2 countries there in Australasia. But so these are just easily accessible data, and it's just a nice starting point to say already in 2021, with just 1.1 degree of warming, we're already trying to deal with a lot of food insecurity. So if we look at the next slide, there's a lot on this. Apologies to the panel, you can't see it. There's a lot on this slide. But here we're trying to look at global hotspots. And so what we're plotting first is where we see high levels of food insecurity. So the darker blue, the more food insecurity there is. And we're overlaying that, the current temperature anomaly. And so that starts to say we might start wanting to focus our efforts at a global level when we're thinking about this, where these hotspots are. And this is just a snapshot of what's occurring now. But what we can do is we can trace this back in time to show where the hotspots are evolving. But also we've got future projections using some of the data Dr. Dashgupta showed us to show where those hotspots are likely to evolve in the future. And again, suggesting where we start to need to focus on reducing the worst of countries that are already food insecure, that are going to experience some temperature anomalies. On top of that, we can then overlay, for example, data on crop yield potential. Which talks about how heat is going to affect crop yields. And we can even think about, you know, where agriculture is particularly dependent on labor, outdoor labor, and the effect that heat's going to be on that. So we can start to pick up these hotspots. And here, for the mathematicians, this is a second differential graph. But this graph is basically saying that over time, underneath this, we know there's global warming. But secondly, the impact of global warming on the probability of food insecurity is actually increasing with warming. So we've got this sort of non-linear curve that says as we get warming, the impact on food security is even worse. And again, this is just another worrying trend. If we look on the next slide, I'm now going to just so that's just a global picture of how we can start to zero in on global hotspots. So now if we look at Ethiopia, and with time, and I say we, Dr. Dashgupta is the data expert here. With time, we can pretty much zero in on any country where, you know, we looked at Ethiopia because people in Ethiopia World Food Programme we were talking to, we said, you know, let's show you what we can do with the data, and then let's talk about on the ground. So what we're basically looking at in Ethiopia is a country long suffering from high levels of food insecurity, linked in part to domestic food shortages and famine. Food insecurity is always linked to other issues, not just agriculture and weather shocks. Of course, it's also on sort of stability as well. But agriculture is characterized by low input, low output, and combined with frequent drought. So we know this is a country that's going to be exposed to climate and weather. We have seen fantastic reductions in undernourishment from 47% to 13% from 2002 to 2016. And this is not unique to Ethiopia. Across the globe, after seeing fantastic reductions in poverty linked to reductions in food insecurity, in the last 3-4 years, we're starting to see an uptick in undernourishment across the globe, and possibly climate change is having some influence in that. And so, but again, you know, the good news story is, you know, reducing poverty really helps on so many indicators. There were 7.1 million Ethiopians receiving food emergency assistance in 2004. That fell to just over 1 million in 2008. So again, the message that Dr. Dashgupta was giving, that, you know, we keep giving is that, yes, reducing poverty matters, but everything's just made harder with climate change. On the next slide. So here is some of the data that we can produce for countries. So we've got subnational level data, and these are waves of collection of this FIS data, the Food Insecurity Index data. And so these are the kind of Questions that people are asked. Have you had to rely on less preferred food? Have you had to limit the variety of food eaten? So not just about the quantity of food, but the variety, the choice, and so starting to get at nutritional value as well, and the sort of micronutrients. And what we can see over time from wave 1 to wave 2 to wave 3 is that we can see sort of some improvements and then some worsening here in terms of limiting the variety. And we should be seeing these improvements, right? So with time and poverty reduction, we expect to see improvements. And so the attribution that's really important to us is saying, to what extent would these have been, improvements have been greater without climate change? And that's what we're always trying to get at, the attribution of climate change. If we look at the next slide, here's some of the other kind of FIES data. So are people limiting the portion size at mealtime? Are they going without eating for a whole day? So, this to some extent is one of the more dramatic. We're starting to talk about severe food insecurity at this stage. And clearly what we can see is it's relatively low, and it's definitely got better over time. So really positive indicators for a country that's reduced poverty quite rapidly. On the next slide. So one of the things we looked at, and this is where we're starting to go into the policy discussion, again from the data, so sort of big data to take us into that policy discussion. So what's better, cash or food assistance? And so we've looked at this in the literature, we've looked at this in data for many countries, and we've looked at this specifically for Ethiopia. And what we find for Ethiopia is cash assistance is actually better than food assistance. And as an economist, economists sort of tend to want cash assistance be better because we say, people should be given choices. And actually what we find is some people take that cash and they pay off their debts. They don't immediately buy food because they want to actually reduce their debts and put themselves on a level footing where they can then start to worry about their nutrition. And actually, if you're reducing your variety of food or reducing your meal size, that may not be as important as reducing your debts. So, you may actually choose a little more food insecurity for a little more cash insecurity. And that's about, who should be making that choice. And so, we can look at the secondary data and say in Ethiopia, cash seems to be better. But actually what we need to know is in the local areas, why is it better? And when is it better? When might foods be better? So designing and targeting safety nets needs far more than, looking at the secondary data that we're doing at the moment. So on the next slide. Just some of the sort of key summary findings. There's a lot of complicated econometrics and data analysis underneath this. We're going to spare you. Econometrics output, but climate and weather shocks are both affecting food insecurity. Increases in precipitation are reducing food insecurity. Again, that's not surprising. What we do find is households with savings and those that are able to store their harvest planning to sell it rather than consume tend to suffer less from food insecurity. Now, of course, it's the poorest and the most food insecure that are going to find it hardest to save money or to save grains. But actually what's interesting is where there are initiatives to help even the poorest save a little bit every month, it really has tremendous payoffs. And so I can't remember if this is the last slide or not, but if we go to the next slide. So just more specifically, I think some of our panel are going to talk about the PSNP. This is a safety net program that has transitioned moving towards more cash payments. And again, these specific cash transfers will be more effective. So safety nets are mitigating some of the adverse effects of weather shocks. And so programs to enable savings, even for the poorest, should improve food security. Okay, and the next slide, takes us to the panel discussion. So thank you. And we do actually have a proper 30 minutes, which we were hoping for the panel. So I've got my crib sheet here on the questions we're going to ask. So I'll introduce the panel members as they speak. I think that's probably easiest. And we're going to ask Dr. Ul Dada, representative from the FAO. Absolutely delighted to have you here. He is actually rushing off to, moderate another session? So we're going to ask him to speak first. And as we have 6 panel members, one is going to be on the video link. We're going to ask people to stick to about 3 minutes so everyone has time because we want to hear from everyone. So Dr. Ul Dada, you're going to give us some reflections on these linkages between climate change, health and communications, I believe. Thank you.
Well, thank you very much, and thank you for the opportunity to take part in this panel. Let me share with you some points on that interlinkages, and thank you for the presentation. They really set the scene very nicely about the facts and the nexus between climate change and health. The first thing I want to say is that looking at the big picture, obviously, our health in general depends on the health of the environment where we live and the health of ecosystems. And climate change and biodiversity loss are affecting these, obviously. So our health is really affected. And when we talk about climate change and greenhouse gas emissions, we also talk about air pollution that also affects health. So it's not just the impact on the climate, it's the impact on our health as well. And as you said, because that also affects the yields of crops, and obviously it affects nutrition, and it affects the availability and access to healthy diets. And looking at air pollutions in general associated with greenhouse gas emissions, and if we consider also indoor air pollution, we have the air pollution that affects around 7 million deaths around the world per year. So it's not just greenhouse gas emissions, but air pollution. So obviously the diversity of plants and animals and microbes in the environment are absolutely essential to our health. And as you said, climate change affects that. And picking up on the point you mentioned about poverty, now we know that climate change affects every part of the world. And those who are poor and most vulnerable, they're always the most affected. So obviously, poverty is increased by the impact of climate change. So the point on interlinkages, just to share with you a couple of things. I think really to look at this nexus of climate change and health, we have to look at two important things. First, which is the synergies between the various aspects that governments are dealing with and research organizations and others. Climate change, biodiversity, health, gender, ecosystem restoration, etc. And the second thing is trade-offs, because you can't just think about fixing one problem and then creating problems somewhere else. It has to be synergies and trade-offs with that. And this means that we really need this in terms of policies. You need to have really coordination and synergies between the various ministries working on agriculture, fisheries, forestry, environment, education, and other areas as well. And here I just want to highlight one initiative to finish with, excuse me, which is when we talk about the health of people, the health of the environment, and the health of animals. And you're probably aware of the One Health approach that is coordinated by FAO and the World Health Organization and the World Organization for Animal Health. So it's environment, people, and animals. And this is really critical, so you can look at the climate change, biodiversity loss, and health nexus in this kind of integrated approach. And education obviously help. We need to have this awareness in terms of people understanding these linkages between climate change and health is absolutely critical, particularly at school level as well. Because we're talking about our generation now, but these people, even by 2030, people who are 10, 11 years old now, they will be 20 by then. So they will be decision makers, they will make choices, and it's important really that we include that. And my last point is about also harnessing the power of innovation, also the local and indigenous knowledge as well in raising this awareness and understanding all these interlinkages in the environment where we live and how climate change, biodiversity loss, and others affect that. Thank you very much.
Oh, thank you. Those are fantastic words. Yeah, I think they deserve a round of applause. Tremendous. Thank you. And I think the point you make about these interlinkages, and then we have to recognize there are trade-offs, super important. I'm going to ask Professor Ros Cornforth next, a former colleague of mine, director of the Walker Institute at the University of Reading. And, oh, can you hear me even shouting? I'm going to ask Ros, to what extent do you think there's evidence of local level adaptation occurring? And I'm thinking particularly in the context of climate and food security by farmers in the Sahel. I know this is an area of expertise for you and something the Walker Institute's heavily involved in.
Well, thanks very much, Liz, and it's lovely to be here and to speak with everyone today. And this is such an important point, and I just really want to follow on the great points made so far. and particularly thinking about social protection systems, and in that discourse, adaptive social protection systems, because there is an enormous amount of work to do in terms of linking global understanding to local action, and which goes back to your question, Liz. People need to be at the center of this. We need to be actually move from the macro understanding to micro. And to be able to do that, we have to really put people and their risk at the forefront of it. We have to be able to understand context and the choices people need and want to make, which requires us, when it comes to adaptation and working with smallholder farmers, making sure that there are inclusive conversations that happen, and that the work that we do is driven from the context that people are in. So a lot of the work that we've been doing in terms of supporting the smallholder farmers in particular has been very much around quantifying climate impacts on livelihoods in the local space, to better understand the support systems that people reach towards in their daily lives. And so that requires, for us, we use household economy assessments and individual household methodology to really look at the detail. And at that point, we also need to be able to develop the tools and systems that work in those spaces, where you can combine quantitative information, but in a form that people can work with. And so, for example, we were working in Burkina Faso in the White Volta Basin, looking at groundwater issues, because actually, although we have these climate projections, there is a range of uncertainty around there, and there are adaptation options that people have and face based on the range of uncertainties. So in fact, we took the climate projections and actually, through instrumenting, looking at the catchments, working with the households, we're able to develop the groundwater storylines, 3 different storylines that actually cover the range of projections. But that's not enough, because that's the point when we need to work together to be able to understand, probe those storylines, and look at what are the adaptation options that people can take, want to make, and when those adaptation options will reach the end of their shelf life, and or whether those adaptation options will actually survive through a range of different futures. And that's the point where we can begin to connect the decisions that need to be made on the ground with the science at a larger level. So I will end there, but just to say, we really need to put people and their risk. What is my risk? What is your risk? What is our risk? Let's put that at the front of the science that we're doing and contextualize it so we can understand and better support the adaptation options that people want and can make in their spaces. And within that, what is the adaptive social protection system that we can support, which Liz was reflecting on. I'll finish there.
Oh, it's fantastic, Rose. I think that word risk is just absolutely central. If that's from everything you said, I'm just going to remind myself that you know, it's incredibly important. I think for academics, for us doing research, you know, asking ourselves, you know, how do we understand risk and incorporate risk is really important. I'm now going to ask Danielle Neurenberg, president and co-founder of the Food Tank. I'm so delighted to have Danielle here because I've been reading your work and following you for so long, and it's just lovely to have you on this panel. So I was wondering if you could just talk to us maybe a little bit about how climate change is affecting and harming the nutritional quality of food in sub-Saharan Africa. And if you want to talk about solutions if the solutions are available or just what's needed, that'd be fantastic.
First of all, thank you. It's such an honor to be here, and thanks for following Food Tank. That means a lot to me. If I may, I'd like to answer a different question first that I heard coming up. You know, we talk a lot about the risk that's affecting people. We talked a lot about children. What we didn't talk about is that climate change and poverty are inherently sexist, and women and children are affected by everything we're talking about more than men, and we really need to respond and address that. And so I think we alluded to it, but I think it needs to be said that women and girl children especially eat least and last, and by climate change and poverty affect them more. And there's certainly so many solutions to that problem and the climate change or the climate crisis that we're facing now. And I think all of these things have already been brought up. Diversification is really key. We need a greater variety of crops. We need to talk about less maybe about food insecurity and more about nutrition insecurity, because we're not investing in a diverse set of crops that are culturally appropriate and that people want to grow, that they're used to growing. We need to put more of an emphasis on indigenous practices, but also indigenous foods, because people, those are foods that have often been looked down upon or called poor people's foods, but they're the foods of the future in so many ways. They're resilient to the impacts of climate change, whether it's flooding or pests or disease. And so I think there are a range of things we can talk about when we're talking about sub-Saharan Africa. In terms of what's happening on the continent, we see sort of this vicious cycle of conflict and food insecurity, but those are both things that are affected by the climate crisis, and they exacerbate one another. And so we have ancient soils in Africa that are depleted, right? And then you have these unsustainable policies that are focusing on fertilizers that are not helping build organic matter in soil. They're actually continuing to deplete it. So we need better policies that really focus on culturally appropriate technologies, culturally appropriate practices, again, lifting up that indigenous and traditional knowledge so that these solutions, these practices are community-led, that they come from farmers themselves and that they come from women themselves. I will end there. I'm sorry I talked so much. Thank you.
No, that was fabulous. And I think it's really important to point out that gender differential, because we had a slide that showed gender differences weren't that great because it's at the sort of aggregated macro level. But I think it's when you're talking about these sort of more subtle differences, and especially nutritional value, who's eating first, who gets the choice, that may not be picked up in the data. So I think that was tremendously helpful. I'm gonna ask Mr. Osei Odrago, our party representative from Burkina Faso, and the host of myself and Dr. Dashgupta, to talk a little bit about what are the most, from your perspective, what are the most pressing concerns, in terms of climate change and health in Burkina Faso? So we do have a representative from the country party representative. Welcome. And I know that English is probably your third or fourth language, so we appreciate you doing this without translation as well. Thank you.
Thank you very much. I'm trying to speak in English, so if it is difficult, I will speaking in French. I would like to talk about Burkina Faso is one of the country where dryness is increased. And when we saw the dryness and the impact of this phenomenon is to reduce the land, the crop production land. And also the impact of the dryness is the variation of the temperature. So where the time of crop season will reduce to 4 months to 3 months. So we have the impact of the productivity. Also, the link of the climate change and the child health is the variation of the temperature. Also, poverty, socioeconomic situation. In Burkina Faso, it's difficult. The different health centers is not an accommodation, the real accommodation, such as the pediatric centers is a little, but a small scale. So we had the child health mortality is increased. So during the April, May, June, even March, it's difficult. Why? Because the temperature is grow, and our scale, pediatric scale, is a little bit. So the mortality is increased. I would like to talk the two pressure is during the dry season is difficult, and during the rain season is difficult because we haven't adapted seed to have a big productivity. So I would like to talk about these two things. It's the link with the health in Burkina Faso.
These are great words, and merci beaucoup. That's the sum total of my French, I think. But I think it's really interesting. If ever there's a hot spot of really difficult situations, I think Burkina Faso is an example of one, and I think you articulated that so nicely. And I feel we talked in the Bangladesh pavilion yesterday, and improved varieties, and we still need the plant breeders who've been breeding for decades and decades, and it might not be the hottest topic in climate change discussion, but actually breeding for the kind of varieties that can deal with these increases in heat is still absolutely critical. I'm an agricultural economist, the least hot type of economist, with the uncool ones. But I think everyone's talking agriculture these days, so maybe our time has come. That was awesome. Thank you so much. I'm now going to ask Jane Wilkinson. We haven't met before until today, but I'm delighted we have because I've heard a lot about you. Jane is with Abd Associates, and we're both actually based in London now, aren't we? Which is lovely. And so it's really great to have someone not in the sort of government or sort of non-profit or academia. So it'd be really nice to know how climate change is making it harder basically for organizations such as yours to do what you want to do, which is to improve health outcomes in lower income countries.
Well, first of all, thank you so much for inviting me to this panel. It's so great to be sitting amongst such distinguished people, and I agree with pretty much everything that's been said. And thank you for raising the gender issue on Gender Day. I guess one of the things that's really struck me here has been that there's been a lot of talk about climate smart healthcare. And I think what we're talking about here today is really making health positive climate action. And I think that's a really key point. As far as Apt Associates is concerned, we often find ourselves at the country level end of developing actions that really implement large donor pots of money. And I think what Dr. Udada actually said at the beginning with the synergies, the importance to actually identify the synergies and trade-offs is super important. We need data on the ground. It needs to be context driven and local. So we can't be working from this level. We have to be working at the country level and need to understand what that evidence is showing us and how that actually makes vulnerability visible to policymakers. And it will be different in every situation. I think the focus on vulnerability for us is super important because, as Shura said in his presentation, there's all sorts of demographics that are indicators of vulnerability, and they're not the same in each place either. And so I think it's really interesting the point that you were bringing in around the fact that cash might work better in some places than food. And I think that actually when we're thinking about integrating large activities where we're involving perhaps different mixes of finance, one of the things that we need to be thinking about is what is the vulnerability that we're addressing? Is it hunger or is it something more than hunger? And actually if the cash to actually set up a small business, for example, is going to deliver long-term security and livelihoods, then actually that's a better way to go. Just one quick example, it comes from Egypt, where we actually helped 40,000 smallholder farmers, of whom many were women, basically become climate smart in their small agricultural plantations by helping them access climate finance from banks. That's the essential, that's cash at the end of the day, and it made them more food secure and more able to actually develop other businesses as well. I think the point that was made around adaptive programming is also extremely important because things change, and particularly with the point of impacts amplifying as the temperature warms, we're going to have to adapt all of our programming eventually. And finally, I'd just like to emphasize the importance that emergency food aid is becoming more and more of a norm. And so this is going to stress the whole system. If what we're moving from is essentially humanitarian aid once a year to humanitarian aid constantly with, incredible surges at times, it's actually going to stress the whole system. And so we need to be thinking about that as well and how we can integrate that into capacity, education, community awareness programs, basically just making sure that we're doing a systemic response. I'll leave it there, thanks.
Really excellent, thank you. And the last point you made is really interesting, isn't it? When this sort of emergency humanitarian aid suddenly becomes the norm, and it normalizes, we should be really worried, and this is at 1.1, degrees of warming, and this is when, we've seen the massive poverty reductions, and yet, we suddenly find ourselves stalling on actually those human indicators. So I think that's another take-home point I'll take with me. And thank you. I don't know if Daniela knows that I'm looking at her just now, but we have with us Daniela Shiriak from the Climate Policy Initiative. Thank you so much for hybridizing this event. I do think we have people watching in hybridized, but we're actually hybridized presenting, which is the future. So thank you so much, Daniela, for joining us from Climate Policy Initiative. And we were hoping that you might talk to us a little about some specific examples of where climate finance can contribute to improve resilience, food security, and health outcomes. And I've got some of my colleagues, or maybe they've had to run off, but some of my colleagues from Grantham Research Institute have taught me all about climate finance. But I would like to hear from you, because I haven't really heard a lot about it in the context of food security and resilience. So I'm really looking forward to hearing your words. Thank you.
Good morning. Thank you so much. Thanks for inviting us, and also it's a great pleasure to be on this panel. Maybe I'll start by quickly giving an introduction on how we do and how we work on climate finance. And I think that everything that's been said until now, it's our great insights into everything, into the topics. But yeah, the perspective I'm bringing is climate finance, and especially maybe with an emphasis on how can we involve the private sector into that. So one of our flagship programs at the Climate Policy Initiative is the Global Innovation Lab for Climate Finance, which is a public-private initiative with more than 60 members, including governments, development finance institutions, and commercial banks. And the goal at the lab is to help drive private sector investments towards climate adaptation and mitigation in developing countries. And the way we do that is by identifying, developing, and then launching sustainable finance solutions. So I will quickly go through two examples of those. The first one is the Smallholder Resilience Fund, which is an investment fund that was brought to the lab by One Acre Fund. As everybody has stressed already until now, many smallholders in Africa are reliant on stable crops. And with the increased occurrence of droughts and floods, the yields of those crops are expected to be negatively affected, and therefore the income of farmers as well. So the objective of the fund is to deploy synchronized investments and technical assistance across entire agricultural value chains, and to help farmers to kind of shift towards high-value, climate-smart tree crops like avocados. So the farmers receive high-quality inputs and guidance on how to go towards that shift towards climate-smart crops, which is expected to help them achieve higher incomes and thus greater climate resilience. At the same time, the agribusinesses working with those farmers, and that can include processors, exporters, transporters, they receive capital and also technical assistance to help them develop their businesses. The synchronized approach is not only aiming to address linkage failures that exist already between the farmers and markets, but it also tries to ensure that value chain businesses provide high quality processing, storage, transport facilities that help to reduce post-harvest food losses and thus contribute to food security. And a second example is the blockchain climate risk crop insurance that was proposed to the lab by a group of 3 organizations: Risk, Acre Africa, and Sprout Insure. And it is a digital platform for standardized crop insurance for smallholder farmers in Africa. The insurance is indexed to local weather, which means that farmers are entitled to payouts in case an extreme weather event happens. And that is, again, droughts and floods mainly. The use of the blockchain technologies means that insurance policies are automatically triggered when an extreme weather event happens. And this in turn enable more transparent, faster, and fair payouts to the farmers. And that compared to traditional index-based insurance, this system leads to reduced costs, and it increases the trust for farmers to take up this insurance product. And this is really important because in developing countries, only 20% of smallholder farmers have access to agriculture insurance. And in sub-Saharan Africa, this is even lower, to even 3%. So yeah, with this, I'll conclude my presentation here, but yeah, happy to discuss further on any of these two examples. Thank you so much.
Thank you, Daniel. I think it's fascinating, isn't it, that another discussion about the fact that we have to have these integrated approaches, and that, as someone also told me yesterday, climate finance is just the start. Implementing climate finance is really complicated. And when you have something like a complicated food system, which any food system is in value chains, it's not easy. And again, it needs detailed local knowledge, which I think has come out a lot. I think we've got 2 minutes. Shora, do you want to just see if there's any questions? There may not be time for answers, but we'd love to hear the questions. Any questions from the audience? Like I say, time for questions, not answers. But I often like to just get a lot of questions because we don't have. There's not time for everyone to answer. Oh, awesome!
Hi, I'm Nicola. I'm from Boston College. I just had a question about when we're talking about climate smart crops. How do you sort of balance that with these like culturally appropriate crops? So things that communities are used to growing and used to eating. How do you sort of balance climate smart and culturally appropriate in terms of like growing resilient crops?
We have time for an answer. Who can answer?
Thanks. So I think actually that goes back to the point around putting people at the front and center, and I think actually it also goes to a point I was quite keen to make in terms of the women because there's such an import to decentralize going down to the point of data collection as well. And one of the most powerful ways to bring people into the equation is to value that local expertise and local knowledge. There's part of that integrated system, of course, is building capacity to enable people to be part of that process and to be the local experts. But it also requires us to think somewhat differently about the methodological frameworks that we use. So something we've been doing at the Walker Institute is to use storylines to propagate them through something called a causal network, which enables you to look at what combinations of drivers lead to a perfect storm in a particular system. And the value of this network is that it means you can bring in quantitative information at the granular level, disaggregated by gender. You can bring in together the climate information at the global level, and you can bring in the qualitative contextual information. And having a framework which you can do that, and you can actually then begin to go, well, in your space, with your risk, what is the best approach? What are the what ifs? Let's look at the what ifs based against the information we know. But that also means that we're bringing in that important information, the cultural elements as well. They can be brought in a scientific framework as well, which enables us to begin to look at the options, the appropriate options. So it's all decentralizing and going back to what Schumacher talked about, small intermediate technologies which are appropriate and inclusive and affordable.
That's awesome. Does anyone else want to just have a last word? Otherwise, I think we've had our lot. Oh, yeah. Let's have a quick question here or comment.
I just wanted to know where we can get that information from.
The local information.
Oh, sorry.
The framework that you've just talked about.
You can see me afterwards, and I'll tell you all about it. There's actually a paper out as well, which is looking at food security in Namibia using this actual framework. But happy to talk to you afterwards.
So thank you so much to our fabulous panel for taking the time out. Oh, sorry. Yes, we'll have another comment. Sorry. Yeah. Thank you.
Thank you. I have to add something. In Burkina Faso, talking about your question, Um, I, we would like to develop the seed, adapted seed, in order to build the capacity of the producer and to have a large productivity, because we are the time of the crop season is very short. So we have to develop adapted seed in order to have productivity to grow, to increase. Thanks.
Thank you. I think it's really important to remember that the fundamentals of the science linked to the sort of social science institutions governance, we need all of them, yeah. So thank you. Yeah, thank you so much to our fabulous panel. I know everyone's so busy. We really appreciate your time, taking time out of your schedules. And thank you for all of you who came and joined this. We really appreciate that too. So thank you so much.
Yes, and I'm looking at the WhatsApp. I believe Seneca should be connecting with Jennifer's connection, right, for all of the folks who are in person. Jennifer, can you confirm audio is working from Glasgow?
Only when they start, it seems.
Okay.
So when we start.
Okay. Okay, actually she's typing in the chat box. Beautiful. Okay. So oh, there's a delay.
Let me know.
Just a moment, Cleo. So the princess is trying to connect again. Maybe we give her. Oh, they're waiting for one speaker. I think they're waiting for Lagi.
Yes, I agree.
And so hopefully if he comes, he can, put on a headset quickly. And I'm just looking quickly here. The princess has come off again.
Can you hear me? You can hear me, right? You need your headset. So hello, good morning. Welcome to this side event at the COP Health Pavilion. My name is... Can I start? Excellent. Thank you so much. I was about to tell my name. My name is Tineke Unema, and I am the Executive Secretary of UN Nutrition. I hope you can hear me very well. We also have our guests online who hopefully can also hear me very well. Maybe just 2 words about UN Nutrition. UN Nutrition is a coordination mechanism in the UN system, and we work towards policy coherence in and across the UN system, and not just the policy coherence, but also the consistent and coordinated actions at country level. So that's UN Nutrition. We are organizing this event together, as you can see on the screen, with our members, World Health Organization, World Food Programme, and then also the Swiss government, and with support of the Sustainable Food System Program. We will have speakers from these people as well. So today we are here at the COP because we, as UN Nutrition and our members, we really want to put nutrition central to the climate negotiations. And why? Why? Because we see those crucial links between nutrition, healthy diets, food systems, and climate change. They impact each other, and that's what we need to see, and that's what we need to bring to the negotiators and to the negotiations. So that's why we are here, and we have a very good keynote speaker, Dr. Jessica Fanzo from Bloomberg University in the US, who will speak to us online. And then she will be followed by a distinguished panel with change makers from all across the world. Guyana, Costa Rica, Switzerland, and Fiji. I just want to share just one personal note with you as well. I'm very pleased to be here and see that there's a lot of movement around healthy diets and nutrition in this COP. And that's new. It was there so marginally, and now we are really making that push. So I hope this event is also helping us to make that push towards putting nutrition central to the climate negotiations. So without further ado, I'd like to welcome Dr. Jessica Fanzo to deliver her keynote address about healthy diets, dietary trends, and climate change. Jess, the floor is yours.
Great, thank you so much, Stineke, and to UN Nutrition for having me as part of this really important event. It's so great to have nutrition and diets as part of the COP meeting. I'm going to share my screen, and please let me know if there's issues with that. Good. So again, my name is Jess Fanzo. I'm at Johns Hopkins University. And I'm going to talk about eating in the Anthropocene. Can we mitigate climate change through food systems? So I think many of you know that food systems are both victims and instigators of climate change. We are in the middle of catastrophic climate breakdown when we look across greenhouse gas emissions, all Earth systems, be it deforestation, biodiversity collapse, ocean acidification. All of these indicators, as you can see from this graph, are going in the wrong direction. And much of that has to do with human behavior and the influence of humans on all of these Earth system processes. And we see that population pressure, our fertilizer consumption, our water use, transportation, telecommunications, everything that we are doing is significantly influencing the climate and the Earth as we know it. Climate change is projected to have a significant impact on crop yields. This is showing you in a 3-degree warmer world. Let's hope we never get to that. We see in many parts of the world, shown in red, declines in crop yields. But we also see declines in the nutritional quality of crops. Models suggest in a CO2 fertilization type atmosphere where we've got a lot of greenhouse gases in the atmosphere, we'll see declines in nutrients like protein, iron, and zinc, with many parts of sub-Saharan Africa and South Asia significantly affected across a variety of crops. And of course, these are populations that already are struggling to meet their nutritional needs. At the same time, food systems are contributing to greenhouse gas emissions, not only in the way we produce food, but land use change, and of course, the entire value chain and supply chains that are emitting emissions. It's not only livestock, it's emissions coming from fertilizer application, from rice, from manure and pasture management. It's a whole range of issues in which food systems are generating approximately 30% of total greenhouse gas emissions. There's also detriments of food systems on certain environmental indicators like fresh water resources, biodiversity loss, collapsing of fish stocks. So we're seeing significant impacts of the food system, not only on greenhouse gas emissions, but these finite natural resources that are so critical to grow food. And so what does this mean for food security, diets, and nutrition? When we look at different climate change scenarios, and if you could just focus on the red as a business as usual scenario, some models suggest that we would see an increased number of people who are hungry, as well as less calories in the food supply in a business as usual effect, which makes sense with the data I just showed you. So climate change is and will continue to be a threat to food security and ensuring that people get enough calories in their diet. We'll also be dealing with more significant malnutrition burdens. We already are grappling with huge burdens of malnutrition, be it undernutrition with 811 million people undernourished, about 20% of the world's children under the age of 5 being chronically undernourished or stunted, and a significant growing burden of overweight and obesity, with many countries in this map shown in the darker color red, double, triple burdens of malnutrition. So we're not making progress on malnutrition, not much. Obesity is growing, and many countries are grappling now with multiple burdens of malnutrition at the same time, many being low and middle income countries. One outcome of the food systems, of course, is healthy diets, as Stineke had mentioned, but our diets are contributing significantly to disease and death. So what is meant to nourish us is creating significant disease and mortality in many populations, with dietary risks being one of the top risk factors of disease and death. And this are diets high in sodium, sugar, unhealthy fats, and low in fruits and vegetables, legumes, nuts, and seeds. So this pattern of unhealthy diets is going in the wrong direction. And we know that in addition to not only the unhealthy, unsustainable diets that we're seeing growing around the world, we're seeing significant inequities with 3 billion people who cannot afford what is considered a healthy diet, one that meets nutrient needs and is protective of health. And again, you see many parts of the global south being significantly impacted with deepening inequities around the world. And to make changes, we know that some countries need to do more. Look at the United States' consumption of animal source foods compared to places like Cambodia, Senegal, and Ethiopia. So some countries need to make bigger changes to their diets, not only to promote their own health, but to also protect the planet for everyone. So the inequities are significant, and some need to make bigger changes than others. So how do we begin to transform our food systems? And I only have 12 minutes, and this could be a whole semester of teaching at Johns Hopkins. But one large message is that we need to take a business unusual approach if we want to achieve the Paris climate targets. We need to increase yields of foods. As I showed earlier, climate change will significantly threaten yields. We need to cut food waste in half. We need to grow healthier calories. We need to reorient the agriculture system to not just grow staples and sugar and oil, but to grow more healthy foods. Better sustainable farm practices, got a lot of technology to do that now in hand. And we need to consume more plant-rich diets. We need to do all of this if we want to stay below 1.5. If we only address the energy and transportation sectors, we will not achieve the Paris target agreement. We have to fix food systems, and we have to do multiple things across the food system. We need to harness the political momentum that we have, and we need to make these moments meaningful. We're in COP. We just had the UN Food Systems Summit. We're in the middle of the Sustainable Development Goals, but quickly losing time. We've got 9 years left. We got the Convention of Biological Diversity, the UN Decade of Action on Nutrition, the International Year of Fruits and Vegetables, the Decade of Family Farming. We have all of these important political moments, but we need to capture those and ensure that we do live up to the promises that we've made. We need to use evidence and data to help policymakers make informed decisions. Here at Hopkins, with partners like the Global Alliance for Improved Nutrition and FAO, we've developed two big initiatives. One's the Food Systems Dashboard, which pulls together a lot of different data across food systems in very visually appealing ways to help decision makers understand what is happening in their food systems and how they're performing. We've also initiated something called the Food Systems Countdown Initiative that will assess and monitor the performance of food system transformation over the next 9 years towards the SDG goals. So look out for those, and we hope that these inform decision making. The fourth thing we need to do is consider people. People are eating every day. They're moving in and out of the food system, making decisions. Much of the foods that are available for the world are these ultra-processed foods that are quite detrimental for health. This is what's killing the world. These foods are cheap, they're tasty, and they're convenient. And you see a significant growth in these ultra-processed foods and beverages around the world. And how do we shift, though? If healthy diets are unaffordable, what can we do to ensure that people can get access to healthy foods? Will everyone be growing lab-grown meat? Will everyone want to eat insects? What is ethically permissible, acceptable, and affordable for the world to consume a healthy diet? That is the big question that we need to grapple with and understand. What do people want, and what can they afford in these critical times of significant economic downturn? We also need to learn from COVID. Boy, does COVID have some lessons for us across the food system. We know that shocks to other systems, like the health system, with COVID, had significant impacts on every other system: education, food, the economic system. These systems interact, and we need to understand those interactions and try to ensure that we stave off shocks and make these systems more resilient. Other things like protecting and supporting food system workers, ensuring they're vaccinated, ensuring they have masks, ensuring that the facilities where they work are protective for their own health. They're undervalued, and we need to value the workers that are working to deliver and produce our food every day. We need to also think about a One Health approach, bringing in social protection programs for those who can't afford diets, stabilizing trade, ensuring that trade remains open and flowing. These were all big lessons to learn from COVID, and it's an opportunity to now work together at national and supranational levels and really build a more resilient food system. The other issue is dealing with elephants in the room. In the food system world, we have many challenges around politics, around power imbalances, around considering the right to food. Many of these played out in the UN Food Systems Summit. If we really want to address food systems, improve diets and nutrition, We need to deal with some of these vexing underlying political problems that the food system faces. If we ignore it, we'll forever be caught in a loop, a loop where we can't really make significant progress, particularly for those who have no voice, who are purposefully disadvantaged and marginalized. We really need to start tackling these issues head on and creating a better governing system to do this. And I'll end there. I look forward to the discussion. Thank you so much.
Thank you so much, Jess, and thank you for getting up early for us. And thank you for your wake-up call. I mean, you were so powerful in just stating the urgency of the climate crisis and at the same time, the urgency of the malnutrition crisis, all forms of malnutrition and how they are interlinked and what we need to do. And we know what to do. And the political momentum is there. You mentioned it very clearly. So yeah, let's do something. So let's go to our panel. Maybe you can join me. We will have, as I mentioned in my introduction words, a few people who are online speaking with us and then also with me here in the room. And I'm so happy that we had Jess Fanso introducing the topic and that we can now go to listen to the practical examples of actual change makers, of countries who are already doing it. So let's go to you. Ms. Carla Mena Soto from Costa Rica, from the Agriculture Extension and Climate Negotiations team. Tell me something about Costa Rica. How is Costa Rica promoting sustainable healthy diets to improve nutrition and climate change, helping to conserve its beautiful environment? The floor is yours. Sure.
Maybe can I?
Yes, please.
Good morning. First of all, thank you very much for that invitation and to have this great opportunity to share the first steps that we are doing on it. Thank you very much for the keynote speaker presentation. It was great. It's really the tremendous challenge that we have. Like Costa Rican Ministry of Agriculture and Negotiation in agriculture, I would like to tell you that agricultural sector in Costa Rica during many years are working together in the line of sustainable food system. We are in the line on it because we consider the challenge and the opportunities that we have, not only in climate change, just to have just GHG emissions or GHG inventory. We believe in the environmental, social, and environment and economic impacts if we want to develop our sustainable food system, because it's so important to take care of the natural resources. The food comes from the natural resources, from the soil, from the earth, from the water, you know? I don't know if you remember, when I was in my school, my teacher said that water is forever, soil is forever, and now no. You know, this is really, really important to take because it's the baseline to food to produce. So in my country, in the public sector, we are making a really nice engagement with other ministries, agricultural, health, commerce, cultural, and education ministries, that we are working together to have our sustainable food system, but like guidelines. We in the last year, when COVID-19 started, we start to communicate our first food-based dietary guidelines. That guidelines, especially for when we are going to organize our different type of people, especially kids, of course, young people, and the women are in lactating period. First of all, we are working on it with kids, in order to teach them where comes the food and how they can replace salty food or fat food, fresh and vegetable fruits, because you know we are tropical country, we have many fruits and many vegetables, so how to teach them, you know, It's not from the supermarket, come from the land, come from the farm. So we start like that, with that guidelines. So for us, it's very important to have these food dietary guidelines like an instrument to start to contribute to guarantee to the population to obtain healthy and sustainable diet to start. So something really important to say also from the agriculture minister, we are working also to have mitigation and adaptation actions in 5 of our most important activities in the agriculture. Rice, we eat a lot of rice. Sugarcane, bananas, we love bananas, and I think the whole world loves bananas too. Livestock, and coffee. We love coffee too. For us, this is a very important crops in our economic and social development. And why not in food production? Why not in agriculture? So we start our NAMAs. NAMAs, I don't know if you know about it, but NAMAs are mitigation actions in order to count the GHG emissions. But our approach is in integrated system: soil, water, sustainable way to plant, to crop, to have our land in a sustainable action with the producers, because we need to work with the producers in order to, for example, reduce fertilizers or apply good practices. That is so important for us in order to be engaged with to produce food in the sustainable way. That is a big example that I want to share with you this morning.
Thank you. Thank you so much. That was so lively. And yes, I do like bananas, by the way, like everyone else, as you said. But I really liked how you put things in a multi-sectoral perspective, and how you mentioned that the food system and how you work across the food system for better nutrition. But I even more liked it how you connected back to people, to consumers, to people who need to be informed also what is appropriate, what is cultural acceptable through food-based dietary guidelines. That's such a powerful tool, especially when you link it with sustainability criteria. That really informs you what's healthy and good for the planet at the same time. So really, really good and interesting points you made. And also linking back so nicely with what Jess Fansa just mentioned online. So great, thanks a lot. I'm looking forward to hear from our next speaker, who will be joining us from Switzerland and is online with us, Mr. Patrick Mink, who is the Senior Policy Officer of the Federal Office of Agriculture in Switzerland. Patrick, I hope you're online, and I hope you can give us a glimpse of Switzerland's food systems national pathway and how it is fundamental for climate change. Patrick, the floor is yours.
Yes, hello, Stineke. Thank you very much. Thank you very much, Stineke, dear excellencies and colleagues. Switzerland was one of the countries that, in preparation of the recent UN Food Systems Summit, submitted a national pathway for food systems transformation in support of the 2030 agenda. This pathway or roadmap aims to address the entire food value chain and beyond, from production to consumption, through a holistic approach. It contains an action plan and 4 measurable goals to be reached in 2030, directly linking nutrition, health, environment, agriculture, and climate. These are: 1, increase to 1/3 the proportion of the Swiss population consuming a healthy and sustainable diet in line with our nutrition recommendations. 2, halve avoidable food losses. 3, decrease the carbon footprint from consumption by 1/4 compared to 2020. And 4, increase the proportion of farms engaged in especially environment and animal-friendly production by 1/3. With about 7.3 million tons of CO2 equivalent, agriculture currently accounts for about 16% of total greenhouse gases generated in Switzerland. However, the figure for food consumed in Switzerland more than doubles to almost 15 million tons of CO2 equivalent, in particular due to food imports. So we have to take into account the entire system and also imports, not only what's produced. If Switzerland's entire population were to follow the nutrition recommendations of our food pyramid, our greenhouse gas footprint could be more than halved, while promoting people's health. And if food waste at consumption stage could be reduced to zero, a total reduction of 2/3 could be possible. This is why the draft food and agriculture climate strategy that is currently being developed is one of the measures supporting our national pathway for food systems transformation, aims for long-term targets by 2050, namely reducing the carbon footprint from food by 2/3 compared to 2020, while reducing emissions from agriculture by 40% compared to 1990. To sum up, Stineke, sustainable food systems should be promoted as an essential solution to climate change, and promoting healthier and more sustainable diets can make a major contribution towards net zero carbon. Switzerland is therefore committed to embed nutrition and food systems in the UNFCCC negotiations. Thank you, and back to you.
Thank you very much, Patrick. Again, a beautiful example of Switzerland and how you again place food systems and the outcome of food systems, good nutrition central, stating that if people would follow the Swiss population, but also other people would follow the recommendations for a healthy diet, greenhouse gas emissions would drop dramatically. And in addition, lives would be saved. So yet another very powerful example. I'd like to go to our next speaker, who is also online and who is speaking to us from Guyana, Dr. Leslie Ramsamy, who is advisor to the Minister of Health in Guyana. And I'd like to know, Ministry of Health, but why has climate change become part of the Ministry of Health core work? Dr. Ramsamy, the floor is yours.
Thank you very much. Why climate change is important to Guyana? One, because we can help globally, because we have large rainforests and carbon credits. But two, in a report last week, 9 cities were reported as in danger that by 2030, between 2030 and 2050, they could be underwater. I am sitting and reporting and talking to you from one of those cities. We are a city and a country below sea level, and we are already impacted. In the last decade or so, we have suffered from massive floods, from droughts. We see climate change as something real. And so when we look at the 2 recent Lancet Commission's report that identify climate change as the biggest global health threat we have, we know, we experience it. We consider 4 governance issues, not just for our government, but for governments around the world, that must become part of the nationally determined contribution as part of the Paris Agreement. First, there must be aggressive cross-sector collaboration under a One Health agenda umbrella, which mandates health in all policies, regardless of which sector those policies emanate from. And in that respect, Guyana is about to launch its national One Health coordinating commission. Second, there is an absolute need for vertical coordination of this effort. And ministries of health must take ownership of that. In the early 1990s, with the existential threat of HIV and AIDS, globally we established UNAIDS. Nationally, we established National AIDS Program. The time is now for a dedicated, committed program to address health adaptation because of climate change. And ministries of health must be in charge of that. As part of Guyana's low carbon development strategy, there has to be, we have a planning unit to address across sector the many adaptations for climate change. And health is playing a leading role in that planning unit. And we recognize that research is not only from the developed countries and northern research flowing down to the south, but there must be a rich array of research, climate related research in developing countries. And therefore, we must build that capacity through our university here. We're trying to build that capacity. Now, whilst I can go through all of the health issues that we face and what we are doing, I think there are two health issues that are worthy of special mention. First, I would strongly posit there is no health without good nutrition. And for this reason, we have uh, we need nationally mandated dietary guidelines. Guyana has had these guidelines, but I believe globally we need to adopt these guidelines and to create more options, for example, for blue food, for example, blue food options. Dr. Fonso has very eloquently gave us all the ways that the world food system has failed us. So I don't want to go in. The world food system needs to be transformed, and we in Guyana are trying to address this issue. Dr. Fonso went into a number of things. I want to just highlight something. Guyana is trying to look at food wastage, spoiling of food, wasting of food. 30% of food around the world and in Guyana also are wasted. We have to have better systems to preserve our food. Um, the intellectual property rights driven inequity affect the world food system. Better technology, better seeds, for example. Um, we are trying to work with our Caribbean colleagues in front of the package labeling. Um, Globally, we have had a decade of Fonzo. I hope one day you would address issues like those. At Codex Alimentarius, for example, we sometimes feel that they represent more corporate interests than citizens' rights. So we have dominant uh, um, domination in our supermarkets and so of highly processed food, salt, sugar, trans fat. In the meanwhile, 33% of our soil are today regarded around the world as degraded, and another 33% at risk. Same thing with fishing grounds. I think some 30% of fishing grounds are now overfished, and another 30% on the threat. The second noteworthy health outcome impacted by climate change that I would like um, to highlight, and in that respect, as we are speaking with Columbia University, the WHO, etc., we are addressing this issue in Guyana, and that is mental health. And while climate change can worsen mental illness and mental disorders, we have neglected that climate change has severe impacts on mental wellness, emotional resilience, and psychosocial well being. We must stop the historical neglect of mental health. Ghana is trying to address this issue as we speak. So I think I will stop there for the moment. And those are the reasons why climate change is so critical in terms of our national policy.
Thank you so much, Dr. Leslie Ramsamy, and also again for allowing us an insight in the urgency of your particular country already suffering so much from climate change and serious floodings. And then again, I'd like to thank you as well for mentioning again this important tool of food-based dietary guidelines that can really make a difference for producers, consumers, and policymakers working across sectors in order to transform food systems towards more sustainable ones, and also to deliver more healthy diets. Very, very good examples. I'd like to check if there's any questions for now in the audience or online. Otherwise, I do have a follow-up question for some of the panelists. I'm just checking. You can wave your hand, or if online, I'm sure my team will get those questions to me. If not, then while people are thinking about their questions, I'd like to ask you a follow-up question, but any other of the panelists online, please. Carla, could you please tell me how Costa Rica is placing nutrition at the heart of the UNFCCC negotiations? I mean, we have all heard about the importance of it, and it's kind of inside, outside the negotiations, but what to do to get it really inside?
This is a really great question. So maybe food-based dietary guidelines and Danama's action and this institutional coordination in a small country in the world like my country is the first steps. We believe to be in that negotiations because Coronivia believe or is in the way in that line. I would like to tell you with the evidence, because sometimes when we do talk about agriculture, maybe you think we are not included, but we already included since when we start in Coronivia. Coronivia is the group like agriculture, we call like that. But for example, during the last days, we were discussing many topics, like I told you, uh, uh, crops like coffees or soils, livestock is so important because it's part of the diet of many countries. And so one of our main concern is how to address, just to produce in the sustainable way through the chain of value to the consumption. And in agriculture, our Coronivia is so engaged, and we are so engaged with what that we recognize the importance to scaling up. It's not to do it, it's to scale, because we eat every day. We eat the food that you have in the supermarket. So, but we need to scale in order to know what exactly you are eating. What exactly is the importance of the healthy diet depend of the age you are. This is so important. So in our conclusions, I would like to read just really fast in order you can I can evidence the importance of scaling up support to enhance action on safeguarding food and nutrition security and ending hunger, aiming for inclusive, sustainable, and climate-resilient agriculture systems, taking into consideration to the vulnerability of agriculture in the climate change. We recognize the need to improve food security, to mobilize resources to implement action at the local and international level. So we are engaged on it. So in Coronivia, we talk about agricultural techniques aspects, but we include, of course, food nutrition. At the end, this is a baseline. For that reason, Costa Rica is part of that group. We believe on it. And also, like Costa Rica, we are in the similar line in order to re-educate our consumers, our consumption market, in order to obtain maybe in the future incentives. That is so important, because it's not that rice, that banana, that milk from sustainable way to produce and another kind to produce. So we are in the way on it.
Thank you for doing that. Thank you for promoting this important topic within Coronavia. But how do you think your actions are being regarded? What is the response from other countries in the room, if you can share that with us?
Yes, well, like we are more than 100 countries over there. And this kind of conclusion is not Costa Rica conclusions. We are agree with this, with all of these topics here in that paper. It's not just Costa Rica. This is Coronivia. And Coronivia is leading by G77 and China. Our chair is, this is ANSAFSTA and SBI in the negotiations. We recognize this and they accept it. So we made that welcome to the report in order to enhance in our national level. So it's difficult because to implement many things that we discuss in that room, the most important thing that I told you in the last sentences is how to implement, because it's urgent. We need to implement. So yesterday I was in a side event about unlock the climate finance in order to work in food nutrition, in order to work in adaptation, because we need to change the way of work. So we are thinking on it. And the most important thing, we are going to implement, and it's urgent to implement resources in the way of not only livestock, soil, and water, also food nutrition and socioeconomic situation to our society.
Excellent, thank you. And I cannot agree with you more. It's not just the word, but you need action, and you are doing it already. I can see that Mr. Patrick Mink from Switzerland also would like to add to that. Well, I know Switzerland is also putting action to the words. Patrick, you have the floor with a question or an answer. Tell me.
Yes, thank you very much, Stinek, and thanks also to the colleague from Costa Rica. Actually, yeah, I just wanted to add, I think, to that, because Switzerland has also actively followed the Coronivia joint work on agriculture, where we clearly expressed the following 3 points. First, to address interrelated global challenges, including climate change, biodiversity loss, food security and nutrition, we need to look beyond agriculture and really adopt a holistic food systems approach. Second, in addition to the need to promote more sustainable sustainable production practices, there is a need to adopt healthier and more sustainable diets with low environmental impacts and low carbon footprints. And third, to address climate change through a systems approach that considers both production as well as the consumption side of food and nutrition. Cross-sectorial food systems policies need to be jointly developed and implemented with the effective involvement of all relevant stakeholders. And we are also championing these points in other global processes, in particular through Switzerland's role as co-lead of the UN One Planet Network's Sustainable Food Systems Program, and in fact, together with our colleagues from Costa Rica as well there. The recent UN Food Systems Summit too has highlighted these interlinkages between food, nutrition, health, and climate change, with participants urging a systems approach to food. And furthermore, Switzerland joined the summit's coalition on healthy diets from sustainable food systems, which brings together the health and climate communities, highlighting co-benefits of this approach. Now, we are therefore very pleased with the conclusions on the Coronivia joint work on agriculture agreed upon last Friday. In particular, the inclusion of the notion of food systems on the initiative by Switzerland. Concretely, the document recognizes that socio-economic and food security dimensions are critical when dealing with climate change in agriculture and food systems. And it stresses the need to design sustainable and climate resilient agricultural systems, applying a systemic approach in line with long-term global climate objectives. So in line with this, we also hope that in the follow-up to the Coronivia joint work on agriculture, parties will further broaden the scope of the deliberations to a more holistic view on food systems, including the role of healthy nutrition and sustainable diets in tackling climate change. Thank you.
Thank you, Patrick. That was a very good addition indeed. Go beyond agriculture, link sustainable production and healthy diets, and systemic approach to tackle climate change. What I particularly liked about that comment, about your intervention just now, is to link global processes. We are here at COP26, but that ends like this Friday or Saturday, and then we need to go on. We need to continue bringing this message everywhere, because there will be other opportunities. Of course, we now need to make the difference at this moment in this room, but then we need to continue and not stop. I'd just like to check with Dr. Ramsamy if he would also like to make an additional comment at this stage.
I just want to say that in Dr. Fonso's presentation, she highlighted the nutrition dashboard so we could make policymakers more aware of the dangers and the opportunities. But we must also remember the ordinary citizens that go into the markets, to the supermarkets, and so they need to also be aware. The fact of the matter is Guyana is a food secure country. We produce all the food that we need, but we import a lot of food. The Caribbean import between 5 and 10 billion dollars worth, US dollars worth of food, mostly hyper processed food, high in salt, sugar, and fats. We've been trying as a government to get front of the package labeling and always being confronted with corporate interest. And I mentioned it with Codex Alimentarius, which has been more than a decade in some countries in Europe, and so have already started to do it. But we have the compromise is always back of the package labeling, hide the information from the people, and the amount of money spent on advertising. So, with all the things that we talk about, a lot of time consumers are driving the process. They're the ones buying, and we need to make them aware not only that the nutrition they're taking to sustain themselves are actually making them sick and killing them. Um, we need to make them aware that some of these food contribute to climate change that is now an existential threat in front of the package labeling. So we need to bring the citizens forward. At the Ministry of Health here, we are trying not only to sell better dietary guidelines, but also to make citizens aware of the danger that they spend money on.
Thank you for calling attention again to highly processed food, sometimes imported, that really are detrimental for health and for the climate and contribute to climate change. We cannot forget that. We cannot forget to work on the food environment also, to try to improve it, to allow people have access to healthier choices. And forget or diminish access and sometimes even preferences for less healthy options like highly processed foods that are high in sugar, salts, and not so high in fibers. I'm just looking around in the room here. Any questions so far? Yes, I see two. Okay. You fight among each other. Who is first? I'm the moderator, so.
Hi, I'm Margaret Jackson. I'm representing MedAct at the COP26. And thank you for really, really interesting presentations. I'm really excited to hear about the sort of things that are going on in Costa Rica and Switzerland and Guyana. I'm a bit puzzled as to whether we can or should expect anything concrete coming out of the COP at the end of the week on this issue of tackling food. So are we likely to, and if not, should we, or is this something that really has to be tackled on a more local, national, or even regional level?
Thank you. I'll take the second question, and then we do a very quick round among the panelists to try and answer.
Mine's quite a specific question, so not holistic, but does take multiple things in account. Rice production. We know rice growing generates a lot of methane, but is a huge global nutritional asset. And there's a lot of cultural beliefs around its production. So I wonder if Costa Rica has something to feed, because you mentioned rice as well. Yeah.
Thank you so much. We'd like to take that immediately, Carla.
Okay.
Yeah. And if you can also reply to that question before we go back to the panel.
Thank you very much for that questions. Well, first of all, rice. Yes, rice is so important, and it's part of our actions in mitigation, because we know we are studying, first of all, well, we start rice since many years ago, changing varieties, control the different ways to the way to plant the rice in summer and rain season. And we are working with the private sector, because sometimes the private sector has to control it to produce, and of course to the market. And we start with them to have a public policy agreement with them in order to each year to see how the good practices they are implemented in the farms, because our big farms, rice farms, are really big in my country, start to reduce or start to show how the demonstrate as is not only mitigate and is adaptation and is the priorities of the rice are nutritional aspects, but we are starting with this since 3 years ago, maybe, yeah, 2 years ago. But of course, before we are trying to try this link with this private sector. This is so important too, and according with your answer here in the COP, I think public policy is really important in order to agree the things that we want to change. Because if not, it's how do we engage and address the change. Another really important is to include producers in our topics, any kind, policy or technical. When we need to include the producers.
Thank you. I know we are running out of time, but I'd like to give Patrick or Dr. Ramsamy just a 30 seconds opportunity each to try and reply the question, the first question. And Jess as well, I'm sorry. 30 seconds each.
I think that whilst I'm not sure that COP26 will have agreements around nutrition and health, I think that no COP so far has had so much focus on health and nutrition as this one. So that, in a way, is a step forward. I believe much of what has to be done is at local level. In terms of the question on rice, rice production it takes up a lot of land across the world. In Guyana, 80% of what we produce are exported, and it's one of our major crops. Well, we need better technology, better ways of applying fertilizer, for example, pesticide, drone technology can make these more efficient and therefore reduce how much fertilizers, how much pesticides we use. So I just want to highlight the fact that
Thank you.
technology is
I think
very important.
you've taken your 30 seconds. I'm sorry to
Yeah,
interrupt you,
thank
but
you. No,
we have one
no,
final speaker also. So I'd like to give Patrick 30 seconds, then followed by Jess 30 seconds. Really keep it one breath, and then we go for the final call for action. Patrick.
Oh, okay, thanks. Just very briefly, and I agree with Dr. Ramsamy's points fully. And well, can we expect more from COP or by the end of the week? I'm not sure. I'm not one of the negotiators there, but to my knowledge, this is really the first time that the notion of food systems has been included in an official UNFCCC negotiation document. So this, for us, is already a great achievement and will allow to continue working on that linkage between health, nutrition, food, climate at a global scale and within the UNFCCC. Thanks.
Thanks, Patrick. Jess.
Yeah, agree. It's nice to see even these kind of side events, with food at the COP. This didn't exist a couple of years ago. But I think with that said, it's a bit disheartening overall to see the lack of commitment on climate. And we're running out of time, and food is a big part of that equation. So policymakers really need to start stepping up and taking it seriously. And there's no time to waste anymore, because climate change is barreling down on us all, and they're certainly not doing enough on food.
Yeah. No, I hear all of you, the four of you, and I hear the people in the room and around me in COP. It's true. It's urgent. Not enough is happening. So yes, let these negotiators take that climate change seriously, but also let we do also our job and take our responsibility in our own environment. Let's just do it together. But I'd like to go for the final call for action to Her Royal Highness Princess Sarah of Jordan, who is also the Special Advisor of World Food Programme on maternal and child nutrition. Princess Sarah, you have the floor. A final call for action.
Thank you very much indeed. For tackling climate, environmental, nutrition, and health challenges, we shall all meet at the table. The title of this event has me feeling very Broadway. In the spectacular musical, Aaron Burr, Hamilton's nemesis of sorts, is excluded from nation-building discussions, deal-cutting, and decision-making. His frustrated Outburst comes in the form of a song called In the Room Where It Happens, because that is where he has to be relevant and to participate. Is the table we're meeting at in the room where it happens? Who is sitting at our table? Is it diverse, inclusive, community-based, and burning with the urgency and determination of the youth movement, working in lockstep on a common agenda and speaking with the same voice? And if we've got all that right, do we have the leverage to play and cut deals with the big boys, international banking, the extractive industry, agriculture? And are we willing to play hardball with the governments who are, at the same time, our donors and executive board decision makers? Obviously, my questions are rhetorical and provocative, and as an advocate myself, I absolutely do not discount the necessity and power of strategic messaging and relationships. In fact, I would argue that we need more and better advocacy, both within our organizations and thematic sectors and beyond them. So while not neglecting the need to try to influence global negotiations and discussions, my call to action is actually a call to prioritize what is already in our ability to improve and impact. After all, for UN agencies and programs, NGOs and civil society, our table is well established. Baking in the desert, under a tree with a crowd of weary, patient women and babies and children, in a damaged health facility, or as it was for me and my WFP colleagues 2 weeks ago in Bukavu, grappling with the paradox that is much of the DRC, a country so lush and fertile, yet home to the largest total number of people facing food insecurity. Yesterday was officially COP's Adaptation Loss and Damage Day. And even in the very best case scenario, how long will it take before the impact of negotiations in Glasgow is felt by people at our table? By Rohingya refugees, for example, housed in permanent structures in Cox's Bazar, Bangladesh, Cyclone Alley of the Indian Ocean. By the communities around Lake Chad or in southern Iraq, who in the space of a generation have seen their or in Madagascar's Grand Sud, where decades of neglect, exacerbated by the climate crisis, had the foreign minister in 2019 acknowledged that his government was sitting on a time bomb. We already have access to the most vulnerable communities, and they are trapped in a tangled web of ungoverned spaces driven by varying combinations of poverty and underdevelopment, food insecurity, environmental degradation, inequality, and persecution, further complicated by politics, history, and national self-interest of the narrowest kind. We know this. The problems are complex and the causes multifold and interlocking, but still we maintain a response architecture of division and competition and preserve the false dichotomy of development and humanitarian. The good news is we know the solution too. In every setting and in every sector, focus should be on and for the entirety of a woman and girl's body and needs. And the bedrock of her needs, my needs, is of course good nutrition. Women and girls with their full participation need proven and low-cost nutrition interventions such as breastfeeding, supplementation, and fortification, while there is simultaneous work and effort across all other sectors to improve healthcare systems, water and sanitation infrastructure, sustainable production of nutritious foods for a diverse diet, peace and stability, and gender equality. She is the front line of change, both as a first responder in crisis and because her resilience, security, and full potential, as determined by brain development and a strong immune system, are the bedrock of success for all our missions, and without which we negate the positive impact of all other interventions and support, and continue to condemn the most vulnerable to an intergenerational cycle of dependency, failure, and frustration. We must do more than pay lip service to a person-centered approach. If geography and security are issues leaving only a small number of actors on the ground, they must be properly financed and empowered to provide a comprehensive package of support. Leaving no one behind means being in the hardest of places at the worst of times and providing a comprehensive package of goods and quality services and then going beyond and making visible the invisible. In conclusion, I applaud the efforts and examples presented by colleagues from Costa Rica, Switzerland, and Guyana. I am shaken by Professor Fanzo's keynote presentation. And I implore those of us who work in positions and organizations of influence to do better together. Keep women and girls at the core. Prioritize populations and communities we know are the most vulnerable or have already been left far behind. And root response and engagement through the transversal nutrition platform as the bedrock to the success of all other ambitions and a means to address many of the root causes of the issues on the COP table. Thank you.
Thank you, Princess Sarah. A powerful call to action, so let's do it. I really liked, just to summarize, your reality check, your statement that there is a difference in power, but then also your positive note that we know what we can do. We have the evidence, we have the knowledge. We know there is a food system, there is a win-win if we transform food systems for better nutrition and to tackle climate change. And we know that if we put nutrition at the center of food systems, it will work for better human rights and for more equity. So with having said this, I'd like to conclude this seminar, this webinar, and this side event. I'd like to thank all the panelists for their powerful contributions, and I'd like to thank the people in the room for their good questions and their patience, and the colleagues online for helping out with the technicalities. I wish you a very good rest of your day. Thank you so much.
Hello? Hello? Can you hear me? Hello? Can't hear any. Oh, there we go. Okay, we're going to start in a minute. We're just waiting for sorting out some technical difficulties, so bear with us and we'll be starting soon. Thank you. Okay, well, thank you all very much for joining us this afternoon. I know you've been having a very busy week already. Ah, here's one of our speakers, marvellous, just in the nick of time. In this session today, we're going to talk about health professional advocacy towards COP26, and we're going to weave a story about a range of different activities that have built up to a moment this morning. Let me just wait. Are you all able to hear us on the channel 0? I'm seeing nodding, so most people are working. Channel 0, that's great. And we've got a real mix of people on the speaker panel who are going to join us. We've got people from the health professional world who I'm going to introduce. We've got people from World Health Organisations, and we've got colleagues from the UK government, from the Department of Health and Social Care, and from the Foreign Commonwealth and Development Office. So I'll introduce each of our speakers as we go along. And hopefully we're going to tell an interesting story about health professional advocacy on the climate crisis and towards this COP26. This morning there was a session held as part of the UK government's presidency agenda called Climate Action for Health. And this is the first time, as I understand it, there's been a session specifically on health on the presidency's agenda at a COP. So it was a really major step forward in bringing the health arguments and the health issues into the heart of COP. And we were really delighted to be asked to bring a video to start that session, to bring the health professional advocacy voice to that meeting and to really set the tone of why it's so important that we think about the health impacts of the climate crisis and what our healthy climate prescription should be. So we're going to show you that video now just to set the scene.
of heat exhaustion,
depression, double the normal number of asthma exacerbations,
cardiovasculares, infartos, stroke,
problems with kidneys, heart, and lungs.
I've seen children die due to the air quality on our streets.
من الإصابات الميكروبية المتنقلة من الحيوانات
and the worsening of psychiatric illnesses,
stress and anxiety of not knowing, is this flood going to come again?
When the Category 4 typhoon made its landfall, the hospital's basement flooded.
Heat waves close to 50 degrees.
The unprecedented droughts and locust infestations.
Les vagues de chaleur de plus en plus longues, de plus en plus fréquentes et de plus en plus chaudes rendent les patients de plus en plus malades.
I prescribe healthy air as a right for all children.
I prescribe the rich nations to make the biggest cuts in emissions. D'investir massivement dans des projets d'adaptation climatique qui touchent la santé.
To invest in reversal of the negative impacts.
To build resilience.
E risolvere le disuguaglianze sanitarie e sociali.
y dejen de financiar a fossil fuels.
Climate change
is a health emergency, and it is my ethical duty to speak about it.
We have a crisis.
So the story we're going to tell in the rest of this session is how we came to have that video and about the healthy climate prescription and how we've built to that point. That video is now available. We're tweeting it already. It's available on our YouTube channel. So we'll be sending out messages to you after this about how you can share that video as well. So I'm going to go back to where we began in terms of raising the health professional's voice. And I'm going to introduce Richard Smith, from the chair of the UK Health Alliance on Climate Change, who's going to tell us about the amazing and extraordinary initiative that they took on and managed to deliver to get health journals around the world to speak about climate change. So Richard, over to you.
Thanks, Alison. Yeah, so I'm going to tell you the story of how we got the same editorial at the same time in over 220 health journals. And I want to emphasize that they're health journals, not just medical journals. So it was nursing journals, pharmaceutical, dental, and veterinary. And I have to start by saying that this was the idea of Laurie Laybourne. I want to give due credit to him, who was a previous director of the UK Health Alliance, which I now chair. And it's probably worth saying that that is an organisation of most of the major medical bodies in Britain, the Royal College of Physicians, Surgeons, Nurses, GPs, Psychiatrists, and the BMA, and I think very, very crucially, I think maybe I'll put this down here, it won't be that bad, and crucially the Lancet, and the Lancet's here today, and the BMJ, and I think that was important because it gave us an advantage with journals. And what we wanted to do was get a very important message to all the delegates at the UN General Assembly. So we timed this to be before the UNGA meeting. But a second aim was that we wanted to raise the voice of health professionals. As everybody here knows, the previous 25 COPs have not included health in the main program, and we wanted to change that. And the message of our editorial, really there were just two simple messages. One, we have to do everything we can to stay below an increase in global temperature of 1.5 degrees. And secondly, very important in the context of this meeting here, we can only possibly do that if high-income countries like Britain, like the US, make bigger cuts and transfer resources and technical assistance to low and middle-income countries. If that doesn't happen, we're going to struggle to stay below 1.5. So we established a team. So there was Laurie, there was me, other people from the Alliance, and very importantly, we had Juliet Dobson from the BMJ and Stephanie Clark from the Lancet. So we had them in there right from the beginning. And we drafted an editorial that made those points, and we then began to approach other journals about whether they would like to join this. And I used to be the editor of the BMJ. I was a founder of the World Association of Medical Editors. I belong to the European Association of, so I know a lot of editors. So I began by going to a lot of them personally, and we were very keen that this cover the whole world. So we went to the National Medical Journal of India. We went to the Chinese Science Bulletin. We went to the PAHO Journal. We went to WHO Bulletin. We went to the Canadian Association Medical Journal. We went to the East African Medical Journal. We covered the globe so that we had everybody represented. And we went, as I said, to pharmaceutical journals, to dental journals, to nursing journals, and to veterinary journals. And I have to say that my expectation before starting this is that about half of them would say, don't want to do that. We're not interested in publishing what other people are publishing. But the remarkable thing is almost nobody said no. Everybody said, we want to be part of that. And then as we approached people we didn't know, we kind of contacted people cold, saying, here's the draft. Would you like to publish this? Would you sign up? Almost everybody, as I said yes. And we went through WAMI, we went through the Council of Science Editors, we went through the European Association of Science Editors, and we went through publishers like Oxford University Press. There were various complications around authorship, which I won't bore you with, but we ended up with about 15, 16 people who were actually authors of the editorial, but then another 220 who published it at the same time. And we managed to get translations in all of the WHO languages of the editorial, because it's not that long. So that was getting the editorial into the journals. But then we had a big communications program. And again, we had fortnightly meetings that included people from a big agency that approaches people around the world. We had people from the Vulnerable Countries Coalition. And we reached out and got as many people as possible to support this editorial, including Dr. Tedros from WHO. We got Sheikh Hasina, the Prime Minister of Bangladesh, and many people from many countries. And we prepared a communications package, both for mainline media and for social media. So we were ready to go, and we were all going to go on the same day, at the same minute. That was absolutely crucial. Unfortunately, various people published the editorial in advance. But that didn't, in the end, mess things up, because the story from the media's point of view was really this unprecedented publication at the same time. And we got a lot of media coverage. Fiona Godley, the editor of the BMJ, did interviews on the Today programme, which is the most crucial programme in Britain, on Sky Television, and many others. Eric Rubin, the editor of the New England Journal of Medicine, did an interview on CNN. And then we got lots and lots of social media coverage, and Greta Thunberg tweeted our editorial, which of course immediately increased the coverage we got. So 2 final comments. One is, I don't know the answer to this, but my suspicion is that many of these journals, it was the first time they had ever published anything on climate change and health. I mean, it's a research question. It would be good if somebody could work out how many had, but I think for many of them, it was a first time. And of course, I hope that will then be the beginning of them doing much more. And of course, our meeting was aimed at this meeting, COP, so we've clearly got to follow up. So whatever happens here, if it's a success, we will celebrate that. If it's a failure in some way, then we'll go back to all of the journals and say, maybe you'd like to publish something more on this. But I hope in a way this will be a beginning, not an ending. This can be a continuing partnership with health journals, and we can steadily increase the number who participate. Thank you for listening to me.
Thank you, Richard. Mohammed, do you want to join us? So my colleague Dear Matteo has reminded me that I haven't introduced myself. So I'm Alison Cox, and I am the Policy and Research Director at the Global Climate and Health Alliance. And the Global Climate and Health Alliance was set up in 2011, I believe. I believe, Richard, you were one of the founders. And we are an organisation that brings together health professional organisations, health students and health workers organisations all around the world who want to bring their voice and their advocacy on the climate crisis. So the next part of the story that I want to talk about is then the Healthy Climate Prescription Letter. Earlier on in the year, we'd been contacted by Lizzie Blenkinsop and Dave McConalogue in the UK government, saying that they were putting together a health programme for the UK presidency. And they were really interested to hear from the health professionals and for us to raise, to give us a platform to raise our advocacy voice. So that made us think, what can we do? So a small group of leading advocates within our movement came together and drafted what became the Healthy Climate Prescription Letter. Over a number of rounds of editing, we came up with this letter, and we really tried to focus on two parts to the letter. One was health professionals' experience of the climate impacts now and the co-benefits of taking action on climate for health. And then we came up with some very strong calls, which are encapsulated in this board, which are about what we wanted to see from COP26, which is strong and urgent action to try and ensure that we keep the global temperature rises to within 1.5, that we have a just and fair transition away from fossil fuels, and that we find the funding necessary both for mitigation and adaptation and loss and damage, and investment in the low carbon and resilient health service. So that's the bare bones of the letter. What I'm going to do now is I'm going to invite Howard Cutton, who is the Chief Exec of the International Council of Nurses, who were one of the first signatories to the letter and was our spokesperson when we came to launch the letter in a co-launch that we did with the WHO report, which we'll talk about in a moment. So Howard is joining us from Geneva online, so I'm just really hoping that we can bring him in through the magic of Zoom. If we can bring in Howard now on Zoom, is that possible on the screen?
He was here.
Have we lost him? We've lost him. Okay. Well, in which case, while we try and find Howard, I'm going to invite Mohammed Aissa from the International Federation of Medical Students Associations, just to talk a little bit about how the Healthy Climate Prescription has worked for them in terms of health professional advocacy and what your message is around it. Mohammed.
Yes, thank you so much. So, as Alison mentioned, the IFMSA has signed on to this letter. Sorry, I'm making this working out. So yeah, we have signed on this letter due to our belief that actually it is very important that we become part of this advocacy. It's not just, for example, the healthcare professionals, it's not just doctors, it's not just nurses, it's everyone, including us as medical students. So we found ourselves it's very much important to be involved in this, especially that IFMSA has been there for the past 70 years. We have been working on the advocacy for public health. We have working on the advocacy for sexual and reproductive health, human rights and peace, medical education, and so many other different areas. So the biggest crisis that we are living at the moment, it was very important that we as medical students and future healthcare professionals to become part of this. And reading the Healthy Climate Prescription Letter and reading the call to action, it's very much relevant to what we are living at the moment. And it's the only way in which we can mobilize the policymakers and the decision makers. As you have seen here, unfortunately, the health was not much of a priority for the policymakers. It was not on the theme. It was not anywhere except in our pavilion and except in our advocacy that we are working on. However, the Healthy Climate Prescription was a tool that we used in order to get to reach the different policymakers and get to tell them, this is what we want from you, this is our issue with the climate change crisis, and this is something that we will hold you accountable for. So even if at the end they are not making negotiations down there that are relevant to health and that are ensuring that everyone are able to live a healthy and a green life, if I can mention it this way, then this Healthy Climate Prescription Letter can be a tool of accountability for the policymakers, especially that it has been signed by 45 million people, 45 million healthcare professionals, students, doctors, nurses, everyone have been involved in this. So it's very much important. And the thing also about the Healthy Climate Prescription, that it worked on the inclusion of health in all policies. We keep on mentioning health in all policies and climate change in all policies. And yes, this was actually mentioned in the Healthy Climate Prescription. In the IFMSA, for example, we have had our policy documents on food systems, on mental health, on the inclusion of gender in the climate change. We have had our policy brief on this. And all of this was mentioned in the call to action and in the background of the healthy climate prescription. We have worked on the food systems, we have worked on the inclusion of everyone, all the stakeholders and all the different generations in the climate action. We have like tackled different issues, including the sustainable health systems. So this is a sign that we, as the health community, we're not just saying it needs to be just us in the room. It needs to be everyone in the room, but the health must be like on the top, or like it can't be on the top of the room, because the room, it can't be the top, but we need to be in the center of the room at least. So yeah, that's why, and that's a sign for everyone involved here, especially all people from the other sectors. We are not rejecting you, or we are not rejecting other people. We are involving all the sectors, we are involving all the communities, because this needs everyone to be involved. This needs to be a multi-sectoral and intergenerational and a collaborative approach that includes all the stakeholders, and consequently we will be able to tackle the climate action. So this is a call to action that health must be included in all policies, and all policies must involve themselves within the health sector with us. Thank you.
Thank you so much, Mohammed. I'm going to try one more time. I think we're hopeful that we have Howard back online. Is that right? Yeah, so we're going to bring Howard in. Hello, Howard. Can you hear me? Hi, how are we going to be able to do this? No, I'm really sorry, Howard, but we've got quite bad.
You, Alison, can you hear me?
I'm afraid not, Howard. It's sounding quite robotic. I think we're going to try again. We're going to take one more speaker and we'll come back to you and see if we can make it work.
Shall I turn my video off? So
Yes. Yeah, let's all turn off videos and see what happens.
Okay. Howard, can I hear you now? Howard, do you want to try one more time?
Okay, hi everyone, it's Howard Catton here. I'm a nurse and the CEO from the International Council of Nurses. Delighted to join you all. I have the great privilege to talk to nurses around the world every week across high, middle and low income settings, and they tell me about the impact of climate change that they see in the care of the people they look after every single day. Our healthcare professionals are witnesses to the health emergency that is unfolding in plain sight, and that's why they're a voice which must not be ignored but heard and acted on. The sorts of things they say and they share is the young and the old people with respiratory disorders that are caused or exacerbated by poor air quality and pollution, lost function and independence. About the people who they support who aren't coping with to hypothermia. Many of these people are already very vulnerable with underlying conditions like cardiovascular disease. They tell me about the extreme events like disasters and flooding and forest fires, and that they see the spread of infectious diseases, the contamination of food and water that people simply can't avoid. And they tell me about the impact all of these things have on people's mental health, as well as their physical health, depression, anxiety, grief, isolation, and PTSD as well. Climate change stealing some for their future. We had the ICN 5.5 from
Howard, I think we're losing you. Howard, I think we've lost the sound on your presentation. You've given us a very powerful testimony of the impact that nurses and across your network are experiencing every day. I'm not sure we're going to be able to get the sound back. I'm very sorry about that. I think we're going to leave it there. But thank you for that, because I think what you brought there was exactly the message that we wanted to share, which was that this is real and this is happening now, and it's only going to get worse, and that's why it was so important to bring this healthy climate prescription to the COP. I'm now going to bring in Dermot Campbell-Ledram, who is from the WHO, heads up the WHO's Health and Climate Unit. And he is going to talk to us about the WHO's own reports and his extraordinary efforts to bring the messages to COP. So over to you, Dermot.
Well, thanks very much, Alison. It's a real pleasure to talk to you here and to make this connection with those frontline health voices, as Howard was just describing, who are now speaking up now so eloquently and powerfully on the need for climate action. And I'll just, if I could just have make a slight correction in something you said at the beginning, Alison. I think we have had health here before, and I think we have to pay tribute to some of the people who have been keeping this, who have raised health before and have been keeping this this voice going. Because in fact, you may or may not be aware that health is actually right at the front of the UNFCCC. It's in the top line of the Rio Declaration which governs the UNFCCC. The right to health is actually right at the beginning of the Paris Agreement. And there are organizations which have been carrying on probably what was quite a lonely struggle to keep making the case that health is the most powerful argument for climate action. And I think, in the past, for example, when Fiji was president of the COP, they held a powerful presidency level event. And there are organizations like IFMSA. IFMSA have been champions on this for more than 10 years, passing the baton from one generation to the next. And we now see them go out into the world, and several of them are in your video, and they're doing wonderful jobs around the world. But what I think is absolutely different about this COP is that it is at a new level of seriousness now. So this is the first time we've had a health pavilion at COP. It's also the first time, as we'll hear in a minute, that we've actually had a substantive health program within the COP agenda. It's still not an agenda item. We think it should be an agenda item. We think it should have its own space. But you'll hear in a few minutes from the UK COP presidency about a very substantive program that is happening within the COP. But to get back to our own role in this, so about almost a month ago now, we launched our report on the health argument for climate action. And so we wrote it, if you like, we held the pen, but it was actually developed in consultation with the wider health community. So I think there are effectively 400 odd contributors to this report. And it's quite clear that it is the health argument for climate action. It isn't just complaining on health's behalf, arguing for a bit more space or some money for health. It's making clear that health is a really good reason why you should act on climate change. We need to protect people's health. And as we've heard, it's the voices of people who are affected by climate change, but also frontline healthcare workers who are protecting them, who are the most eloquent voices for acting on climate change to protect their lives. But also, perhaps more importantly and persuasively, that action to cut carbon emissions is really good for your health. And so we know that the health gains that would come from meeting the Paris Agreement goals would pay for the cost of mitigation. So we think we're bringing a really positive health argument to COP. So we launched that report at that time, but we launched it sort of in partnership, as you said, with the Healthy Climate Prescription Letter. Because, I mean, to be honest about it, we are UN bureaucrats. We sit in WHO. We can give out these prescriptions. But what is much more persuasive than that is that partnership with our team, which is every frontline healthcare worker in the world. That's who we represent. We represent them and the patients that they try and protect. So we were nothing but honoured to have that partnership with this initiative, which brought their voices forward. And then to make that commitment clear, we also had this opportunity when we heard about 3 months ago that there would be a team of cyclists from the NHS in England, launching from Great Ormond Street Hospital, which is a legendary hospital in the UK, Children's Hospital in the UK, who are going to take a message from children and on behalf of healthcare workers from London to Glasgow, stopping along the way at children's hospitals in association with the air pollution pods. And hopefully you'll hear a little bit about that in a minute. At which point we thought, they just asked us, could WHO maybe give a little bit of endorsement? And we immediately thought, we have to do better than that, because this is such a valid, strong effort that we have to lend it all the support that we can. So what we did is we got Dr. Tedros to sign our report, hand signed it with a message to Alok Sharma, the president. We haven't met him yet. We're still hoping. And I have to say, we hope we still get to meet him at the end of this conference, because if not, I think we're going to have to take it to the next conference. Sharm el Sheikh is about 4 times as far, but if we don't get to meet this president, then we'll have to just pass to someone who'll meet us. But that's hand signed by Dr. Tedros. He also signed the letter personally, and so then what I did was just to get on my bike and cycle that from Geneva to London in order to hand over to the healthcare workers to then take it on their ride. And I got to cycle with them for one day, which was the best day of the whole lot, because I got to talk to these amazing people who were treating children every day, and basically were not going to stand by and just treat children and then send them back out into a world which is being damaged by climate change. I could go on about this ride. It's very dangerous to ask a cyclist to talk about their ride, because I'll just talk for hours. I could go on about it's very painful. I put my body on the line. I was making a sacrifice, and it was quite painful. But really, it was just really enjoyable as well. So I feel a little bit guilty, getting any credit for this. But I do actually think that there is some kind of valid comparison there, or valid analogy. It was really enjoyable. It was quite tough, and so is climate action. But it is actually really positive. I came out, and I'm sure all of the other riders came out of this much more positive than before we started. And I think it is the same for mitigating climate change, that the things we need to do are quite tough. You do have to make an effort. There has to be an investment of resources, but it is actually better for you as well as better for the planet. And so, yeah, I and the rest of the team were absolutely delighted to make that connection between as I say, the sort of bureaucratic world we can sometimes inhabit, and to make that connection to frontline healthcare workers. Because I think, and just to make a final connection back to the way we opened this, I think we all have a role to play. So we were also really happy to see the editorial from the medical journals. We're happy to work with people doing adaptation projects in different countries and to champion them. And we all have a comparative advantage. But that voice of the healthcare workers is really, really critical, because they are the most trusted profession in the world, and they're in every community in the world. And they are actually stepping up now to also cut carbon emissions. So they're one of the few sectors, certainly with the NHS in England, which is not blah, blah, blah. They've set a target, and they're setting annual targets to reduce their greenhouse gas emissions, and they're meeting them. So I think we're just really keen to take everything that we've achieved within the last year or so to raise it to the next level, and then we just want to multiply it again.
Thank you so much, Dermot. And if you weren't following his travels on his Twitter feed, I really recommend you go back and look at his Twitter timeline. It's a lovely story, and you brought such personal messages about why you were taking on that journey, and explained really well why it's so important that health is non-negotiable, and why health should be at the heart of climate action. And you did it with some lovely dad jokes as well. So I don't want to encourage you to do any more, but anyway. Do take a look at that. And this brings us on to the next story. You mentioned that this extraordinary group, the Ride for Their Lives group of doctors, nurses, technicians, and workers from across a number of children's hospitals in the UK, but including the chief executive of Great Ormond Street Hospital. And I'm very much hoping we've got one of them on the line now, Terry Bayliss, who is a doctor and director at the Newcastle NHS Hospital Trust. She apparently rode every stage from London to Glasgow, and apparently was in the front group, the faster group, as we went. She's got some slides as well that we're going to share as she speaks, as we bring her up. And I'm very pleased to say we have with us the blue satchel that contains in it the WHO report signed by Dr. Tedros, the Healthy Climate Prescription Letter, again, that Dr. Tedros himself personally signed and encouraged all the WHO staff to sign, but has also, as we've said, been signed by 46 million organisations representing 46 million health reps. So I'm looking at our text desk. We have Terry on the line. Welcome, Terry. Thank you so much for joining us, and over to you.
Hi there. Thank you so much for inviting me to be here today. It's a real honour. My name is Terry Bayliss, and I'm here today representing the 70 healthcare providers who cycled 800 kilometres from London to COP26 in Glasgow in what was a really symbolic act of collective, collaborative, and positive action to raise awareness of the urgent need to tackle air pollution and to deliver the Healthy Climate Prescription Letter. I'm also really proud to represent my own NHS trust, Newcastle Hospitals, who showed tremendous leadership by becoming the first NHS trust in the UK to declare a climate emergency. I'm showing a few slides as Ride for Their Lives was very much a collective effort. And I wanted to feel that we have here with us just the amazing riders and the supporters that were part of the whole experience. Could I move the slide on, please? Thank you. So a little bit more about the ride and the riders. The ride was brought together by some extraordinary people who do need a very quick mention. The idea for the ride to raise awareness of the need to tackle air pollution came from Vincent Lee, the CAD manager at Great Ormond Street Hospitals. Vincent's colleagues Matt Shaw, the chief exec, and Mark Hayden, a paediatrician and active travel campaigner, then championed the idea to Tom Clark of the Climate Acceptance Studios. Tom worked with, I think, each of you, Richard, Alison, and Dermot, to galvanise a global coalition of partners, including the Global Climate and Health Alliance, the Clean Air Fund, and BUPA. And it's thanks to these efforts, the idea that Ride for Their Lives would deliver the Healthy Climate Prescription to COP26 was born, beginning with Dermot's quite remarkable feat of cycling from Geneva to London. I also want to make a really quick and special mention of Amy Sutton, the Children and Young People's Participation Officer at Great Ormond Street Hospital. On top of her day job, Amy was an essential part of the team and basically organised us all of us, before and during the entire ride, which I think was probably the biggest challenge in itself. Few of us here, you see on the screen, knew each other before Ride for Their Lives, and the first time we met in person was when we set off in London. Coming together from all over the UK, the group is a diverse range of representatives from 6 children's hospitals, from key health bodies, the brilliant young people from the Young People's Forum at Gosh, whose message we were delivering, and also from the public and private sectors, and even an award-winning artist. The riders included engineers, pharmacists, paediatricians, and sustainability experts, to name a few. And we shared a really focused, collective common purpose, and that was to raise awareness that the climate emergency is a health emergency. It's affecting our children, and urgent action has to be taken to prevent the avoidable deaths and illnesses that are being caused by air pollution. I think that this large group of trusted, busy healthcare providers representing all parts of healthcare, the fact that they felt it was essential to take time from their personal and professional lives to take action and to use our professional positions to raise awareness, to push themselves to their physical limits and commitment to delivering our message. It gives me hope that together we can take the urgent climate action that we need to. Could I have the next slide, please? The journey itself took 8 days. It was amazing to see it on the map. We travelled from London to Glasgow, stopping at 7 different points along the way, and during the journey we covered 800 kilometres, with the longest day covering just over 140 kilometres. We climbed a total of 26,867 feet, which equals 6 times the height of Ben Nevis. Some of us spent up to 13 hours a day in the saddle, and we all shared our message with too many people to count. In addition to our journey, participants from all over the world joined in to log their miles for the month of October, collectively reaching a total of 1 million kilometres travelled during the month. That collective action is also symbolic of just how far we can go if we work together. Could I have the next slide, please? Before, during, and after the ride, we've all reflected on our motivations. When the ride was suggested, I wasn't sure we could pull it off. That so many of us committed signifies just how important tackling the climate emergency is to health providers. We recognised that the ride was an important platform to collectively raise awareness that the climate emergency is a health emergency that is disproportionately affecting children. As a group, we specifically highlighted air pollution, as we know that globally air pollution kills an estimated 7 million people a year. I don't think anyone here will be unaware that last December air pollution was named as a cause of death for the first time in the case of 9-year-old Ella Casey Deborah, pictured on the left, known as a funny, busy, clever, curious, sporty and musical young girl. Ella's mother joined us at the start of our ride in London, reminding us all of the importance of what we were doing and providing the extra motivation that we didn't even need, but was much useful for the long week ahead. As healthcare providers, we know that the daily consequences of the impact of the climate emergency on health are growing more serious. In our hospitals in Newcastle, we are confronted with this every day. Chronic respiratory and cardiovascular conditions increase and premature deaths rise. In the northeast of England, we have two of the very best hospitals in the world, with some of the worst health outcomes. In our hospitals, we see the impact of this on children especially, with a combination of exposure to poor air quality and deprivation lead to chronic conditions in children and young people which they carry through their lives. We see firsthand that the climate emergency is a health emergency that's affecting children and widening existing inequality. That's my motivation. Could I have the next slide, please? Given the aims of our actions, the perfect backdrop and a further way of amplifying the message to our journey was Michael Pinsky's sobering artwork, The Pollution Pods, which recreate pollution levels in different cities around the world, and everyone who has a chance should visit and experience the pods for a starkly effective representation of the reality of our future if we don't take urgent action on air pollution. Next slide, please. Throughout the journey, we've aimed to engage others, and at many of our hospitals, our young patients were motivating us with their own work. One of our young long-term patients at Newcastle, Ishmael, wrote to our group of riders with a series of practical recommendations outlining the things that he thought our hospitals should be doing to tackle the climate emergency. And thankfully, we were able to assure him we were doing most of them. The children, as well as the scientists, are telling us what the right thing to do is. I think it's pretty clear that we have to get on with it. We haven't got time, and our children's futures are already at stake. Next slide, please. So when I reflect on the journey, I feel very honoured to have been part of it. I learnt much from my fellow riders, and as a group we shared a tremendous sense of responsibility in delivering the Healthy Climate Prescription Letter for all who signed it. We also learned, frustratingly, that in our country the necessary infrastructure to support active travel, a simple action that we can take to improving air quality and reducing emissions, is seriously lacking and must be addressed. When arriving in Glasgow, we shared a sense that while we've reached our destination, our journey is far from complete. As healthcare providers, we must continue to encourage advocacy and action and give people the time and space for this. As a group that have the trust of the public, by working together, we can make change happen. We all know that we have to continue making behavioural changes, and Ride for Their Lives gave us a public platform to collaborate to raise important awareness of our message and of our actions and of our choices. Finally, I think, as well as being a personal physical challenge, the ride itself is symbolic of the challenge that we must undertake globally to address the climate emergency. The challenge is significant but achievable. It's urgent, but we can take significant steps by coming together. It requires us to commit as a collective. It can be done, and it will be hard, but it's possible. Along with COP26 and the world politicians, we all know we need to act and do all that we can to tackle this crisis. We are all responsible, and we don't have time to prevaricate. We hope that Ride for Their Lives has amplified our message, and that the climate emergency is a health emergency for everyone, and particularly for children. And I know that we will definitely continue our journey of advocacy and action. Thank you.
Thank you so much, Terry, and for telling that story. It's, as you came out with some very powerful messages in there, that in a way, your journey, you were trying to express that it is a long journey, it is going to be difficult what we need to do, but it is doable, and it's really important that we all engage with it. That the health professionals are strong and convincing messengers, and that the climate crisis is a health crisis. So there was much more in there, but thank you very much for that presentation. And as I say, the blue satchel that you brought with you all the way is with us here, and we are still hoping to get our moment to present it to Alok Sharma at some point today. If not, like you say, we will take it to Shamil Sheikh. the final speakers today that I want to bring in are Lizzie Blenkinsop and Dave McConalogue from UK government. They've been our contacts throughout this whole process and have been encouraging us and supporting us to raise our voices and bring them to this COP. And I invited them along today because I thought it'd be really interesting to hear from you about how you see health professional advocacy, what role you think it plays in developing climate policy, and what benefits your government and other governments might gain from listening to the voice of health professional advocates.
Thanks, Alison. So I'm Lizzie Blenkinsop, work for Department for Health and Social Care, and have worked very closely with Dave in Foreign Commonwealth and Development Office over the last couple of years on COP26. So as the UK presidency, health has been selected as a priority for science at COP26. So we have developed a COP26 health programme. It's been far from smooth sailing to get it to this position, I think it's fair to say, but I think a real strength of the COP26 health programme has been working with partners. So we've been working across government, lots of departments and executive arm's length bodies involved, but also external partners such as World Health Organization, Global Climate and Health Alliance, Healthcare Without Harm, the UNFCCC as well have been really key partners in this. And what that has meant is that we've been able to extend our reach beyond what we are able to achieve just in UK government. So we just wanted to give a bit of an overview of what the COP26 health programme was and what it includes, and then we'll talk about the healthcare professional advocacy and how that supports the health programme as well. So we have 4 initiatives under the health programme. The first 2 are really around health systems and how do we get health systems to respond to climate change. So this was split into 2 initiatives that we were engaging with countries over the last 6 to 9 months to try and for them to make ambitious commitments too. So the first one was around building climate resilient health systems. And so this was to make sure that health systems could withstand the impacts of climate change, so extreme weather events, infectious diseases, and all of the health impacts that climate change causes, making sure that health systems could respond and adapt when they are most needed. So we've been engaging a number of countries on this, and we've managed to get a number of commitments to this. Our second initiative is around building sustainable health systems. We know that health systems account for around 4 to 5% of healthcare emissions globally, and they play a really key role. So it was important that health systems were playing their part in climate change and keeping that 1.5 target alive. So overall, we managed to get 50 countries to sign up to both of those initiatives, or 50 in total. I think 47 is it for sustainable health systems? So which was a great achievement, and absolutely a key part of that was the partnerships, external partnerships from government as well. And then whilst we were working on our health programme, I think a really key element that we wanted to bring in was the voices of healthcare professionals. And so this is when we started to reach out to Jenny and Alison in Global Climate and Health Alliance and some other key partners in WHO in this. And we really felt we needed to bring those voices into COP26, and we had that opportunity within the COP26 health programme to do that and bring it into the heart of the presidency. So I'll hand over to Dave to talk a bit about our journey on that.
Sure, thanks. Alison asked how it feels from the government side with health professional advocacy. I'd say it feels really exciting, but a little bit dangerous when you start on this journey, because the key thing is you have to give up control. That's really important. So it has to be about health professionals, has to be messages which are led and owned by health professionals, not by governments. But what we were looking for was a chance to align on COP26 and to really use the voice of health professionals to really deliver those messages. So for us, on the COP26 health programme, we were broadly looking at trying to deliver 3 things. The first one was about what is the health argument for climate change? So how can we use those really tangible outcomes for people, your families and communities, which are the health outcomes, to try and drive higher ambition from countries on climate action, both mitigation and adaptation. That was absolutely key for us. And that's really one of the ways that we were selling the COP26 health program to the COP26 presidency. And that, that's a process we have to go through. The second element is around the co-benefits. So generally what you do on climate change, the actions you take on climate change are generally also really good for health. But the actions you take on climate change sometimes are difficult for the public because, and politically sometimes they're difficult, because you can do something which is really great. You can take lots of carbon out of the system, and that's brilliant. But how is that going to translate into votes for you on the ground? Are you going to see this? How is that going to affect somebody living next door to me in Glasgow? How are they going to feel that? Well, they do feel it because they feel it often through the health co-benefit. So, for example, when you move to less meat in your diet, when you shift towards active travel, when you burn less fossil fuels, you result in less cancers, less respiratory disease, less cardiovascular diseases, better mental health. You live longer, you're happier and healthier. And so that's a really important message to drive out. The third area for us was, we always talked about this, we can't just stand back in health and just tell other people what to do, because it's not a credible position. We have to be able to sit up and say, well, look, we're doing this, we think it's really important, and we're reflecting that in our action. So we really have to have a strong voice from the health community, but we also have to build health systems which are resilient to climate change, so really genuinely protecting the health of our populations, because we recognise that climate change is real and is devastating for those communities that we're protecting, and so we have to do that. And the second one is, whilst we're protecting our communities, we can't add to the problems that we're trying to solve. So we need to take carbon out of the system as well. Or we need to certainly build in a way which enables us to reduce or minimise those carbon emissions and local air quality. So why would you need health professionals within all this? Well, they're just critical in all three, really. And they've got so many strengths. So, I mean, the first one is numbers. So there are a lot of healthcare workers. They're in every country in the world. They're in every community. Most of us are married to them, have them, their sons or daughters or mothers or fathers or brothers. We respect what they do, and we listen to them. And we know they're really credible. We know that because there's lots of really good evidence for this. We have it within the NHS, run a survey every year. I'm stealing sort of Nick Watts, who's the Chief Sustainability Officer's speech here, really. But when they ask people, healthcare workers, what's important to them, they come back and they do say climate change, and they want to see the NHS do more on it. And that's the same. They have a similar survey in, I'm sure it's going to be published soon, but I'm sure they won't mind me saying, in the Scandinavian countries run a very similar survey with exactly the same results. They came back very strongly on that. The second element is that people, as Dermot alluded to before, they trust health professionals. Health professionals are credible within the communities. They're the most trusted health professional in most countries in the world when they run surveys on this. So it's generally nurses, doctors, followed by dentists, and then engineers somewhere after that. So it's a really great voice to have on that as well. And I think it's when you combine all of those, you've got a real strength to play with there, and you've got a real push. And I think, for us personally, what the COP26 presidency was trying to do, the aims of the COP26 presidency, were not UK specific, they were global, and they just aligned very well. You'd have to be a bit of a monster to not agree with them. So we for us, there was limited conflict in terms of giving health professionals a voice on this. So what do we do next, and how did it feel? I'll bring Lizzie back in a second to see how it generally felt to do this. So if I'm honest with you, it did feel a little bit risky coming from a government office where politics plays out, and you have to be really careful. So it was a little bit heart in our mouth that we went there, and we did check it, and we did test the idea with several people, and in fact they came out and they loved the idea. This is really great. But of course, if it'd gone wrong, and we got really terrible messages, which are really sort of anti-government messages, or they felt like they were being attacked, then we still would have had to bear that brunt. But we didn't feel it was a high risk that would happen, because we were really concentrating on the aims of the COP presidency and not the UK. That was really essential to do that. But we did understand that we had to relinquish control. So it couldn't be something that the UK government could do. That just wasn't going to work. And in fact, when we started doing this, we started trying to kind of coordinate it with several different organisations, including WHO, GCHA, etc. And it just really wasn't getting anywhere. And we couldn't really work out why. And so we had a number of conversations in the background. And I think the feeling was, actually, if you really want this to work, don't try and help. Just step back, set some parameters. If we're interested in it, we'll go for it, and then we'll deliver. And you just need to step well back, and that's what we did. And the results were just incredible. I mean, absolutely incredible. So, I mean, organisations representing 46 million health professionals across more than 100 countries in the world. It was just such an amazing advocacy message to bring at a really critical time. People are looking at healthcare workers, they're looking to healthcare workers, and the fact that healthcare workers in this current situation, coming back out of COVID, were prioritising this as a key message towards COP26 was incredibly powerful. I'm getting the evil eye here from Alison, so I'm just going to wind down but say, from us, I mean, it's a big thank you from us to you guys for doing this. We didn't do anything. We just asked you, and you went off and you did it, and you delivered, and it was incredibly impactful. So thank you very much.
Thank you very much, Dave and Lizzie. So yeah, it's been really interesting working on this, and we, as I said, what we delivered has been the Healthy Climate Prescription, which has been very much a bottom-up, crowdsourced letter that just spread throughout the network. And then the video that we showed today, again, I very much appreciated that there was no editorial control exercised on what we did. You gave us a space. You asked us, can we produce a video? You gave us that platform, and we delivered. And I'm just really pleased that this is. If all government and NGO workings went like that, we'd be we'd be laughing. So we've kind of run out of time now, but I hope we've given you a flavour of all the different elements that built towards really bringing a strong message here to COP. As Dermot said, this didn't start this year. This has been going on for a long time, and the only thing that I wanted to bring out was that we had this health agenda session today that the presidency owned within the building. But you're absolutely right to draw that line, that this has been building for years. There's been many dedicated advocates who've got us here, but it's also got to go on from here. This is only a beginning. We are still trying to get the message taken delivery. In our letter, actually, we've delivered it. We want somebody to take receipt rather than us leave it behind the dustbins. We want to actually have somebody pick it up from us. And not only that, we need to build for the next COP and the COP after that. We need to see a health agenda. Julia Gillard at our conference this weekend talked about the need for a global strategy on climate and health, so that there's a real pathway to have these discussions within the COP processes and within governments and within at the regional level. So we want to really build on that, about how we bring the health messages into the heart of the COP process and the heart of climate policy. So I'm going to draw a line there. I want to thank you all again. We're going to show the video one more time and encourage you all. You can find the video on our YouTube, the Global Climate and Health Alliance YouTube channel, and on the Global Climate and Health Alliance Twitter feed. And if you follow, just look for #ClimatePrescription on Twitter, you'll find the video there. So I really encourage you all to share that with your own networks any which way you can. We'd really appreciate if you did, because this is the whole message of what we wanted to bring here today. So one more time with the video, please.
It's of heat exhaustion.
Depression.
Double the normal number of asthma exacerbations.
Cardiovasculares, infartos, stroke.
Problems with kidneys, heart, and lungs.
I've seen children die due to the air quality on our streets.
من الإصابات الميكروبية المتنقلة من الحيوانات.
And the worsening of psychiatric illnesses.
Stress and anxiety of not knowing, is this flood going to come again?
When the Category 4 typhoon made its landfall, the hospital's basement flooded.
Heat waves close to 50 degrees.
The unprecedented droughts and locust infestations.
Les vagues de chaleur de plus en plus longues, de plus en plus fréquentes et de plus en plus chaudes rendent les patients de plus en plus malades. cuts in emissions. D'investir massivement dans les projets d'adaptation climatique qui touchent la santé.
To invest in reversal of the negative impacts.
To build resilience.
E risolvere le disuguaglianze sanitarie e sociali.
Y dejen de financiar a fossil fuels.
Climate change is a health emergency, and it is my ethical duty to speak about it.
We have a crisis.
So, good afternoon, everybody. Can I just check first that everybody can hear me? I'm getting some thumbs up in the room. So, my name is Dermot Campbell-Endrum. I head the Climate Change and Health Program at the World Health Organization. So, welcome to it says the WHO Pavilion. It's actually the Health Pavilion. We're very pleased to run all of our events in partnership with the wider health community. I'm just saying a couple of words just by way of welcome to this event, effectively on research, applied research on climate change and health. So the format of the event is that we have two very eminent speakers, followed by a series of very eminent panelists, both here and virtually. And so I'll just introduce the first two speakers who have carried out important work in interrelated initiatives on reviewing the current state of the evidence on applied research on protecting health from climate change. And they'll give a bit of a scene setting of the current state of play in this important area. And then I'll hand over to a colleague from the UK DHSC to moderate a panel discussion on basically the future of this area of work and what we can do in the future. So without any more from me, it's a fantastic panel and time is limited. So I'll hand over first to Dr. Martin van Aalst, who's an old friend and is director of the Red Cross and Red Crescent Climate Centre. So over to you, Martin.
Just to use the same microphone. Can everyone hear me? Oh, should I take off? Okay, yeah, exactly. I was even more careful here on this stage than anywhere else in this building, I imagine. Thank you, Dermot. Indeed good to be here in what does feel like a home for many more than just WHO, but it's also WHO's leadership that's making that possible. So thank you for that. So on behalf of the Red Cross Red Crescent Climate Centre, but also the International Federation of Red Cross and Red Crescent Societies, sister organization based in Geneva, it's a real pleasure to be talking about the research agenda on this climate and health interface. It's also a real pleasure to do this, especially today on Science and Innovation Day, and we just launched the Adaptation Research Alliance, which you will hear about in a minute, which I think is actually one of the most exciting commitments that has been made on adaptation in the COP so far. And it is exciting because it is actually doing what we need much more of, building bridges between different communities, between different levels of knowledge needs applied for decision making. And I think we have a lot of work to do to enable that decision making between the climate community and the health community together. I'll also be frank, even in the International Red Cross and Red Crescent system, although we're known both for disaster management and health work, the climate agenda has taken off on our side much faster on the disaster risk management side, where there was also the sort of climate forecasting across timescales that was a natural entry point to forecasting extreme events. And of course, there are also health dimensions to that. But over time, the actually very bottom-up questions about health aspects of climate change have come through our network as well. But we've noticed that it was already very difficult to get our national Red Cross and Red Crescent societies to connect to the right knowledge actors in the climate space, which they hadn't traditionally connected with. So the disaster management people started building links to environment ministries, for instance. It is yet another connection to be built between the health communities in those countries, the disaster management communities, and the climate communities. And we're seeing so often that those bridges are not being built. On the research side, I think that's also a culture issue. And I think we actually, on the climate adaptation side, and more broadly the climate research side, have a lot to learn from the health community, where I think the research culture is generally much more rigorous than it is in climate adaptation and also in disaster management, for effect. The other way around, I think that culture change, that culture difference in how health research is organized and how climate research is organized has also sometimes, I think, caused some of these interfaces not to work. And in a way, I think we have benefited from the leadership of some that have already pioneered this, and I see a couple in the room here as well, over a longer period of time. Like the whole adaptation agenda, we are now basically confronted with the need because it's right in our faces. So we knew in a way this research was needed. We wanted to do the research before it was already in our faces so that we could see it coming. We haven't done enough of that, I would say, but the prominence is now so much bigger. So it's good to see the attention on that agenda and to see that also, as you already said, as a shared agenda within different actors in the health community, but particularly also building those bridges to many others outside. I'll mention one final thing. You were joking about my mask before. I think the pandemic has showed more than ever before how health crises are also sort of general crises for economies, for livelihoods, for poverty. And I had expected this COP to be drawing lessons about the resilience of systems and the importance of having the capacity to cope in terms of health systems, in terms of social protection systems, all of those. I'm very surprised that conversation is not more prominent, but I do think that's another area where learning the lessons about how you manage change, shocks, surprises, but also this sort of pressure on whole systems would be very important, and the health community will have a lot to share with the climate community. And again, it should be part of our adaptation research agendas as much as the climate and health research agendas together. So once again, just a big thank you for hosting this event, but also putting all these issues on the agenda for long already. I think the world has waken up too late, but it's good that that appetite is now there, and we've got a lot to do over the coming years, and really look forward to those partnerships. Thank you.
Thank you very much, Martin. It's fantastic. And as you say, that importance of partnership, of working, in our case, between the technical agency and the IFRC, humanitarian agency on the ground, is critically important. And I think just to carry on that theme of different voices with different comparative advantages, it's a pleasure to introduce Dr. Purnima Prabhakaran. I'm just reading to get your title right, Purnima, Head of Environmental Health and Deputy Director for the Centre of Environmental Health of the Public Health Foundation of India. The reason I had to check the title is we also know Purnima as the leader of the research arm of the collaboration that we have. We have a formal collaboration between WHO and civil society. It has a research arm which Purnima heads. So we're all colleagues in that regard. And I'll just introduce you, Purnima, to give the update from your side. Yeah. Thank you.
Is this okay? Yeah. Thank you, Diarmuid, and hello, everyone. As Diarmuid just mentioned, I have to start off by thanking WHO and the Global Climate and Health Alliance, who co-chair the CSO Working Group on Climate Change and Health. And the work that I'm going to be talking about in the next 5 minutes is under the aegis of the research subgroup of this alliance. And I will be failing in my duty if I don't first acknowledge at the outset 3 important contributors to this work. 3 young ladies, yes, all ladies. Alexandra Ergonova from the WHO, Jennifer Kuhl from the Global Climate and Health Alliance. Can I use that one, if that's okay? Hello? Hello? Is this okay? Yeah. And Dr. Richa Sharma from my team back home in the Public Health Foundation of India, without whose contribution this work would not have been possible. And last but not the least, a very committed group of volunteers from the IFMSA. Nothing is possible without the IFMSA's contribution. So let me start with this. So this was work that started way back on the sidelines of the last COP, when we were meeting and discussing what the agenda for this research subgroup should be. And next slide, please. So Diarmuid pointed us to this report that WHO had produced in 2009, which looked at protecting health from climate change, global research priorities. And this was a report that had come out of a very consultative process. And we were wondering what happened since. Since 2009, was there anything that had changed in the research world connecting climate change and human health? So we started off on this journey of documenting if anything had happened since 2009 in the last decade. So this group set out with the inputs from the research subgroup to develop a search strategy through a very consultative process. And we started out with a literature review, somewhat like a systematic review, but we looked at 3 databases. We looked at 3 databases, PubMed, Embase, and ScienceDirect, because we were looking at basically targeting the medical journals. And we looked at what had happened in the 10 years, 2009 to 2019, using some keywords for our search strategy. Next, please. And this is what we found. There was something like a little over 10,000 articles that said something about climate change and health. And as is the usual process in a review, we filtered those articles to bring out all the duplicates, things that were not exactly looking at human health, but we still landed up with about 2,000 articles, 2,181 to be precise. And with the support of these three organizations, WHO, GCHA, and Public Health Foundation of India, we started looking through these articles, looking at the state of research, what were the areas that the research was looking at, what was the geographical distribution of this research, and also trying to come up with what were the gaps in research. So next, Alexandra. So the last report, in 2009, had looked at 5 priority areas, and these were health vulnerability, health protection strategies, health impacts of adaptation and mitigation, decision support systems, and research that looked at financial implications of climate change. And what we did with these 2,000 odd articles was try to categorize them across these 5 categories, because this is what that last report had advised. Research needs to be done across these 5 priority areas. And I'm not getting into the details of this, but this is basically the distribution of the research across the 5 priority areas. A lot of it on health vulnerability to climate change, a little bit on support systems, and a smaller amount of research on health protection strategies and health impacts of adaptation and mitigation. That's the kind of distribution we found. Thank you. Alexandra, next. Yeah. In terms of actual thematic areas of research, we saw that there were some publications that looked at mixed impacts of climate change, but a lot to do with temperature-related hazards. So when I say temperature-related, a lot to do with the extremes, which is the heat, but there was also some looking at the cold, the temperature, the other extreme of heat. And you can see the little research that's happening in the other areas: diet, maternal and child health, mental health, infectious diseases. A little bit more in infectious disease, but I guess not enough, about 300 articles. There was also a little bit of research in the vulnerable population groups, the SIDS, the small island developing states, the extremes of age, migration and displacement. So this is kind of a bird's eye view of what the research looked like in these 2,000 odd articles over the last 10 years, actually. Thank you. We also wanted to see what the geographical distribution of this research was like, and no surprises there. A good amount of the research was from Europe and North America. We had a lot of research from Asia as well, but you can see the lack of research in the other regions of the world. And this reminded me of the 1090 rule of the Global Forum for Health Research, where only 10% of the resources go into the places that have 90% of the disease burden. This kind of mirrored for me in the climate change and health research as well, the 1090 principle. And I think that's what we were looking for in case people are looking to see where the finances need to go in the coming years in terms of building the research base, the evidence base. Here is the answer. I think the needs-based research is what we require. It's a lot of the most vulnerable countries that actually don't have the evidence base. So that was enlightening for us from this work. Alexandra, next. So really, this is the top-line messages in terms of the gaps in research. Most of the research was focusing on the health impacts, on the vulnerabilities to climate change. There was little to do with migration research or the effectiveness of adaptation measures. Most of the studies were conducted in the high-income countries. No surprises there. We did not have the time or the resources to go into actually, look at who the first author was, where was the first author, where was the last author, were they in universities in the in Northern America or Europe. But largely, we could see that this was research in the global north. And in terms of financial estimations, there's more research that needs to be done. We didn't find too much research on gender disaggregated data. And I think the more we think about the gender lens of the impacts of climate change, we realize that there are a lot of gaps in that space. And I think we need to put in more resources for that. So the full report, I think, is there a QR code? So I think this is what it's looking like. We do have just the one copy, but going forwards, I think we're going to have a QR code for people to access this report. And that's the first look today that we have of this report. So thank you so much for your attention. That's really a whistle-stop tour of what we did over the last 1 year, but I hope it's going to give us some insights into where our resources need to go in the coming years. Thank you. Thanks, Jeff.
Thank you very much, Purnima. That's really excellent. I hadn't seen the final summary of the results, but that's really useful. And just to add one additional detail to that categorization that you mentioned at the beginning is not something that we invented from WHO. That was actually in the first World Health Assembly resolution on climate change in 2008, which we didn't write. The countries wrote that. That's what they asked for. And I was quite struck by that result, which we'd seen about 10 years ago, which is quite a lot of work now on the impacts of vulnerability. So quite good at telling people what the problem is, much less good on telling them what to do about it. And I think that's a nice setup to the next speaker, because one of the other things that the UK government, the COP presidency has been quite visionary, I think, about is within its health programme, within this COP, it has a new initiative effectively on applied research on adaptation. And I think that's what we're going to hear about from Jessie de Maria Kinney, who's the head of Secretariat at the Adaptation Research Alliance, which is basically managing that process. So over to you.
Great. Thank you very much, Diarmid. And welcome to everyone. Excellent. So as you've heard, and as you've heard also from Martin here, we've just had the formal launch of the Adaptation Research Alliance, which is a global coalition of over 90 organizations across 35 economies. And our membership's made up of researchers, action funders, research funders, practitioner organizations, policymakers, and end users as well. We envision a future where the research community is a highly valued partner as we co-produce research with and for policymakers, practitioners, and vulnerable communities to strengthen resilience in these communities who are most importantly on the front line of climate change. Next slide, please. As you can see here, here's our mission, the ARA mission, which is to accelerate and scale investments in action-oriented research in developing countries. And really, this is prioritizing the most vulnerable, while also building their capacity across the spectrum of research to action. And this will also then thereby strengthen the research and implementation linkages, which is so critical. And I believe Martin also mentioned that here as well. Also importantly, as we recognize there are still many unknowns, hence the need for research. And as we've heard today here on health particularly, there's a need for learning and learning while doing as we're doing our adaptation options. Next slide, please. So one of the work streams that the ARA has been carrying out over the past few months is a consultative process. And it's one of the 6 work streams. These particular consultative processes were carried out from July to October, and they're also intended to link to the Adaptation Action Coalition and the COP26 objectives. But ultimately the objective of the consultative processes is to actually identify research needs and research opportunities. For this first proof of concept phase, the Adaptation Research Alliance chose 4 topic areas, which you can see on the screen. Food systems with a focus on smallholder agriculture, climate risk assessments and LDC with a focus on national adaptation planning, not NAPS per se, but that national level planning and strategy, and gender and social inclusion. And also most relevant, of course, to us here today is on global health with a focus on climate resilient health systems. Each of these 4 topic areas had a delivery lead who pushed the process forward. And in the global health area, this was co-led by the Red Cross Red Crescent Climate Centre and also by Public Health England at the time, and now formerly the UK Health Security Agency. So yes, next slide, please. What I'd like to really do here is just highlight a bit the process, but also touch on some of these key messages. So first, the process itself convened 68 experts from NGOs, policymaking organizations, and academia across 6 different continents. And the process used the WHO 6 building blocks and the 10 action points from the WHO operational framework for an overarching guiding framework to organize the wide-ranging ideas that emerged from the various consultations. The consultations were held through surveys, key informant interviews, as well as larger group consultations amongst this expert group. And as you can see on the slide, we have 3 key messages that emerged from this consultation process. The first one is really there's a greater what is required is a greater effort to improve the understanding of health systems and particularly with regard to climate resilience globally. And this is actually saying that we must integrate the thinking of climate and health as one, particularly within the concept of adaptation and the adaptation space. Second, very importantly, and this is very core to the Adaptation Researchers Alliance's mission, is how we do the health systems implementation research is just as important as actually what we are researching itself. So it's the way that we do research, because we don't have time now, given the science, there's a certain scale and urgency that we must respond to, and therefore how we do the research is critical. And the third key message is that we must have a sustained and substantial investment in adaptation research for health systems, and this must occur at a global stage, but then of course work down through national, subnational, and local levels. Next slide, please. And the last slide here, really just to wrap up with, is the priority areas. So those first three were key messages that came out of the consultative processes itself, and then these are the priority areas where we do have a chair's summary, which is a short report that you can find on the Adaptation Research website that's available now. But to highlight some of these key areas, the ones that came out, again, of this process were the need for climate and health financing. And again, this is that key message that came out I just mentioned about the need for the sustained investment in climate resilient health systems. Also, the importance of leadership and governance. And here's really, again, this idea of working across sectors, working across areas, across levels, and breaking down the silos. And one of the aspects that came out here is actually a need for understanding the different types of risk information that are needed to actually inform decision making. The third point was on health systems, and this was really looking at understanding better what actually the impacts on the health system are in today's changing climate in the future, and actually what type of adaptation would be required for those health systems themselves. This then is very linked to the need for health vulnerability and adaptation assessments within health systems and the health sector, and an integrated risk monitoring and early warning systems as well that are related to health and also health systems themselves. Another point that came out here was really about people, the health workforce. When we talk about health systems and climate resilient health systems, we are not just talking about infrastructure, we're talking about people. And so the health workforce was really on the frontline staff who are actually exposed to the changes in the system, the impacts that are being suffered due to climate change and how they impact the system. They also require certain training, sensitization in some case, but also investment in resources and capacity. Another area was climate and resilient sustainable technologies and infrastructure. So again, this goes more to the infrastructure aspect of the actual health systems. And then the third was on service delivery itself. So this came down to three particular areas that were covered within these potential priority areas for research, which was emergency preparedness and management, the climate-informed health programs, and then the management of environmental determinants of health. And again, this is just an overview of what emerged from the consultative process itself. Please do find out more on the Adaptation Research Alliance website. And I'd like to hear from the panelists about this and, of course, the other studies as well.
Wonderful. Thank you very much. I think we've had a great setup. We've had a review of the current state of play and the published evidence. We've had the consultation with the wider community on what they think the priorities are. And it's now a pleasure for me to hand over to Dr. Lucy Chappell, who is the Chief Scientific Advisor at the Department of Health and Social Care here in the UK. Over to you.
Thank you very much. I'm just going to swap so that I can see the people on the screen, if that's all right. Thank you. So welcome, and thank you, Dermot, for that introduction. So I'm just going to introduce the panelists, and we have today Beth Thompson. Have we got one other microphone? Lovely, Beth. Could you just introduce yourself, Beth? No, I'm not on the panel.
Good afternoon, everyone. My name is Beth Thompson. I lead Welcome's policy team. And Welcome, you may not have heard of, but we're an independent research foundation. We're there to support the science that can really solve the key health challenges of today. Climate and health is one of those, alongside infection and mental health. So this issue of how we fund climate and health in a way that delivers action on the ground is so important to us. I'm looking forward to the conversation we will have. Thanks.
And Jairaj Kalsi, would you like to introduce yourself?
Good afternoon, all of you. Can you hear me? My name is Devraj Kursi. I'm an epidemiologist with a wide background in trying to combine science, society, environment, and human being together. I take a holistic approach. I'm an interest in climate change. I'm working on a report for health and climate change for Africa. It's part of a global academia's enterprise where all the academias of the world are linked together. And we will be presenting that tomorrow. So I enjoyed the presentation here, and I look forward to contribution. Thank you.
Thank you very much. And on screen, we've got Professor Christine Ebby. Christy, can you hear us?
I can hear you just fine.
Let's just see if we can get this audio to work. I'm not hearing anything from Christy.
Can you not hear me? I can hear you perfectly.
Yes, I think I...
All right.
Yeah. Thank you. Christy, would you like to just introduce yourself?
Thank you. I'm Christy Ebi. I'm a professor in the Center for Health and the Global Environment at the University of Washington. Been working on climate and change and health issues for about 25 years. And thank you so much for facilitating this remote participation. I really appreciate it.
Thank you.
And thank you to all the panelists for the presentations.
Thank you. And Juan Pablo Uribe is also joining us virtually.
Yes, thank you. Can you hear me well?
Yes, yeah, I can hear you. Thank you.
Great. I'm very happy to be here and to be joining you in the panel. I'm the Global Director for Health, Nutrition, and Population at the World Bank. And I'm also the Director of the Global Financing Facility, the GFF. And again, a pleasure to be with you.
That's great. So my name is Professor Lucy Chappell. I'm the Chief Scientific Advisor at the Department of Health and Social Care, and I head up the National Institute for Health Research, which is one of the funders. So this conversation is really relevant to me and to many of you because we've got to say how we're going to address this global research priorities that we've heard about and what are the challenges with that. So I'm going to start with a question to the panel, which is about thinking how we enhance research and how we really tackle on the research gaps to support stronger health outcomes. So coming back to this focus on health and really also focusing on resilient and sustainable health systems. So can I start with you, Jiraj? What do you think are these, what topics would you really like to see a focus on moving forward?
Well, we need to do evidence-based research because policymakers lack that information, and in the absence of the data they need, they can argue anything. They can say climate change is not affecting health, or they can say it's affecting health too much. So we don't have that basic evidence-based knowledge, for instance, on exposure level in time and space. We don't have a database to link the disease due to that climatic hazard. And that's especially true for the area that I work in Africa and elsewhere. So we need that basic research. A database is very fundamental. Then we have bottleneck. We have capacity for doing research is limited because of the infrastructure is limited. We don't have trained personnel. Most of the research are done in a parachute fashion. People coming from high-level country, and they come get a publication out, good, great, but there's nothing sustainable left on the ground. So we need to partner with the local people to build the capacity so they can sustain that. These are some of the areas, and of course in academia we give small grants as a seed money as an incentive for young students to do climate-sensitive research. So this is some of my observation.
So can I come to Christy? Christy, you've got a more of an applied health, applied research background. Can you just talk about sort of where you see the gaps now?
Thank you, and I'd like to take a slightly different perspective, building on the presentations and the comments that were just made. When one looks at the analyses of where the gaps are in terms of research on climate change and health, it focuses on peer-reviewed publications, which means it's not taking into account the considerable work that's been done by the World Health Organization, the World Bank, UNDP, and others. There needs to be significantly more funding in that area, but it could be quite helpful for the health sector to take an approach that's used more in meteorology called research to operations, where we do explicitly have those partnerships between the research community and the people who are going to be participating in the research, who are going to be implementing it at the end. And that can be facilitated by centers of excellence. One of the real challenges we've had, as you've heard from multiple speakers, is a very, very, very low level of funding in this area. And partnerships of centers of excellence. In the short term, they may need to be some north-south partnerships to do the capacity and training building we've heard about. But ultimately, having multiple centers of excellence worldwide where we can really move this agenda forward in a collaborative fashion as identified by ARA and others. Thank you.
Thank you. And Juan Pablo, can I come to you about this issue of equity and how you see that, which dimensions are particularly important for ensuring that we weave equity into all of what we do?
Yeah, no, if I can, let me briefly go back to that prior question and share two very concrete examples on the research agenda that I think will complement what was just said by the two prior panelists. One of them, Lucy, has to do with being able to really assess the vulnerability that takes place at the country level. And for that, by the way, the World Bank has been working on a vulnerability assessment tool, which has been already being tested in Pakistan, and it's being now used in other countries like Haiti and PNG and Sierra Leone. But the important part of this very pragmatic research tool is that it really provides specific country inputs for national strategies for governments to follow through. The second example that I just wanted to share has to do with the economic valuation of the relation of climate and health. By the way, extremely important for the next steps of addressing inequalities in the climate change impact and the burden of disease. This economic valuation tool will include very specific aspects of the impact of the climate change and health burden. For example, including diarrhea, stunting, extreme events, and also vector-borne diseases. And this will help countries also build the investment and the policy case to follow through with the needed interventions. By the way, all of these impacts cut across the determinants of health. They operate through the determinants of health, and therefore the dimensions of inequality. Just to conclude with your second question, that need to be addressed are all the dimensions of inequality that we can think about. They will all be affected by this relation between climate change and health.
Thank you. And I think that also really builds on what Purnima was speaking about earlier about considering the financing side of it, not as, in sort of as part of the bigger picture. And Beth, can I come to you sort of from a funder perspective? How are you approaching these sort of research gaps and thinking about where you're going to focus?
See, as Wellcome, we're thinking about climate and health broadly. So this goes beyond the impact on health systems, which is important, but we need to think about the impact that climate change is going to have on health across the direct impacts like heat exposure, but also the impact of extreme weather events and what happens when we have floods. So the waterborne diseases that we see as a consequence, the impact of increased salination of water. We're interested in the impact on food systems. So I think it's important when we talk about climate and health that we think across this broad range. And we've heard some of those things today. We're interested in three particular elements of this, and that's how we're thinking about approaching our work. Firstly, the impacts. So we've seen that there's more research at the moment in impacts and vulnerabilities, but it still isn't enough. We need more of that so that we as climate and health people can articulate the case for climate change action based on people's health and on people's well-being. So this is fundamental for us to understand that better, to be able to attribute the impacts of climate change on health and to do that in a very, very clear way. But the interventions are so important. We need to understand how to mitigate and how to adapt in healthy ways that will promote people's health rather than detract from it. So that's fundamental to our thinking, and that's going to mean doing more research at that interventional level, doing the evaluations, and working really closely with the implementers to do that. So there is no doubt in my mind, and in Wellcome's mind, that this area is chronically underfunded. We need much more funding going into the research on climate and health. Wellcome can make some contribution to that, but we need others in the space as well. But we also need to think really smartly, cleverly about how we fund. And this comes to the points on working with the implementers, working with the policymakers, and building that into research from the outset. So I think that is crucial for our whole community to think about.
Thank you very much. And you know, sort of really looking at this from all the different perspectives that these panelists represent. So can I just sort of build on that by talking about how we allocate resources? Juan Pablo, can I come back to you just to sort of talk a bit more about how we allocate those resources best from your perspective, and then I'll come back to the academics and see what it looks like from their side.
Of course, from the bank's perspective, the allocation needs to follow your initial question about inequality. I want to make a quick reference to the joint negative impact that climate change and COVID are having in so many countries, particularly low-income countries, and within them, the most vulnerable populations. And our knowledge and our research agenda has to have the intentionality of helping countries and also the global efforts close those rising inequalities. We're seeing them in each one of the individual stress determinants like climate change and like COVID. And when they are combined, the inequality gap is even wider. Because of that focus is that we also try to develop strong instruments that can work at the country level, that are country driven, because that inequality takes place at the country level and at the subnational level within these vulnerable countries. And the characteristics of effective interventions at the country level to close those inequalities, and that's where research, by the way, needs to bring inputs, are extremely well known, but very difficult in the day-to-day application, because they need to be country-driven, they need to be sustained, they need to be fiscally sound in order to be sustained, they need to be multi-sectoral when our institutional arrangements at the country level are by sectors, and they need to have strong community engagement. So these characteristics, again, must be in the focus of the research, which again, should also be focused on closing the inequality gap that only increases.
Thank you. A very useful, comprehensive answer. Christy, can I come to you as an academic about what's your perspective on the allocation of research funding in this area, and where we could do more, or where we could see a particular pull from research funders?
As several speakers mentioned, there's almost no funding in this area until, frankly, now in the US, the funding, for example, for the US National Institutes of Health has been less than 0.04% of their budget. When you look internationally at how much funding is going to adaptation from the international funds, we're talking about 0.5%. There's lots of efforts at the moment to start developing research agendas. We've been developing research agendas for 25 years. What we desperately need now is the funding. And there's so many opportunities. There's so many problems that have arisen because of climate change. We see so many impacts around the world. We also see so much effort at the level of countries, at the level of communities, and within the research community to start moving forward in this area. And trying to prioritize is a challenge. It really depends, because we know that the risks of climate change for health vary by location. And what you need in the Western Pacific is slightly different than what you need, for example, in Europe. In the end, we need it all. And my advice to the funders is to look at your particular interests and to start with what's urgent and immediate. We see many urgent and immediate needs. We see so many places where people are needlessly suffering and dying from climate change. And also to start thinking about the longer term. that our climate is going to continue to change, and what is it that we need to do today so that we will be prepared for that very different future. Different funders will come up with different ideas. If they have some discussions with each other, so there's some collaboration, that will be very, very beneficial. But ultimately, we need to really get moving quickly. Every action is going to help. Every area of focus is going to be useful. Thank you.
Thank you. And Diraj, from your perspective, what is it that academics need most from the funders at this point?
Like I mentioned, we are bottlenecks in the research agenda. We have the plans, but we don't translate that into action. One of the things, like I mentioned, is the limited capacity. So we need strong partnering. Money is required, but we require more than money. We require the capacity to do it, the training, the manpower. We, for instance, sometimes give a small amount of seed money to young scientists who do case studies and bring them out to policy level. But of course, we need to generate country level specific national data, regional data, global data. And for that, we require more substantial funding.
And just to go a bit further, because sometimes the resources are financial, which we've talked about, and I think it's really right to focus on the researcher capacity building. Can I just ask the panel about sort of science and technology? So how could we best harness technology? Beth, do you want to pick that up?
We have some very strong climate data around the world. There's great meteorological data. We're not very good at joining our climate data up with our health data. We have pockets of good health data around the world, but we also know we have big data gaps in the places that are most vulnerable and the places that will see the greatest impact. So from our perspective, it's so important to be able to build the data resources and the data infrastructure in the places where this counts. And this speaks to the inequity at the moment between the global north and the global south in terms of where the research is performed. So there is a researcher capacity gap, but the data capacity gap is huge as well, and a really important one to bridge.
And just from other panel members, is there more that we should be doing in terms of working with the sciences industry, the life sciences industry, and other industries in this area? How do we take these public-private partnerships with us? Juan Pablo, have you got a perspective of that from the bank?
Yes, the public-private partnerships should be a very important strategy to try to bring quick innovations at the country level, and that can be working almost immediately in improving a lot of these responses. The COVID pandemic has brought these important disruptions in terms of technology, by the way, even in primary healthcare settings. And it will be interesting to see how we can overlap those with the needs derived from climate change. There may be an opportunity there. But I wanted to add a little bit more to that discussion on the financing of these excellent ideas. For example, bringing technology to help us close these gaps in a faster way. We just finished an economic analysis of countries titled From a Double Shock to a Double Recovery. And what is very impressive of the results, Lucy and other panelists, is that more than 50 of the countries studied, almost all of them low-income countries, will not be able to get to prior COVID public expenditure levels in the next 5 or 6 years. So we need to be very realistic. We understand the incredible needs out there, but we also, as was just said before, we need to prioritize and be very conscious of trying to do the best with the investments and the capacity of resources we can mobilize, making sure again that those research are research that can be translated at the country level into concrete policy actions that will have an impact in the well-being of people. I just wanted to highlight again that incredible fiscal pressure that most of the countries are going to be facing, and the need for a lot of realism in prioritizing at the country level.
Thank you. And that bridges nicely to the next area, which is to think about policy. because it's not enough just to do the research, it's about how it's translated, both into policy and through implementation. Beth, you head up the Assistant Director of Policy at the Wellcome Trust. How do you see this translation and this pull from research into policy?
The link between research and evidence and action is nowhere near as strong as it needs to be at the moment. And there are some mismatched incentives between what the academic community wants to see and what a policy community wants to see. And I think it's so important that we learn to speak each other's language to align better what it is that's important to us. And this is not an academic pursuit at its heart. It's about making a difference to people's lives. So we have to build that thinking into our research from the outset. That requires funders like Wellcome to change how we do things. And we're not great at thinking about how do we include policymakers at the start of the process. Wellcome has started to do this, and we've been, through some of our funding, trying to bring policymakers into the process. But I think it's somewhere we as a research community have much further to go to be able to build those bridges and to truly understand and build the needs in so that we're answering the questions policymakers want and therefore creating answers that they can use and do something with. So I think we understand the problem to some extent, but not well enough. And it's an area for urgent action because, as Chris says, this is an urgent issue. It's about making change.
Thank you. And Christy, can I come to you and ask you how, as a researcher, do you approach thinking about your research being implemented or your research going into policy? How do you do that at the start of your research project, not at the end? What would you say to other researchers in this area?
It's an excellent question, and I would actually put my remarks more towards the funders. I do happen to know that Dr. Dominique Charron is in the audience at IDRC, and IDRC has a long history of thinking about how you ensure that you're going to have research to action and that there are funding opportunities. Dominique, I'm sure you can explain this much better than me, but there's funding opportunities to help build your teams before you have the call for proposals. So you can have the time, as we heard about before, to do the capacity building, to work with the communities, to work with the policymakers, and so that you do really understand what is needed. And then you're ready to put together a proposal that will cover the research, that will cover the implementation, and importantly, ensure that there's uptake of the research and that you've got possibilities for scaling up, because we desperately need to scale up what we've been doing so far. And so thinking a bit differently about how research is conducted, how it's funded, and to reframe a bit how we go about this process, I think would be incredibly beneficial, because then we would start our research projects with the partners we should have, with the capacity built on the ground, so that we can collaboratively address whatever question is we're trying to address and know that we'll make a bigger difference in the long run. Thank you.
Christy, I think that's very powerful and words that we can all take away. And Dheeraj, from your perspective, how do you see that what has been called a pipeline of research, but I visualize it as a translational circle of research. How do you see that from your perspective?
I think what we need to do is agree with the previous speakers. When you do research, you're doing it for a purpose. And you need to know what the purpose is. You need to do a needs assessment. And in the needs assessment, we include everybody on board. The policymakers, the implementers, those who need the capacity. Then we see what direction we need to do. And there's ownership in that policy, in that evidence that we produce. That evidence can then be made into policy. But everybody feels they contributed something, they feel an ownership, and it's a much more bigger chance of surviving than a standalone silo research.
Thank you. Well, I think that's covered a really broad area, but most importantly, if you look at the panelists, it shows how we need all of these different components, and it needs all of us coming together, both from our previous speakers and from all of you. So thank you very much. Just to reflect on some of what we've heard this afternoon, I think over these days we've heard a lot about COVID-19 as a health emergency and the parallels with climate change as a health emergency for now, but also talking about how they have overlapped and intersected and sometimes amplified the existing health inequalities. So I think we've all got to say what do we learn, and how do we learn from those and move forward so that we have sort of joint impact in both dimensions. I think it's been very helpful to see the work on the global health research priorities, and I think many of us will go away and look at that in more detail. And particularly that focus on solutions. It's important to describe it, but we are also in this meeting talking about how we go beyond the description and talk about sort of interventions and very much at a stage for that. And to how we've discussed focusing on research, how we do it, and the financing. Because many of us here will be researchers, and we should be leading the way on making research delivery from the design, delivery, and dissemination stages more sustainable, because we should lead from the front on that. I'm really clear. So as Chief Executive of the National Institute of Health Research, I'm really pleased to say that we are committing to further funding on the theme of sustainability, which will go across our programmes. And because we recognise that it's a global health issue, we are also focusing particularly 20 million on a call into the global health research arena, and using a sort of the partnership model that a lot of us have used for global health research. It is not done from, as we've heard, it's not done from the global north to the global south, quite the opposite. If it doesn't start with the communities that are most affected, it will never be effective research that is implemented or goes into policy. So I think this afternoon we've heard about the entire sort of translational circle and how it's going to, how it's relevant. And really that on this sort of Science and Technology Day, research underpins, provides the evidence that should be translated into policy. So thank you very much to all the panellists and to the earlier speakers. I think we've heard lots of food for thought, and I hope that we take this away and think about how to make it happen. Thank you.
The impacts of climate change and natural hazards on women and men can strongly differ due to existing gender inequalities. Studies show that this is caused by unbalanced power structures, discriminatory laws and customs, and unequal access to and control over resources. So when a disaster strikes, men and women often face different risks: shortages of food, a lack of privacy and safety, and gender-based violence are some of the impacts women tend to be more exposed to in post-disaster contexts. Yet, countless examples show how reflecting on the social construct of men and women can be an extraordinary asset. In the context of the Hurricane Mitch in Central America, women have been taking an active role in what are traditionally considered male tasks in responding to disasters and have considerably enhanced the resilience of the people. But although the gendered experience plays a major role in the disaster context, what do we really know about it? If women, men, and children are impacted differently, wouldn't it make sense to cater for solutions to their needs? As a response, the Ensure Resilience Global Partnership, at the highest level governing body, unanimously endorsed in September 2020 its Declaration on Gender. This signals to the international community the need to recognise and prioritise gender dimensions in the risk finance and insurance sector. To do so, the partnership established a unique platform for coordinating efforts. Welcome to the Centre of Excellence on Gender Smart Solutions. Our platform generates and collects the latest research.
Okay, welcome, Excellencies, distinguished delegates, ladies and gentlemen, dear friend. Welcome to this important discussion at the Health Pavilion on addressing adaptation through strengthening health and protection system. I'm Angela Bascheria, I'm the Population Dynamic Advisor at Eastern Southern Africa Office for UNFPA. I will be your moderator today. Let me acknowledge a representative from the government of Zimbabwe and representative from the Foreign Commonwealth and Development Office, colleague from WHO, United Framework Convention on Climate Change, and colleague from the Adaptation Fund and Queen Mary University. We have joined forces today to organize this session to highlight the importance of system-level response for adaptation and the necessity to integrate sexual reproductive health and rights to ensure that we truly address the needs of women and girls in the effort to adapt to climate change. A warm welcome to our participants online. This session will be fully hybrid, so one can participate remotely, and so we ensure the conversation is inclusive and we hear all voices. So to our participants online, please, you can introduce yourself by tapping your name and affiliation, and feel free to post comment. We try to pick up some comment at the end of the session. But without further ado, let me invite Dr. Julita Onabanjo. She will be joining us online through Zoom platform. She's the director of the technical division. Dr. Julita assumed this position in August 2021. UNFPA is delighted that she's now leading the technical work. Prior to this role, she was the head of the Eastern Southern Africa Regional Office, where I'm based, and her strategic leadership contributed towards ensuring a common Africa position on population and development issues. UNFPA, alongside the success, Julita also championed the work on climate change. So, Dr. Julita, you're most welcome. The floor is yours. I believe that you're going to join us on the Zoom platform on the video.
You can hear me. Distinguished delegates, colleagues, and partners, really good day from New York. I wish I was there. But let me join Angela in thanking you for joining us today at the Health Pavilion in Glasgow, and to all those who are joining in virtually. A special thanks to our partners and to the representatives. I think, Angela, you spoke of the Zimbabwe COP26 delegation. UNFPA, the United Nations Sexual and Reproductive Health Agency, really values strong collaboration and really acknowledges the dedication and action being taken on climate adaptation and mitigation, including through strengthened health and protection systems. Allow me to start by asking you to imagine with me. Imagine a frail, undernourished, pregnant Sahelian child bride who goes into early labor. She leaves her village in the 42-degree scorching heat, reaching the nearest maternity unit after many hours of travel on foot. The delivery room is as hot and dusty as it is outside, and there's no water supply, and she's thirsty. Imagine then that the midwife, who is to assist her during birth, is also suffering from the same extreme heat conditions. Dear partners, global warming is changing life as we know it. An increase in 1 degree Celsius in the week before childbirth corresponds with a 6% greater likelihood of stillbirths. Climate-related emergencies cause major disruptions in access to essential health services and life-saving medicines, including contraception and HIV medications. Air pollution is linked to poor maternal and newborn health outcomes, and global warming is associated with the increased spread of vector-borne diseases such as malaria and dengue, which can increase the risk of spontaneous abortion, premature delivery, stillbirths, and low birth weight. Partners working at the intersect between health, including sexual and reproductive health, gender, and climate change. I think we repeat these facts. We almost know it at script, because the evidence and science on the direct and indirect impact of climate crisis on safety and security, on rights and well-being is clear. And indeed, that science and that evidence is growing. In 2019, the cyclone Idai and Kenneth catastrophically impacted more than 1.7 million people in Mozambique, Malawi, and Zimbabwe. In Mozambique alone, they caused major damage to more than 110 health facilities, leading to severe disruption in health service provision. Indeed, in affected districts in Mozambique, access to the nearest health facility within 2 hours travel time reduced from about 78% to 52%. And I'm glad our delegation from Zimbabwe will speak to their experience and efforts. I think in addition to climate change and the climate crisis, we know it is a multiplier of existing inequalities and vulnerabilities, impacting the ability of women, girls, and other marginalized populations, including persons living with disabilities, and their ability to protect and uphold their rights. And as climate impacts on livelihoods and economic security increases, so do the risks of the prevalence of gender-based violence, including domestic and intimate partner violence and child marriage, HIV infections, school dropout rates, and indeed with the current COVID pandemic, these have been further multiplied. So dear Excellencies, partners, really in this decade of action towards the 2030 Sustainable Development Goals, the evidence must make our actions clear and urgent. Climate adaptation efforts must ensure climate resilience, health, and protection systems. And this must include prevention, preparedness, early warning, and early action approaches. But these systems remain chronically underfunded and are already under pressure from ongoing COVID-19 pandemic. This has weakened the adaptive capacities of communities and countries with dire effects for women and girls. And so adequate, predictable, and urgent climate adaptation financing is therefore really critical to make health and protection systems more resilient to climate change and indeed to other simultaneous public health shocks, such as future pandemics. Partners and colleagues, COP26 and all other COPs must not leave health and gender out. By doing so, we risk leaving women and girls even further behind. To drive this work, UNFP has put forward a multi-pronged approach integrated into climate adaptation strategies to ensure the continuity of SRH services and functional protection systems to prevent and respond to gender-based violence, reduce risks, and ensure better preparedness and strong emergency response to meet the SRHR needs of those impacted by, displaced, or at risk of climate crisis effects. And we have placed women and young people at the center and as partners and leaders in this effort. Allow me to have you all return to the pregnant girl from the Sahel. But this time, imagine she's much older, better nourished, has attended antenatal care, has a good social and community system to support her getting to the facility. She's giving birth in a well-ventilated facility with portable running water, well-prepared, adapted, and resilient to adverse climate conditions. And you will all agree with me, this is the scenario we all want to see. So allow me to end by proposing 5 actions we can take collectively, recognizing that I know the conversation that's to follow is going to be rich and will enrich us even more. But first is the need that we all have to take to ensure that countries have costed national adaptation plans, and even better still, the NDCs, that integrate health, but specifically SRH and reproductive rights, and tackle gender vulnerabilities, including gender-based violence and child marriage and FGM. 2, we really need to build the knowledge, and I really want to recognize indigenous knowledge on adaptation, but also the capacities of communities, social protection, gender, and health workforce, including our midwives. What they need to know on climate change and related health risks is going to be key in our adaptation. We need to strengthen, and this is the 3rd, the resilience of our logistics systems and promote really innovation and research in medicines and supplies. One example being the work that we at UNFPA and WHO are currently doing on heat-stable carbetocin to prevent postpartum hemorrhage. We need to set up climate-informed health and early warning systems, able to alert communities and health facilities for early response. And I think finally, we really need to collectively advocate for stronger political will, commitment, financing, and action. Adaptation financing must work to strengthen systems and communities, to make them climate resistant and uphold rights and choices for everyone, everywhere. And I know we will hear, I definitely know from Queen Mary on the NDCs and the lack of comprehensive range of actions needed to build climate resilient health and protection systems, especially for SRHR and GBV. So we are behind. Please let future rounds of NDCs, NAPs, and COPEs do better for women and girls. Our objective today is just that, to raise awareness amongst all stakeholders on the need to strengthen health and protection systems as key climate adaptation response, and to call for that climate financing that allows countries to build resiliency and adapt effectively. I know you will all help make this happen. We call on you and we count on you. I thank you, and back over to you, Angela.
Thank you, Dr. Jolita, for these inspiring words. Next opening remark will be from Dave McConaughey. He's a health advisor at the Foreign Office Commonwealth Development Office, and he brings 12 years of experience in national and global health, and he's currently leading the health program at COP26. Dave, warm welcome. Over to you for the opening remarks.
Thanks very much. I mean, this might be quite a short speech, actually, because the presenter before me just presented such a comprehensive argument for why it is we should bring in sexual reproductive rights into the conversation around health systems. But I'll talk a bit about, I think, why it's been important to us. I'll talk a bit about the COP26 health program and why and where that came from, and hopefully I'll offer some optimism in terms of where this is going, but also maybe a few words of maybe not caution, but maybe some of that forward thinking about how it is we integrate sexual reproductive health and rights within climate resilient health systems so they don't get left behind. It's also really nice to be. I think it's the first time I've been on a panel where you could definitely say we've got the gender balance right. It's not often you get to say that, so that's really nice. So why is health so important for COP26, and why have we pushed it at COP26? And the reasons, many of them were covered by the speaker before, and in a really lucid way. But it's basically the climate crisis is a health crisis. The outcomes are health outcomes. You live shorter lives, you live them in worse health, you achieve far less, you've got poorer mental health. And so if you're tackling the climate crisis, you're tackling health. But also, health is a really good argument for change. So you can present health as really tangible outcomes that people can really see, feel, and touch in the near term. And sometimes, we had a presentation, I made the same point earlier, is sometimes a political commitment or an argument is sometimes difficult around climate change, because it's very hard to take an action and then see what the outcome of that is. But actually, the outcomes are health outcomes. As you shift food systems to be less shift diets, so there's less meat, or if you shift your transport over to more active forms of travel, you burn less fossil fuels. Well, of course, you get less cancers, you get less cardiovascular disease, you have better mental health, and you live longer lives. So why is that important for women and girls? Well, that's particularly important because, as you guys will already know, I think, that the climate change is a driver of health inequalities. And it's the most vulnerable, who've got the least resilience, who will suffer the biggest impacts. And even more unfair than that, it's normally the communities who've polluted the least. And women and girls are right at the top of that. We already know that in disasters, women and girls are many, many more times more likely to die than men and boys. That's a fact. Climate, as the climate crisis exacerbates, what we're seeing is reduced access to healthcare services, whether that's because of increased demand, because of excess morbidity and mortality, or it's because of damaged infrastructure. What that will mean for women and girls is unintended pregnancies, unsafe abortions. We'll see mothers and babies die because of lack of access to basic services. So it's absolutely critical. So what have we done in COP26? And I say this, and I always forget to talk about who we are. So we are the COP26 presidency, so as the UK government as hosts, but with our really key partners, WHO, Healthcare Without Harm, UNFCCC, Climate Champions teams, and also many of the governments I've been working with around the world. So what have we done? So we've come up with essentially 4 initiatives, and I'll briefly scan over 3 of them and talk more about the one we're really here today to speak about. And that's around health professional advocacy. So how do we use health professionals to really raise the voice for the impact of climate change on health, to drive for higher ambition at a bigger scale and faster pace? How do we recognise that there's big gaps within? We recognise there are big gaps within the research, particularly on adaptation, and how do we shift that agenda forward? And so we've been working with the Adaptation Research Alliance to really advance that research agenda and push forward our research agenda, particularly in climate resilient health systems, but also a wider breadth of work. And then the final 2 are around the health system. The first one is around sustainable low-carbon health systems, recognising that health systems are contributors to carbon emissions, and that we need to step forward and address that in how we build forward our health systems. But the flip side of that is around building climate resilient health systems. And we're recognising that health systems are incredibly important to protect people from the impacts of climate change, and particularly with women and girls, to give them access to the services that they need, whether that is contraception services, giving them the right to choose, giving them control over their own bodies. But they're also extremely vulnerable to climate change as well. And we need to build health systems in their own context which recognise the current and future climate risks and are built to address those risks. So we've asked governments around the world to make 2 commitments under this. The first one is they commit to carrying out something called a vulnerability and adaptation assessment, and this is a tool or methodology that's existed for many years, developed by WHO, and essentially it gives a health system a systematic understanding of where it's most vulnerable to climate change, where it's got adaptive capacity and where there's gaps within that adaptive capacity. The second thing we're asking to do is to make a commitment to publish a plan which sets out how they're going to address the vulnerabilities that have been identified in that vulnerability adaptation assessment. And what I'd say is, so we've been doing this for several months now. When we released the figures today about how many countries had stood up to make those commitments. So in total, 50 countries have come forward to make those commitments. Of those, 49 of those were around climate resilient health systems. So overwhelming support to do this and move this forward. And that's a massive political commitment to this. However, what I would say is sexual reproductive health and rights really need to be integrated within that approach. And if we don't plan it into that approach, it will get left behind. So we need to really think about how we do that. We really need to engage with that. And we need to think about, when we're talking about resilience of health systems, we need to think about access to health systems as we move forward. And women and girls need to be really at the top of our list in terms of understanding where they're vulnerable to climate change and how health systems will address that. But we need to have that conversation. We need to be very vocal about that. And we need to put those discussions and women and girls right at the forefront of the policy, the strategy, and the finance as we move forward on that. And so that's really the next challenge. I mean, it's a challenge for us as the UK government. It's a challenge for the countries who are doing that. But it's also a challenge for civil society as well to really push that voice forward so that it can't be ignored as we develop health systems which are resilient to climate change. Thank you very much.
Thank you so much, Dave, for this inspiring word, and also congratulations for the work of the presidency. This is the first year that we have a COP, a health pavilion, and actually a health program, so congratulations on that. So let's move into the panel discussion. And we have an exciting lineup of speakers. Let me start with introducing you the first panelist, is Heather McMullen. She's a lecturer on global health at Queen Mary University, and she's an expert on the intersection between SRHR and climate change, looking from a justice perspective. And she has been leading the work with UNFPA on looking at those issues. And she's going to tell us today the results of two studies. One was on the NDC and another one on a scoping review on child marriage. So Heather, welcome, and the floor is yours.
Thank you, and thanks so much. It's really lovely to be here talking to you about this today. So echoing what we've heard so far, in order for people to be able to respond, adapt, and become resilient to climate change, at the most fundamental level, they need control over their bodies. And sexual and reproductive rights and health is essential to this. So we know that climate change negatively affects people's ability to realize their sexual and reproductive rights and health in multiple ways. And we also know that bodily autonomy and integrity are fundamental to being able to respond to climate change. We often talk about women and girls as a vulnerable population to climate change, but we need to remember that women, girls, people with diverse sexual orientations, gender identities are made vulnerable by systems and structures that discriminate against them and interlocked to oppress them. So sexual and reproductive rights and health are transformational in and of themselves when realized and upheld, and they're also a cornerstone of resilience and gender equality. We can't really have meaningful gender equality if we don't realize sexual and reproductive rights and health. And they take on a renewed urgency in times of instability, in times of crisis, and in the world that we're already experiencing and expected to experience more under climate change. So, how do these intersections come together? What are we seeing in the evidence, and what do we know so far about the ways that climate change is impacting SRHR? So we know that climate change worsens maternal and neonatal health outcomes. We're seeing this in direct and indirect ways, so increases in heat and air pollution are impacting pregnancies, birth weight, neonatal health outcomes. We're also seeing the impact of vector-borne diseases impacting the health of pregnancies as well, water salinity, also just general stress and mental health issues and impacts brought on by climate change too. So we know that climate change isn't particularly good for pregnant women and their babies. We're also seeing climate change result in increases in gender-based violence. So this is in times of stress and scarcity and major pressure on natural resources. And there was a review done by the IUCN that outlined some of that. But we also know that climate change brings extreme weather events and disasters and all of the things that come with that, which also results in increases in gender-based violence, increases in trafficking, increases in sexual violence, and brings in a whole host of protection issues. We know, and I'll talk a little bit more about the ways that climate change exacerbates the existing drivers of child marriage and impacts people's sexual rights and reproductive rights and human rights. We also know that climate change in multiple ways disrupts, the essential access to sexual and reproductive rights and health services and undermines health systems and all of the things that we need to support people to have well-being and to experience good SRHR. And that's in a number of different ways with the different crises that we see brought on by climate change. We know that disasters bring all of the negative impacts of a humanitarian crisis and sort of worsens all of the things described above. And in general, we also know that climate change increases inequality and vulnerability, and particularly for groups who are already facing intersecting forms of oppression. So all of this kind of comes together to paint a difficult picture for realizing sexual and reproductive rights and health, but should also encourage us to be sure that it's explicitly included in climate change policy and all kinds of other policy as well. So a little bit moving on to our review. So next slide, please. So in partnership with the United Nations Population Fund, Queen Mary and myself and some other researchers, some of whom are here today, reviewed 50 nationally determined contribution documents for references related directly to sexual and reproductive rights and health, but also references to gender broadly, health broadly, rights, vulnerable populations, and also population dynamics. And what we found was very few direct references to SRHR, and those references, there were 6, and those were around gender-based violence, maternal health, access to family planning, and also HIV, in the sense that people actually need a certain level of adequate nutrition in order for HIV medications to work effectively. And that was also seen in one of the NDCs. But I think one of the important things to note was that when you actually looked across all of these different thematic areas, what you can really see is that SRHR is, fundamental to sort of being able to achieve what's set out in the NDCs, and it sort of underpins things like health, gender equality, the realization of rights. So there's a lot of opportunity within the NDC documents to make SRHR impacts more explicit. So we saw, out of the 50, we saw 36 of the documents reference gender. We saw most of them, pretty much all of them, have some kind of reference to human health. But on the whole, these references were quite superficial. It didn't necessarily have much depth, and there was a lot of work to do to actually spell out what it means in countries, what it means for the problem scenario, and how we would actually respond to be able to understand better how to improve overall health and well-being. So there is the opportunity to more meaningfully reflect SRHR challenges in climate policy documents. The NAP Global Network and Women Deliver also did a review of national adaptation plans for SRHR references. So these two documents together, our review and the review done by the NAP Global Network and Women Deliver, can give a pretty good understanding of where we are in terms of SRHR and pretty important climate policy documents. Gender-based violence is really a key intersection that we're seeing that should be also included in climate change adaptation policy. And I think what I'd also really like to say is that when you read these documents the way that we did, it becomes also very evident that there's the climate crisis, but also the biodiversity, waste, toxin crisis, and other environmental crises and challenges are all working together, and people don't experience these separately. They're living them all at the same time and negatively impact things like their SRHR. We also did a literature review, a scoping review, looking at the evidence of how environmental crises are driving child marriage. And what we found is essentially it's exacerbating all of the drivers of child marriage. So next slide, please. And what we're seeing is that due to disasters and extreme weather events, families are feeling pressured to marry daughters at a younger age and as a way to cope, as a way to respond, as a way to reduce the financial pressures on the home or secure a safer future for their daughter. It's also in times where of disaster settings to try to protect, their daughters from sexual violence or the violence that can be experienced in these settings. We also see a major disruption to education, and that has a number of knock-on effects in all kinds of ways for a girl's human rights, well-being, and sexual and reproductive rights and health. And we also see a link between child marriage and other harmful practices like female genital cutting. So you can also see FGM increase when child marriage increases, and a sort of number of knock-on effects of harm that actually just further contribute to the marginalization and vulnerability of women and girls. Next slide, please. We did make a kind of conceptual framework for this. So as the environmental crises are more frequent and intense, we see families and communities generally lose the factors that are protective against child marriage and need to develop different coping strategies. And from there, we see this exacerbation of the drivers of child marriage and increases in the negative impacts of SRHR. So finally, I'd just like to wrap up by saying, with the next slide, that strengthening health systems is really important to support the achievement of SRHR, and it is essential for climate change adaptation and resilience. When health systems are weak, we know that it's the people who are already suffering who suffer even more. And SRHR is a really good barometer of how well a society is doing to protect its most vulnerable people. And it also, unfortunately, tends to be something that's kind of not funded enough, left behind, not included enough in policy, and we don't want to see that happen as we go forward in climate policy and climate and health policy. We want to see direct, exact references to SRHR. Quite often people put gender, think that means SRHR. It doesn't. We need to actually also spell out the SRHR impacts and aspects. And the review of the NDCs revealed that, there's a lot more work to do, but also that SRHR is underpinning so many of the transformations that we want to see and that we need. And finally, I guess I already said it, but really including SRHR and health system analysis in some of the ways that we've already heard mentioned, and strengthening climate policy and health action with explicit SRHR is definitely something we can do to help what is looking sometimes like a kind of negative outline of the evidence. So moving forward, I think that these are things that we can do, but I look forward to hearing to the rest of our panelists.
Thank you, Heather. And I just want to underscore the importance of this review. So we were able to follow up with this review with a guidance note, because the review was actually published around March. So we were able to write a guidance note and support country on the current submission of NDC. And we were able to understand what are the bottlenecks and gaps on trying to ensure the country really have a full proposal on the health sector, or on gender, on those issues. So we were able to follow up on countries. So hopefully next year, when we do the revision and of the actual submission, we will see a little bit of improvement that we kind of move forward. But let's move to the next panelist. Is Elena Villalobos from WHO. She's the Capacity Building and Country Support Lead in the Climate and Health Unit. And Elena has been working on these issues from a programmatic perspective. Elena, welcome, and I have a few questions for you. So how are countries progressing in integrating health sector adaptation action? And how is WHO supporting countries to ensure comprehensive health action adaptation plan? The floor is yours.
Thank you, Angela, and thanks for inviting WHO to be part of this important panel. I think we were one of the first sectors that basically realized that we should closely follow the climate change processes at country level. And we were the first sector to develop sectoral guidance for example, the National Adaptation Plan. So basically we adapted the guidance and tried to make it simple for our constituency, basically the Ministries of Health, to understand what the NAP process was and how they could get engaged. So basically, we've been supporting countries to develop plans and strategies on climate change and health for over 10 years now. And recently we launched a survey. We realized that out of 95 countries who basically responded to this survey, 3/4 of those countries have developed plans or strategies, but that doesn't mean that those are linked to the climate change processes at country level. So basically, when we started following more closely this process at country level, what we are trying to do with this health component of national adaptation plans is basically for the Ministry of Health to make sure that they are linked to the national processes, that they are talking to the Ministry of Environment, that they are talking to the Ministry of Water, that they are talking to the Med Services, and that they are aware really about the whole process at country level. So when you look to the same data, even if 3/4 of those countries have developed plans or strategies, only 1/3 of those are considered health components of national adaptation plans with this quality criteria that basically they are talking to others and that they are integrated into the climate change process at country level. So basically, talking about the commitments, no, and the importance that we are playing and that we are giving to climate resilient health systems, I think the most important bit that are related also to sexual and reproductive health and rights is basically how we assess vulnerability at country level. And when we go to countries, basically we accompany the countries, we accompany the Ministry of Health, and maybe we need to make an effort to sit more programs at the table to discuss, to agree on scope, because usually what we say is that vector-borne diseases are a priority, waterborne diseases are a real priority at country level, and this is very easily understood by them. So this is basically their undernutrition. This is what they will basically as a first scope of their assessments. But even though in those assessments, even of course, in my experience, over 40 countries supported to do VNAs, none of them included sexual and reproductive health and rights. But this is something that has to come from the countries. But looking even to the assessments that we support, the vulnerability assessment, no, basically looking at women, men, boys, girls, and how they are going to be exposed, which is the role with regards to water, which is the exposure time to mosquitoes, who is cooking outside, who is working outside, because it's women, but it's also men, no, working in heat stress with no social protection. Basically, there is a weakness that we need to improve and go in more detail to that. And for sure, there is a role to play there to strengthen also the considerations related to sexual and reproductive health, and then overall exposure of women, what we were mentioning before, female sexual and genital mutilation or sexual violence, domestic violence. And then when it goes to the plans, basically we are building on the evidence that they get with their assessments. We encourage them to develop comprehensive plans basically to address those vulnerabilities and to ensure that the health system is going to be able to protect their populations. But the same, I mean, when it goes to the plans, then sometimes they don't go into detail to the specific priorities. They just want to strengthen surveillance, but without going to this level of detail that will be required basically to be able to tackle malnutrition or mental health. Something that is good is that we see a qualitative change. There are more priorities coming up. Mental health before was not mentioned. Now it's coming up very, very highly in the agenda. And hopefully also sexual and reproductive health, maternal and child health is also being more and more prioritized. And I think basically just to reflect also on the point that Dave mentioned, I think what is important is that we need to ensure basically that this is integrated into the overall climate change and health process at country level rather than duplicating efforts, because this is the way that we will also build capacity and governance mechanisms at country level to make sure that this is done in an integrated and sustainable way, and that they are basically just sitting in the table. Yeah. So that's it from.
Thank you so much, Elena, and thank you for kind of outlining the importance and underscoring the importance of data and understanding those mechanisms on national level. We have next on a video that has been recorded from Flo Newman. She's the lead on gender youth at the UNFCCC Gender Secretariat. She's been very busy in the last few days, but she's been very kind to send us a video telling us about the importance of integrating gender into national plan and how UNFCCC is integrating those issues. So if we can now show the video from Fleur.
Thank you so much for the invitation to join this important conversation today. So why is it important for adaptation responses to health and protection to be gender sensitive? I'd start by saying that we know by now that while climate change impacts everyone, it does not do so equally. There are multidimensional factors, including gender, that affect how climate change impacts people differently. The impacts on women and girls, non-binary people, and other marginalised groups of environmental degradation and climate change is often greater or more complex for them, and they often have less access to resources to respond. And when reflecting on these differences, context matters. Women and girls are not a homogenous group. Importantly, the differentiated impacts of climate change on women and men has now been officially recognised under the UNFCCC process. The 5-year enhanced Lima Work Programme on Gender and its Gender Action Plan that was agreed by parties at to the UNFCCC at COP25 for the first time in a decision on gender and climate change recognises with concern that climate change impacts on women and men can often differ owing to historical and current gender inequalities and multidimensional factors, and can be more pronounced in developing countries and for local communities and Indigenous peoples. Importantly, the decision references the historical nature, the persistent nature of inequalities. It is clear that COVID-19 is also having a differentiated impact on women and girls, worsening barriers and gender gaps within the public and private spheres. However, in many places, it has also revealed an enormous capacity within societies to take collective action and support changes to business as usual for the sake of public health. There are lessons to be learned in how publics have responded to the current health crisis. It has also laid bare the fact that many working in the field of gender equality are already aware of. Our economies are underpinned by a vast, informal care economy of unpaid and domestic care work, and also that this is undervalued work in our economy, such as in the health and education sectors, which is predominantly undertaken by women and girls almost universally. This lesson is vital for governments and societies to firstly acknowledge and understand, but it must then also inform future action. Resilience from future shocks, health, climate, environment, and economic, needs to be built into the investments being directed at economic recovery right now. That necessarily means addressing climate change and gender equality and women's and girls' empowerment. These are systems issues that require changes, radical changes in some cases, to the systems. And so how is the UNFCCC ensuring that systems responses on climate adaptation are gender sensitive, and what opportunities exist to strengthen this work? As I mentioned earlier, the Lima Work Programme on Gender already refers to the multidimensional impacts of climate change. Although there is room for improvement, the UNFCCC process is often open to observers to participate through different means, such as written submissions or workshops. At the moment, there is an open call on the UNFCCC website seeking evidence on the differentiated impact of climate change on women and men, and evidence of the impacts related to SRHR would be vital to include. So I would encourage any organisation that has such evidence to make a submission. One of the results of a call for submissions which looked at this topic in a few years ago is, in fact, that the UNFCCC Gender Action Plan now recognises multidimensional and intersecting factors. Submissions will be synthesised in a report prepared by the Secretariat and considered by parties to the UNFCCC at the June session next year. Specifically related to the review of the Gender Action Plan, which is also happening in June next year, parties will be considering if there are any areas that could be strengthened, whether by topics or by activities or both, and whether these could be included in the process. At this COP, parties have agreed on how they wish to be informed about progress on the implementation of the Gender Action Plan, which also includes submissions and a synthesis report. These calls for submissions and reports are more than simply process. They are key entry points for identifying and advocating for activities that could support countries in building resilient health and social protection systems, which in turn can prevent gender-based violence and guarantee sexual and reproductive health and rights. To build support for such activities being adopted by parties, this could happen through many ways, one of which is activities of the Gender Action Plan. One activity encourages parties and relevant organisations to organise workshops and technical meetings so countries can share experiences and exchange good practices on integrating gender considerations in their national policies, plans, strategies and actions. So my call to action is for countries and organisations who are working at the nexus of SRHR and climate change to actively engage in the activities of the UNFCCC Gender Action Plan so that your work and findings also reach decision makers within this process.
From Flora to have on her busy schedule this week, she has managed to send us the video and bringing us the perspective from the UNFCCC. Let's move to the next panelist, and Emily Fadzai-Matingo. She's a climate change scientist at the government of Zimbabwe. She's currently coordinating the adaptation plan at national level. So who better than you to give us like national level perspective? And I have a few questions today, and thank you for bringing your experience into this panel. So how is climate change affecting the health and protection system at the country level? I know UNDC has been quite progressive on this. So what has been the adaptation response that your government put in place? And how you have managed to adapt, you have managed to integrate those issues into your national NDC. The floor is yours.
Thank you very much. Good afternoon, ladies and gentlemen. In response to the first question, I'll start by saying that, as alluded by the earlier speakers, women and girls are no doubt disproportionately affected by climate change in Zimbabwe. And this is augmented by the traditional roles that they have, which place them at a more vulnerable position than their women counterparts, than their male counterparts, sorry. And in the earlier presentation by the earlier speaker, they mentioned the fact that Zimbabwe, as well as Malawi and its neighboring countries, often bear the brunt of extreme weather events such as Cyclone Idai. And when these cyclones happen, they usually damage infrastructure. That means that women and girls are not able to access health facilities. And then this, in a way, affects these rights that we're discussing about here today. And then moving on further, you'll find that there are issues to do with owing to food insecurity as a result of climate change. There's an increase in migration to urban settlements, and also in some instances to neighboring countries as a result of the push factor of vulnerability as a result of climate change, which affects their livelihood options. Now, this has often resulted, especially in marginalized communities, in having child-headed families, where we are having young girls actually heading families, and this in turn then means that they have no time to tend to these rights that we are discussing about here today. So it will also be good for resources to be channeled so that we can ensure that these rights are also safeguarded. Now, moving to the issue of how the government has been responding to the problems as a result of climate change relating to health. I would hasten to say that first of all, the government has domesticated the Gender Action Plan that was alluded to by the former speaker online, where we have also done a gender analysis at national level to establish what are the gaps and needs that we have in place so that we can ensure that we mainstream climate change, we mainstream gender processes in the climate change agenda so that we have our women and girls also participating in the climate space and also accessing accessing those rights that pertain to them. And we have also had the launch of an interesting program that has been running, which is called the Solar for Health, where we are having solar systems being put in place at rural and polyclinics right around the country to ensure that women, when they are giving birth and also accessing other rights pertaining to their health facilities, they are also going to do that where there is sufficient electricity. So it's quite an interesting program that also other countries can tap into, provided if they have abundant solar lighting to also do that Solar for Health initiative. Then we are also promoting water and sanitation hygiene programs to ensure that the women and girls do not have to walk for long distances in search of water, and also maybe in some instances have their rights also maybe protected in that way. Then we have another interesting program that we have also been supporting as it relates to these rights, which focuses on vehicle savings and lending schemes within an integrated system of resilience building, where women and girls in some instances can actually come together to actually be putting resources in place, and then they can be borrowing them in times of wanting to cushion their livelihoods. That way we can have the sexual and reproductive health and rights protected in the long way. And also lastly, to say that in terms of these issues that we've been talking about, Zimbabwe has an issue to do with early warning systems, where we are saying that because we are highly vulnerable to the impacts of climate change, if we can have our early warning systems being strengthened, this can greatly aid the process of mainstreaming gender, as well as the aspects of sexual and reproductive health and rights in the climate change discourse. And I'll conclude by also appreciating the support that we have received from the UN agencies in revising our nationally determined contributions. And we look forward to more support coming in to advance the agenda of how we can actually integrate health and health issues beyond the usual issues to do with vector-borne diseases, but also now the emerging issues to do with sexual and reproductive health and rights, so that we can have our women and young girls also being protected in the climate change, because really climate change is upon us. Thank you.
Really to bring the country perspective and really the experience on how you have put all of these things together at the national level, because climate adaptation is an intersectoral approach, so it's really interesting to see your perspective. We have another speaker online. She's Tasnia Ahmed. She's a member of the UNFPA Joint Youth Working Group, and she's going to bring us the perspective from the youth. I think she's on the Zoom call. And so I will ask you, Tasnia, how are young girls in Bangladesh adapting to the impact of climate change on SRHR and on protection system? And how can country and development partners better enhance protection system to support goals in dealing with the impact of climate change? So I think Tasnia is going to join us online.
Yeah, thank you, Angela. So as a young activist or youth activist, before going to ask with the different kinds of perspectives, especially Bangladesh perspective, when young girls or even the young women are facing several kinds of issues, especially on the women protection, reproductive health protection, especially in the climate affected areas. I want to ask a question to my respected governments, my ministers, my climate adaptation professionals, my public health professionals, academicians, youth activists, and all other investors and donors. So the question is, with alignment with this, the session objectives, do you really think that the existing health facilities or even the safety protection systems is really enough to cover the climate affected areas, especially in any kind of emergency crisis, considering the COVID-19 situations, and more focusedly for the young people and young women or girls, because when we are targeting for the health protection or any kind of protections for women and girls, we have to rethink about their facts, because as I am working in a very vulnerable area and of course in a developed country, the areas are more and more cognitive for those peoples who are actually working in this perspective, because I am that girls where young people are not actually getting that priority, and even young girls are always feels tokenized in terms of policy making table, because my answer is, if we think that these existing policies or even the implementation criteria is enough for us to cover the focus all of this protection or our policy or even our things, then what was happened in terms of COVID situation, when all the youth health centers or even the adolescent health cancer were converted into vaccine centers, or even the COVID test centers, and somehow young girls or women are deprived of getting any kind of reproductive health or even any kind of health issues, because they were somehow very frightened to go outside or taking any kind of service care or any other issues. And finally, if your answer is no, that if you are not enough, that these existing laws or regulations are enough to cover the all health facilities, then what basis our commitments stand for? Because especially on climate change areas, if our commitments are not in a right track, then there is no way to such kind of organizes this conference. Even the end of the day, the concrete solutions or even the global actions cannot be taken on that perspective. We have nothing to make a commitments in this conference. So if as a young activist, if I want to really raise a voice, want to make a commitments, we have to be a very high positive monitoring system in our health mechanism, so that all accessibility of the reproductive life can be ensured, connecting with the adaptability, because when I am not taking the adaptation of my environment, then there is no any global actions regarding this climate actions or aligned with the reproductive health, because when I am actually targeting women, the climate affected areas women are more vulnerable. even they Even sometimes we are mostly focusing on the quantitative facts rather than the qualitative care services, because when we are always trying to increase the health systems, increase the health clinics or many more, but what about the internal, all the the internal care services in the clinics? Because if we are not focusing on that facts, then there is no sense to just increase the health clinics. So we have to be more focused on that points, and even also the protection sites, as the child marriages are increased very rapidly on those climate affected areas. As an example, in 2020 in March, all the schools and college, even all the institutions were closed on that time. And after that, when in 2021 in August, when all the schools were reopened, it was very clear that it was very clear that any teachers on that perspective or on that rules. Even a girl just reported that I have only one girl in my class that I'm taking, because other girls are already got married on that class. So what was the point about the protection sites? Even they are not concerned about family planning or any kinds of things. Then when and where we are talking about this, this family planning or protection systems, then then these are all vulnerable and somehow more protected. So I think in a line, I just want to make a very short, that is, if we want to strengthening these health systems, we have to make more and more capacity strengthening programs for young girls and women so that they can raise their voice from their side, their point of views, and even also take handles from their own protections. And secondly, we have to make more budget for those programs, and we have to make more budget for the women protection programs and women protection health services, so that we can ultimately implement those global actions that we are now actually taking on this COP conference. So thank you, Angela.
Thank you, Tasnia, and thanks for bringing the voice of the youth and bringing us accountable on this, and thanks for sharing and on your insight on this. Let's move to the next panelist, and welcome Sahina Dobratsky. She's a senior climate change specialist at the Adaptation Fund. She previously worked at the World Bank, and she has co-authored a number of books, including Time to Adapt, bringing the insight from the Global Environmental Facility and experience on adaptation and climate change. And she was recognized amongst the 100 women's leader on energy and climate by the White House in 2013. So Sahina, I have a question for you. Only 0.5% of multilateral climate finance are targeted to health projects. And what opportunity are there to mobilize more funding, to make protection and health system resilient, and especially in the context of the discussion that we had at COP? And what has been your experience in accessing financial projects on the contest for SRHR? So what are your recommendations for this?
Thank you very much. If I may introduce myself, my name is Saliha Dobardzik. It's a difficult name to pronounce, and I don't blame you at all. It always happens. This is a topic that's interesting, relevant, and important, but I didn't realize, to be honest, how interesting and relevant it was until listening to the previous speakers. So for that, I'd like to thank you for inviting me to this panel. I think that there is a lack of awareness, general lack of awareness. I mean, I'm not an expert in SRHR, but that is not to say that we're completely oblivious. Rather, it is that adaptation is a multifaceted problem. And there are ways of building resilience that could be labeled differently. And we haven't necessarily, our structure, I mean, in this space, in the UNFCCC space, we haven't really prioritized SRHR. It just hasn't been central to the discussion. And I'm hoping that's changing. Ironically, I think the pandemic has helped sensitize a lot of people to the centrality of public health more generally, to the issue of climate change, or addressing the issue of climate change, seeing the linkages between these issues. But I think also there's been sort of a mind shift towards what's possible and what can be done, or what's possible and what we're willing, basically, to do, and the ways in which we're willing to change. Okay, so but let me mention some practical challenges as to why I think the portfolio of, and this isn't the adaptation, we are a small fish compared to the Green Climate Fund and other sister funds created under UNFCCC. That is not to say that we're small. We're a $1 billion fund, now a little bit more. We had a very successful replenishment yesterday, an announcement of contributions that broke records. So, sorry for that plug. But the reason why, or one of the reasons why this topic is, you could say, underrepresented among the funds is because the countries do not send proposals that are focused on health explicitly, that are not investing in health systems, that are not necessarily including activities related to SRHR. And therefore, we can't fund them. So as far as the Adaptation Fund is concerned, if we receive a proposal that articulates well, and I think the previous speakers have demonstrated on a mini scale, have demonstrated that can be done. If a compelling adaptation, reasoning, proposition can be articulated in a proposal, and I think that can be done, we can fund it. And so it is up to the countries to request the funds on that basis from us. We don't have any concerns. We don't have the Adaptation Fund. I'm not speaking for the other funds, and I'm not including them right now. When I say the Adaptation Fund does not have specific sectoral allocations. So really anything is possible. Okay, having said that, I do want to say a few things about the way we work. Sorry, my notes just disappeared. And I do want to make the point that many of our projects end up supporting health, even if they're not labeled as health, even if we don't track them as according to that. But because the kinds of proposals we get tend to be, well, again, they're country-driven. They're always country-driven, and they tend to be in sectors that are obviously climate-sensitive, such as water or agriculture. Obviously, there are very strong linkages to health. And the Adaptation Fund was founded on the principle of concrete action, direct access, support to the most vulnerable. And so we have projects that target very vulnerable communities, which tend to have worse health outcomes across the board. But also, I would say we have projects that specifically, for example, target communities with high HIV prevalence and other types of diseases as well, more broadly. We have projects that aim to rectify that. And we have safeguards that ensure, one principle among 15, is that our project should not negatively impact public health. Also, the basis on which our projects are designed have to include extensive community consultations, and our projects also need to be gender sensitive. So that means that women have to be consulted on what their priorities are and what their needs are and what their challenges are. And so we have had examples where, the project had nothing to do with, formally, nothing to do with SRHR, but in the course of the consultations, it will be the women discussing the patriarchal society, structures in the society that are, preventing them from accessing resources, preventing them from controlling their, sexual autonomy and having full ownership of their rights, and those kinds of things. And so, I have an example of a project in Rwanda which is called Reducing Vulnerability to Climate Change in Northwest Rwanda through Community-Based Adaptation. And so this project, through these consultations, actually created an opening for family planning practitioners and advocates to explore further partnerships. So again, many of our projects, like I mentioned earlier in agriculture and climate change, have to do with nutrition and food security, and these are things that impact women's health, maternal, neonatal, children's health, and so on. And water security, so with implications, of course, to both access and quality. So these are both really important. Obviously, climate change affects disproportionately women in communities where they're the primary procurers of water, and so if they have to walk longer distances, it has various types of impacts, including some that have been mentioned. And so any project that you could say, generally, any project that builds community resilience, if it's a well-designed project, it by definition builds women's resilience, improves their state, I think the recognition that climate change is not gender neutral is one that the Adaptation Fund certainly has adopted. We have a pretty progressive gender approach with a special attention to women and girls as a cross-cutting issue. And as part of the fund's Gender Action Plan and the fund's focus on the most vulnerable, all proposals that we receive must have specific gender assessment, and the results framework must include gender disaggregated metrics. So these are some of the ways that helps put some focus on women and girls, and perhaps that helps open further the way to greater support of issues such as SR and HR. But having said that, I appreciated the comment, I think, by the first speaker that public health improvement is a powerful, I think, entry point to prioritizing adaptation actions. I think that's another way of looking at it. It's not the way an adaptation fund necessarily would think, but like I said, we would really appreciate building new partnerships with the health community, if you will. And I don't see any real challenges in doing so. I will say that among the funds in general, there tends to be a bias towards brick and mortar interventions, and that's another structural, thing. But but I think the awareness level is growing, and I think we can be hopeful that these kinds of issues will be taken quite seriously, particularly if countries themselves are willing to embrace this and recognize that SRHR, these are not women's issues. I mean, these are societal issues, maternal health, neonatal health. These are not women's issues. They're in everyone's interest, and any leader worth his or her I don't know what the saying is, but worth their salt, I think, has to recognize that. So maybe I will stop there. Like I said, the funding is available at the Adaptation Fund, and we look forward to seeing different kinds of, I say different from what we're used to, but I do want to say that we have an innovation funding window, and this could be an interesting opportunity because there is still, I think, maybe a barrier to understanding how this is relevant and important, but perhaps these are some opportunities that could be used to advance the agenda further. Thank you.
Brilliant remark, Saliha and Saliha. Really, you have the work cut out for us. We have more research to do, more support to country, and really understanding how we can put forward programs and activity for really bridging the gap. So thank you so much for your remark. We are a bit over the time, but maybe we can take one question from the floor if there is one, or online if there is one. I know that there is a break time, and so we've been given a kind of 5 minutes grace. So if there is a question, please.
Thank you. I was interested in what the finance person said. I just wanted to know what is Innovation Fund, so that maybe, should we engage you, we should understand exactly what that fund is. Thank you.
Brilliant. And maybe we have a couple of questions.
Yeah, follow-up question related to that. Is the fund accessible to, what's the target group? Do you get applications from non-for-profit organizations, universities, other than government entities?
Just to say thank you very much for your presentations. They were wonderful. Thank you so much.
Brilliant. So I think there is one question I think is an important question. So if I can give you the floor again.
Oh, thank you very much. And thank you for those questions. Actually, we have several innovation windows. Some of them are accessible only to entities that are accredited with the Adaptation Fund. So we have multilateral, regional, and national entities that can access those funds. But for those who are not, there is the Adaptation Fund Climate Innovation Accelerator. And so I think this mechanism is administered by UNDP and CTCN. I'd be happy to chat more about it because it needs a bit of time to explain. But it is accessible to NGOs and other groups like subnational governments, non-conventional groups that are not accredited with the Adaptation Fund could access funds from there.
Brilliant, thank you. And I think I would like to thank all the panelists for this important discussion, bringing your perspective. I would like to thank all the participants here and online, and the WHO Pavilion for hosting us today. And there will be recording of this session, so there is a lot of information. We can go back and watch it again. And thanks again for the panelists for your insight.
The impact of the climate crisis on sexual and reproductive health and rights. It is time we build climate-resilient health systems to protect the well-being of all. The global climate crisis is one of the most pressing problems we face. It disrupts development, multiplies people's vulnerabilities, and worsens gender inequality. When a climate disaster hits, livestock and crops are lost. Households and livelihoods are destroyed. Girls may be removed from school and put to work to alleviate their family's financial hardships. A girl out of school is at risk of being married off to a much older man, leaving her vulnerable to intimate partner violence and HIV due to an imbalance of power. Her education and aspirations are ended. Women and girls often lose the ability to manage their reproductive health. Health services like family planning are interrupted and unintended pregnancies rise. No menstrual products and lack of clean water may prevent them from menstruating with dignity. more women die without qualified birth attendants. To reduce shocks during disasters, we must protect the health and well-being of all. Climate adaptation measures need to include strengthening health services, especially sexual and reproductive health. National health plans must include strategies for adapting and building resilience. Better emergency preparedness, response,
sometimes it's when you've said something many
Big smiles are always.
Testing 1, 2, 3. I can hear myself.
Hello.
One, two. Now I can hear me.
I can hear you. Can you hear me?
Hello? Oh,
No.
okay. No, I can hear
Just
him.
once.
We're ready to start? Okay. Hey everyone, we're gonna get started, so please put on your headsets if you're interested in listening. Sorry for we had some technical difficulties, so we were getting started a little bit late. I'm going to give it a minute for people to clear out if they're not staying for the panel.
Joe, I cannot hear you.
Oh, you cannot hear me? No, it's okay. Now you can hear me? Okay.
Hello? Hello.
Can you hear me? Are you set to channel 0? And can you hear me when I talk now? Okay, good. Yeah, and so thanks guys for staying at the last panel of the day here. Some people are saying they can't hear in the audience. I don't know what. Go to channel 0 if you're having trouble. We're good? Okay. So my name is Benjamin Matek. I'm from this company called Apt Associates. We are an environmental consulting firm based in the United States, and we do a lot of work on black carbon in the waste sector. For those who do not know, black carbon is a part of particulate matter that has climate forcing abilities, hundreds to 1,000 times stronger than carbon dioxide. But it also has health effects like particulate matter, like causes respiratory issues, cancers, asthma, all of the well-known issues, health issues caused by particulate matter, and it's commonly released in the waste sector from open burning and other combustion processes like waste combustion when it's not properly regulated or filtered. And so we're here today to talk about how work in the waste combustion sector can have climate benefits but also health benefits. And I have a really great panel today of people who have been working on this. And as a format, we're going to kind of give each panelist a quick few minutes to talk about themselves and about their work. And then we're just going to go straight into a discussion format. In the end, we'll have some time for audience questions. And so my panel today is Gina Kanhai. She is a consultant for the World Health Organization, who is a project manager and has done work for the Development Bank, KFG, DEG. I'm also joined by Joseph Spadaro. He's an environmental research scientist and is also a consultant for the World Health Organization, European Commission, and the European Environmental Agency. I have Carlos Silva Rijo. He is the current president of the International Solid Waste Association, and he's a Brazilian lawyer and has been working in the waste industry since 1999. And Zoe Linkowitz is a senior technical advisor and the head of communications at WasteAid. And she has 20 years of experience implementing local and global circular economy initiatives. And so I think we'll just roll right into our first panelist. Gina, I think you're up, and to kind of give a quick introduction about yourself and some of your work for the World Health Organization.
Yes, thank you so much, Ben, for inviting me. It's a real honor to be here. As you can imagine, as doing research and also presenting this research here today, I'm a scientific-minded person. But I think more than that, I'm quite action-oriented. So I did try to found a startup. It wasn't successful, but you practice. So I'll give my best to give you concrete actions so that you can drive change in your communities today. And with that, I would say we'll just start looking at the research. So let's start with seeing how we can, or one back please, how we can connect waste management, health, and climate change, because these are usually three terms that don't come up in the same sentence often. So the research Joe and I will be presenting is part of the WHO Urban Health Initiative, with the pilot city being Accra in Ghana. I can imagine one or the other person, if you look at the picture on the left, you might be relaxing into your chairs and thinking, phew, waste looks a little bit different where I come from. I guess this might not be so relevant for me. Let me assure you, this is not the case. Waste management is a derelict area in most countries worldwide, and we are on the verge of a major health crisis, and it will only get worse if we do not take action now. So this topic is definitely relevant for you. Starting with this uplifting comment, let's look at what we did in our research and what you can do when you're trying to shift the waste management. So we had some research questions. Basically, the main things we wanted to know is, are people dying and what can we change? So if one breaks that down a little bit, first we asked about population awareness of health risks. Why? Because only people who know they are at risk of getting a disease or similar, can take counteractive measures. Looking at methods, you can see how one can do this. What we did was a large household survey and focus groups. If you would like to do a household survey, we also published the survey. It's accessible. You can adapt it a little bit and use it. What we did next is we estimated the emissions that currently arise from waste management in Accra. Now, this how is a little bit more difficult. So we used a tool which was developed by Apt Associates. It's called the SWEET tool, Solid Waste Emissions Estimation Tool. Um, it needs quite some data input, but it's all data one can get quite well. So we did some site visits, for example, looking at where is waste, how is waste collected? So then one would need to, for example, know what kind of trucks are used. Do they run on diesel or gasoline? How far do they travel each day? So all things one can find out quite well. This tool, what makes it very nice is it's Excel based and it's very easy to use, so highly recommendable. The last thing we did was we looked at what are the health impacts related to these emissions that we calculated. Um, this is something Joe will be presenting in a little bit. But I mean, if one looks at where we are right now, this means with this tool we have a current estimation of emissions for the current state, for today, for example. So that's okay, but what we want to know is how can one change things? So we built alternative scenarios, future scenarios up to 2030, based on what might be feasible in Accra. So we had a business as usual, which has a little bit of population increase over the years, and this is balanced by a collection capacity increase. So nothing changes much. Then we have a cease open burning scenario where the open burning is reduced in 2 phases down to 0% open burning during the 10 years. We have an increased composting and recycling scenario where the capacity is doubled for both of these technologies. And then last of all, we have a landfill gas capture scenario where all dump sites are upgraded to sanitary landfills with methane gas capture. If we look at the next slide, you'll see some results. So on the left, related to climate change, there's the total emissions by scenario. So we have the 4 scenarios as lines. If we look at what can one see here that is not Accra specific, so what can one draw out of this? One can see that all scenarios have rising trends. Why? Either population growth, in other countries it might be increased waste production. Therefore, this situation will not get better if one does not manage it well, starting as soon as possible. If one looks at climate mitigation potential, highest potential is with cease open burning, which is the light blue line, and then after that with landfill gas capture, which is the red line. Recycling and composting is relevant, but does not drive the reduction of greenhouse gases and short-lived climate pollutants in the level that one would need it in Accra. If we look at the right, black carbon emissions by source, what one can see, the red line, very strong. Most of the black carbon emissions are from waste burning, open waste burning, and then one has some from incomplete combustion processes at the bottom. With that, I'll hand over to Joe to look at what the health impacts are.
I'm going to stand up so I can face the screen. Oh, that's okay. Okay, next. Okay, so following what Gina was telling us, we calculated what the emissions are, what the reductions for the different scenarios, and then we converted those emissions into concentrations through dispersion models, and then we applied concentration response functions in order to calculate the health effects. Specifically, we concentrated on mortality because mortality usually is the largest effect that we can see on health, both in terms of severity as well as the cost. So in the graph that you see on the on the left-hand side, you can see the timeline of the premature deaths that would be avoided by taking the difference between the different curves. And this is the timeline going from 2019 to 2030. You have the different options that we're considering, and you can see how the timeline changes as you move from left to right. If you tally things up, you find that the landfill with gas capture could actually save about 1,100 deaths over the 10-year period, followed by the seas open burning, which is about a little over 900 deaths. And in the case of the composting, you actually have a worsening of the situation. You actually have 2 additional deaths. When you look at the right-hand side of the slide, you can see how the cost is changing over time for the different alternatives. And you can see that over this 10-year period, the total benefit is generally between $100 and $130 million. These are present value costs in 2020 dollars. And if I wanted to compare that in terms of something that is in the context that I can relate to, let's compare it against the GDP of Ghana. And it turns out that we could achieve about 0.2% reduction in the GDP. That, of course, applies only for the red and the blue curve, but for the green curve, we actually have a loss, and so we would have a greater income. Next. I also wanted to share with you another work that we did, and this has to do with some work that we did in Colombia. Here, what we did is we were looking within the context of the NDC, and we wanted to know, given a certain set of input options, how much could we reduce the CO2 and also the other pollutants, which are indicated on the left-hand side of the slide, NOx, black carbon, ammonia, and PM, and how they are reduced in terms of how much we reduce the CO2, and then convert that into an equivalent reduction in morbidity and mortality, as well as costs. And that's what you see on the right-hand side of the table. On the top, you see the morbidity. We looked at 2 specific scenarios, scenario 1 and 2. Next, on the middle, you see the mortality, and on the bottom, you see the economic assessment. If we look at mitigation scenario 3, we find that the NDCs for Colombia could actually avert approximately 900,000 cases of asthma attacks in children. This is over a 10-year period from 2020 up to 2030. About 3,800 deaths we could avoid in year 2030. And that, again, to put these numbers into context, we compare them, what would be the number of cases of either asthma attacks or deaths if we did nothing? And that would be a 10% reduction in both cases. And then finally, you have your costs. In the case of morbidity, you can avoid about $16 million, about $2 billion in mortality, and when you put everything together, it comes out to about $1.9 billion. So those are the 2 studies that I just wanted to share with you. They're recent, that show the linkages between NDCs and black carbon and CO2 in the case of waste. That is the topic of this evening. And just one final comment, again, comparing these numbers against something tangible like the GDP of Colombia, it's about 0.6% or 0.5%, depending upon which ambitious scenario you choose. Keep in mind that oftentimes, in order to implement the NDCs, it's stated that you need about 1% of the GDP in order to implement the measures. Health alone will give you back at least 2/3 of that, not to mention everything else in terms of environmental improvement. That's it for me.
Off? Oh, there we go. Thanks. Thank you so much. Carlos, your turn.
Thank you, Ben. And I'm very happy to be this evening here at the Health Pavilion to discuss. Is it okay? Yeah, yeah. To be here at the Health Pavilion to discuss about the linkages between waste management or the lack of waste management and health and people's health. because usually it's an overlooked topic, and I here would like to congratulate the organizers and Ben, Abt, and all the partners to bring this issue together. And I'm currently the president of ISWA, the International Solid Waste Association, and
I think the crowd says switch mics. Okay.
thank you, Ben. And I'm also the CEO of Abrelp, which is the Brazilian Association of Waste Management Companies, and we are working, and ISWA's missions is to promote professional and sustainable waste management worldwide. And when is there a problem? Can you hear me? Okay. And when we talk about promoting sustainable and professional waste management worldwide, we talk about ensuring sound waste management for all. The most recent data shows us that 2 billion people in the world lack of basic waste collection, and 3 billion people lack of a sound waste destination system. Those failures to implement such basic services takes us to inadequate situations in which we have open dumping and also open burning. We, as ISWA, some years ago, we published a research called Wasted Health, the tragic case of the world's largest dump sites, in which we identified some of the largest open dumps active in the world, and the relationship between these dump sites emissions and contaminations to people's health. And now we, more recently, we contributed to a research coordinated by Engineering X, a partnership between the Royal Academy of Engineering and Lloyd's Foundation, to really talk about open burning. And we just saw some recent data really emphasizing that we need to tackle this problem in order to save lives. It's not only the case to protect the environment, it's not only the case to mitigate greenhouse gases, but it's the case to save people's life. And this is our main role. But as we are here in a climate change conference, in a high-level forum dedicated to mitigate climate change, it's important to highlight that black carbon emissions from open burning of waste, not only those made in different regions, but also the spontaneous open burning in dump sites are one of the most powerful climate pollutants, climate forces. And according to recent ISWA estimates, if we stop open burning, open dumping, and collect landfill gas from landfills and divert biodegradable waste from landfills as well, the waste sector has the potential to contribute to something around 10% of the global emissions mitigation. Despite the waste industry contributes only with 2 to 3% of the global emissions, if we have a more adequate waste management system in place, the waste sector can mitigate around 10% of the global emissions. If we move from end-of-pipe solutions towards a more advanced system, implement waste prevention, implementing recycling, and organics treatment and waste to energy, then the waste sector can contribute with further 10%. So in total, our sector can mitigate around 20% of the global emissions. And when we have such systems in place, we can contribute to saving billions of people's lives who suffers every day from this inadequate practice. So here is our main message, that the waste sector is a relevant net saver towards the net zero by 2050. And this is the message we need to include, not only to save the planet, but also to improve people's life, people's health. And this is the most relevant and venue to talk about it and to bring into our audience attention. Thank you very much.
Thank you. Zoe, are you still on?
Yes, hello, I'm here. Can you hear me okay?
Yep, we can hear you great.
Super. So thank you to ABD Associates for inviting me to speak at this event in the World Health Organization Pavilion. It's a great honor. I'm Zoe Lenkovic. I am Senior Technical Advisor and Head of Communications at WasteAid. WasteAid is an international non-governmental organization based in the UK. We implement sustainable waste management projects in lower and middle income countries. And our work improves livelihoods, promotes inclusive circular economy innovation, and contributes to a cleaner and healthier future for all. So just to echo some of the points that Carlos has made here, 1 in 3 people globally doesn't have a regular waste collection and safe disposal service. So that's the global figures. But if we look at it regionally, it's 85% of people in sub-Saharan Africa and 91% of people in South Asia. So that's globally, we're looking at 40% of all the waste that's generated every year. So about 1 billion tons is mismanaged. Now, if you don't have a waste collection service, what options do you have? Because nobody can make their waste disappear. You either dump it, in the street, at a dump site, or in a river, with all of the problems that produces, or you burn it. Now, if you're fortunate enough to live somewhere with a regular waste service, the idea of burning your waste might not be so obvious, but actually it kills pathogens, it prevents waste accumulating in neighborhoods, and causing all sorts of other problems for communities. So in many ways, it is the best option that people have, unfortunately. But when we look at, if we're burning or mismanaging 1 billion tons of waste every year, the emissions that come from that are estimated, as Carlos was saying, to be around 10% of global emissions. That's double aviation, and yet it attracts a fraction of the climate finance. Of course, the health impacts, which is what we're really here to talk about today, are severe and varied. The health impacts include heart disease, cancer, asthma, emphysema, skin and eye diseases, nausea and headaches, damage to nervous systems, and damage to reproductive systems. And in fact, the health impacts on children are even more severe because, they're not just small adults, their bodies are developing and they're much more sensitive to environmental pollution. So in children, we see nutritional malabsorption. Now, this is because the intestine, the lining of the intestine doesn't develop properly. So the intestine should have a very wiggly surface area to absorb the nutrients from your food. But if you grow up somewhere without decent waste management, your intestine just develops in quite a smooth way through a process called environmental enteropathy. And that means, from a parent's perspective, even if you are, you're doing everything you can to feed your children healthy meals every day, they could still end up with malnutrition. Okay, and that, of course, has further impacts on childhood development. By the age of 8, these children are 4.5 centimeters shorter than their peers. They have doubled levels of diarrhea, educational underachievement, and 6 times the levels of respiratory disease. So this is a significant issue for a great many people on the planet. So WasteAid, we work with stakeholders in lower and middle income countries from the public, private and community sector. We recognise that many of the places that we work don't have waste managers as we would see it. And so we need to work with all different kinds of stakeholders from health protection, the economy, natural resource management. We need to work together collaboratively to develop a shared understanding of the value of waste management, or indeed the cost to society of not managing waste safely and sustainably. And then we also work with global partners from the business sector, institutions, and other donors that want to accelerate change in this area and make a cross-cutting impact towards delivering the Sustainable Development Goals. So once again, thank you ever so much for inviting me to this panel. Just to close with our message to COP is that waste management is climate action. Thank you.
Thanks, Zoe. So the way we're going to do the next 20 minutes or so is I'm going to ask our panelists some questions. I think we'll start maybe going the reverse order that we just did. It will give everyone a moment to try to answer the question if they want, or they're welcome to pass if they don't have an answer. And then after that 20 minutes, we'll do open the questions to the people here in the pavilion if they have any questions. So the first question, which will go Zoe, Carlos, Joe, Gina, and you guys feel free to pass if you don't have an answer, is in the communities you're working in, do people on the ground make the connection between health and the climate benefits, or the health costs of black carbon and the climate benefits of mitigating it, or is there still an education gap and more education needed in these communities you're working in? So.
Thanks, Ben. Yeah, really good question. I would say, in many of the places where we work, education, general education about environmental protection and protecting your health and the health of your family is lacking. Of course, when we work in communities, we don't want to just fill people with fear and say, oh, open dumping and burning is causing, these problems in your community, is causing these problems in your childhood health and development. Because, mental health is as important as physical health, I think. And unless you're actually enabling people to create safer and more sustainable alternatives, then we just need to make sure that we're giving people practical solutions at the same time as educating them about the dangers, the local, personal, and global risks of poor waste management.
Thanks. Carlos, do you have any wisdom to share?
First of all, I would say I don't think it's an education problem, because it's more an awareness problem, because not only related to open burning, but let's say what we see in many places around the world is that common people doesn't make the direct link between their attitudes and the consequences of those attitudes. So when we see people just putting fire in the waste in front of their houses or in their backyards because they don't have waste collection services, it's because they want to get rid of those materials, and they don't know, they really don't have the knowledge of all the negative impacts these attitude causes to them. So for instance, when you have vulnerable people living around open dump sites, they are making their lives from the dump sites. They really don't know what type of negative impacts those activities cause to their health. And the same situation when you have people living by the sea or by a river, and when they dump their waste into the sea and into the river, and those waste just cause a direct problem to themselves. It for sure pollutes the environment, contaminates the water, and causes global warming. But in fact, the first impact of those attitudes are directly on each one's health around or nearby those places. So here, what we really try to do at ISVA is to loudly advocate, saying that lack of waste management is a health problem. And on the other hand, or the reverse of it, what we say and what we advocate is that sound waste management is a basic human right. And this is what we must fight for. That this activity to implement basic waste management services are considered as a human right, as a right for everyone to have some quality of life, to have a quality to enjoy a good environment, and then develop good health and not the problems we see nowadays. Because as we just heard from the researchers, most people don't know that some health problems they develop are due to inadequate waste management practices. And this is the link, the missing link, and what we need to really bring on board to show everybody. And then we think it would be easier to move forward and catalyze the most needed resources in order to change this situation.
Joe, do you have anything to add?
I think Carlos and Zoe have pretty much covered it all in terms of that, of the question you asked. But I agree with Carlos that it's not so much an education as much as really a combination of factors. People are unaware of the consequences, but sometimes they may be aware of the consequences, but they have no option other than what they're practicing. So we need to provide them opportunities and in terms of accessibility to waste management and provision of waste management opportunities. Without those, you may be well-intentioned, but you have no other choices to just burn the waste in the front of your house because you have no other option to remove it, to get rid of it. Clearly, being aware of it makes people more demanding, politically speaking, what needs to be done. They say, this is not acceptable to us. By educating them, they know what is the effect to their health, what is the effect to the environment, what is the effect to their families, and then they can demand that there be a change and there will be a political reckoning for it.
Gina, do you have any thoughts? You'll also get the next question first, so.
Oh, perfect.
Yeah.
Let's see about the next question. Yes, I have some thoughts on this one before we get to the next one.
The next question will be on NDCs, so a little different, but.
Yes,
What?
so I'll stay with this one first. Okay, so I think there are actually two gaps. So one, yes, it's education or awareness, but I think there's another thing. So research on health awareness shows that people generally underestimate the risk of falling ill, which means if we imagine me and my twin both growing up the same, I will assume my twin has a higher likelihood of falling ill than I do, even if I'm very well educated. So I think this is a bias we have. Then, of course, there's an education and awareness gap. What we saw in Ghana in our study was for short-term effects, so the connection between waste and cholera, waste and diarrhea, or waste and malaria, people throughout all levels of society and education were fairly well educated. Looking at long-term effects, so now we're going into more of these black carbon related effects such as asthma, so respiratory tract issues, we found very, very low awareness. Now, if we look at even the longer term, because people generally don't die of asthma, they die of something that overwhelms their decreased capacity of the respiratory tract. So, for example, we are now in a health crisis with COVID. I would wonder if people throughout many of our societies are aware that their risk of, for example, incurring severe COVID increases with particulate matter emissions, which also arise to a large part from waste. So I think we have a very big education gap, but in addition, we have this bias that even if people know, they are not willing to accept that they actually could be at risk. So I think there's two things one needs to look at there.
Thanks for that addition. And so the next question is a little bit changing topic. Where for those listening who in the room who might be working on NDCs, how can what policies should go in NDCs that kind of can reduce black carbon emissions, but also or climate emissions? What policies would you recommend? Strategies, and how would you sort of integrate these into NDCs, or how do countries integrate these in NDCs?
So I'll go for part of the questions. How can one reduce, or what strategies can one use to reduce black carbon emissions? I think there are experts in this room who are much better suited to answer the NDC part. So what I would always recommend is that one looks at where are these emissions arising and why. So since mostly it's waste burning, the question is who is burning waste and why are they burning waste? And then one sees what strategy would align. I can just give a few examples of what we saw in Ghana. So we saw high income, low density households burning a lot of garden waste. Why? Because it didn't fit into their trash bins. So something one could think there about doing there is one, education, because there's definitely limited awareness, but then maybe also something like decentralized composting, which usually would not be viable in Ghana or in Accra, might be something to think about here. Middle income households, very different situation. They burn waste because it's not picked up. So then one can think about how does one increase the reliability of collection, or because it's usually related to poor weather events, how does one get better road networks or lighter trucks that can pass if the roads are blocked because they're swamped and muddy? If it's the informal collector that burns waste because they don't know where to dispose it, one can think about integrating the informal waste sector into formal collection processes. If it's informal waste recycling because one is burning to, for example, get at the raw materials, then it's a very different situation again. So maybe it's about setting up recycling centers, doing enforcement work, controlling landfills or similar. So I don't think I can recommend a single strategy. I think it makes sense to look at who and why and then see what leads to significant change.
No,
Thank you.
those are really great suggestions, even if they weren't NDC related. But we'll hopefully get some NDC additions from the next panelists. Joe, do you want to go next?
Yes. Well, thank you. That's a given where where we are today. That's a very pertinent question to ask. How can we get the NDCs to address these issues? I showed the example of Colombia because it was something fresh off of the drawing board that I just finished. And in setting up that particular analysis, we considered over 150 different mitigation options targeting different sectors. So for instance, in the energy sector, we looked at energy mix. We looked at greening the system. We looked at energy efficiencies. We often overlook that just simply improving the efficiency of a system has a significant return in cutting down the emissions. Now, one thing that is very important for the NDC process is to set up an inventory. You need to know where the emissions are coming from, what sectors are responsible for the emissions. Once you set that up, then you can specifically target the sector in terms of taking into consideration what can be done in the short term, what can be done in the long term, and what is cheaper and what is most expensive. So therefore, it allows you to prioritize the different measures and the timeline under which you do that. Now, setting up an inventory, of course, is a big thing, but it really requires three key elements. You need to look at a specific sector, try to measure, follow, and then consider options that you can consider in order to reduce the emissions from that sector. In the case of Colombia, we found that waste was not as important as transport, and it was not as important as forest fires, whether they were necessarily triggered by natural events or man-made events. On the other hand, I also did a study that I just finished for Nigeria, and there we were really surprised how much waste burning was contributing to the problem. In fact, nobody thought that was important, and they were focusing exclusively on transport. It turns out that after we did the inventory, we found out that waste management was number one by an order of magnitude, followed by transport and the remaining sectors in the economy. So to summarize, really getting a handle on what is the inventory to target it so that you can adapt your strategy of intervention.
Thanks for that. Thanks for that, Carlos.
Yes, I'll follow on Joe's comments, and I was thinking, like, when we talk about NDC and waste, not only on like a black carbon perspective, but the first topic that comes to my mind is we need a methodology to quantify and assess the emissions from the waste sector. Because if we don't measure, we don't know the sources, we don't know the amounts, and thus we don't have any feasible or positive solution. So this is the first thing. And Zoe mentioned a important data during her initial speech, is that only talking about open burning of waste, the climate impact is almost double than the aviation. And here, during these 2 weeks of COP26, we heard a lot of mitigating greenhouse gases emissions from aviation and other transport sectors, and very few about stopping open burning and implementing sound waste management, despite the emissions from inadequate waste solutions are more than double if we count all together. The second point, coming back to the NDCs, the second point that comes to my mind is that we also need to develop a carbon system with a fair and transparent carbon pricing in order to support and put forward to guide the right decisions. Without this transparent and fair system, we won't have like the best decisions in place. And third, but no less important, is that we need that NDCs consider waste sector as a net greenhouse gases reducer. If we don't have it, we don't move forward. And I dare to say, if we don't consider the waste sector as a relevant greenhouse gas reducer, we won't achieve our 1.5 target. And here is the main pledge that we must bring now and we must raise today, is that all NDCs have waste as one of its focuses. And according to an information just presented yesterday during a side event we hosted here at COP26, only 16 NDCs currently includes waste as one of its focus. So there is a long road ahead that we need to really move fast in order to achieve the targets and the goals that are being set and that are being under commitment during this COP26.
And Zoe?
Thank you. Yeah, so great responses from the other panelists, and fascinating to hear from Joe about the the scale of the emissions from waste in Nigeria. It'd be really interesting, and hopefully over the coming years we'll be able to get more comprehensive data from more countries, just to be able to prove what many of us know, but we just don't have the data to show it at the moment. I mean, why isn't waste included in NDCs? Purely because we don't have, in many cases, we don't have an internationally agreed way to estimate the emissions from poorly managed waste. Why? Well, it's, as Gina was saying, it's a very complex area to try to get data for. I had an interesting conversation a couple of months ago with somebody else from the health sector who was talking to me about the struggle they had in estimating the emissions from cook stoves in people's homes. And it's similar to that. It's because it's very dispersed. Lots of small points where waste is being burned. And then at the other end of the scale, we have dump sites that are regularly on fire, and who knows what is in that dump site, who knows how many cubic meters of mixed waste have burnt and at what temperature and under what conditions. So it's, to get actual data is going to be, I don't want to say it really, but it's going to be impossible to get the actual data. So we need to develop a way to agree a way to estimate what that impact is, so that governments can do the calculations and realize for themselves, if you've got a population that's this big, generating this much waste, and you're not collecting any of it, or you're only collecting and managing, say, 10% of it, then you can bet your bottom dollar that the rest of it is probably going up in smoke in some way, shape, or form. So I think that events like COP this has been great. The lead up to it, the work that we've been doing with other partners from different sectors and from around the world, and this event as well, bringing us together here. Because it's really interesting to understand and important to understand about each other's research, so that we can, join those dots. And hopefully by the time COP27 comes around, we'll be, much further ahead in terms of having an agreed methodology for estimating those emissions, and then getting waste included in the NDCs, and ultimately able to attract climate finance.
Thanks for that, Zoe. I want to open it up to the audience if anyone has questions. My colleague there, Olga, in the lovely pink sweater, has a microphone. So just say your name, who you're from. If not, I have other questions we can ask in the last 10 minutes, but I just wanted to give people an opportunity. Yeah.
Hi, I'm Modin Watsama from the Wellcome Trust. Thanks to the panel for the excellent presentation. This is all quite new to me as an area. I guess I had a question around, in one of the presentations, there's a reference to gas capture in waste management. And I just wanted to know, what is gas capture?
Do you want to say who you want to answer? Just direct which panelist, or do you want me to choose, or?
Someone's got her hand up. I think Zoe's got her hand up.
Zoe, do you have your hand up? Do you want to take it?
It was Gina.
Oh, Gina. Okay.
Presentation actually, so I'll pass to her.
Okay, so this refers to landfill gas capture, so methane gas that is captured from landfills. I hope this clarifies.
So I can unpack that a little bit for you, Modi. So when organic waste is disposed of in landfill sites or dump sites, it gets compacted under the next waste that comes in. And when organic material, biodegradable material, decomposes in the absence of oxygen, so in that kind of compacted condition, then it generates methane, which is a very potent greenhouse gas, as I'm sure you know. So by diverting organic waste from landfill, or alternatively where it's already there, installing landfill gas capture. So you collect the biogas, which is methane mixed with a few other gases, and then you can use that. You can clean it up and use the methane as a clean burning fuel to generate renewable electricity.
If I could add one comment to that. A number of years ago, we did a study about the gas capture. When you capture the gas from the landfill, you can do several things with it, as Zoe was mentioning. You can flare it so that you convert it from a very potent to a less potent, climate altering pollutant. The other option would be to capture it and then use it, for instance, to run a gas turbine, which means you can generate electricity or generate heat. In fact, what we did is we did a study where we looked at a landfill without gas capture and calculated what is the cost per ton of waste that we dump into that particular landfill. And that, in the case of Europe, came out to about 63 euros for every ton that we dumped into the landfill. If we decided to capture 70% of it, say that's the state of the art that we could have done at the time, then the cost would have dropped to about 33 euros per ton. So it halved. Now, in addition to doing that, you might say, okay, well, I want to use that for something else, to produce electricity. And so if that is the case, you wanted to produce electricity, and then it depends, what do I do with that electricity? What am I displacing? If you displace, let's say, electricity from, let's say in the house where you might, let's say, want to use it for cooking purposes and things like that. And let's say your source to provide the electricity is fossil fuels, then in that particular case, we were able to drop the value down to 24 euros per ton. So as you can see, we almost got a third of the original cost impact to health, both mortality and morbidity, by simply capturing that gas and utilizing it.
May I add something here? Just a particular comment, Ben. And Joe, those figures are amazing because these reminds me that the cost of inaction is always higher than the cost of doing something. And this is something important when we talked about financing adequate solutions, when we talk about attracting some resources to the waste sector, that we need to have those numbers and those figures very clear ahead of us, because usually when we go around, and I know that most of our panelists have been around in different places of the world, lacking of basic waste management infrastructures, and have heard from many of the responsibles that the situation is that way because they don't have money to improve, because they don't have resources to, let's say, implement a landfill, to implement a landfill gas system, or to improve a advanced system such as like a composting plant or a sorting plant. But it's because usually those calculations are not often made. Those calculations are not often brought into attention of the responsibles, of the citizens, because as you mentioned, Joe, and I fully agree, if we bring those to citizens' attention, then we start demanding the change. Then the population is starting requesting the right change. And here is our power as citizens, as groups. We managed to request many improvements throughout our living, and we are still lacking to request an improvement and a big change in the way we manage our waste.
Thanks for
If
that.
I could I come back on that one quickly, please?
Sure.
George,
I see we have another question. So
got there first.
yeah, do you want to
very quickly?
go for it?
Thanks. Yeah, just to back up what Carlos was saying, is a report from 2015 by the International Solid Waste Association, so Carlos's organisation, and UNEP, and they found that if you go to, if you're working in a place that has no waste management, right, for every dollar that you invest in waste, in a simple waste management system, you get $5 to $10 back of savings to society in terms of improved health outcomes, reduced flood risk, all local economic benefits as well. So it really is a very good return on investment. Thank you.
Thank you, Zoe.
No, that was a good addition. I saw we had another question. I saw this hand up first. Can you just say who you are, where you're from, and say which panelist your question is directed to?
Yes, thank you. My name is Deo Okure from Uganda, and I work in the air quality space, so this is very exciting for me. I have a question, I guess, Carlos. Thank you. Yeah, I'm picking on you because I know they're very exciting case studies for, South American cities, especially, Curitiba on waste, innovations around waste management. So I know there's a textbook case for, of course, waste to energy recovery, value addition in terms of the waste streams. But my view is that that doesn't seem to be, it's not been, very proactively, pursued by many countries. So what exactly are the barriers to why aren't we? Because if you look at the global south, where it's not just waste, there's also energy access is a problem as well. So there's a clear case for, of course, getting alternative source of energy from the waste streams. Why isn't that happening? What are the actual barriers? Why don't we see that happening? Thank you.
Thank you very much for your question. And here we have some issues. I would say that this is a crucial question in order to improve waste solutions in the global south mostly. And what we do have first is to consider the waste characteristics in those regions, because in order to have waste to energy system, you need a minimum calorific value of the waste to make those plants, let's say, performing well. So this is one thing that we really need to take into consideration. And secondly, I would say we need to consider what is commonly called the waste hierarchy in a stepped approach in order to really find the right solution for each location. In waste, we used to say there is no one size fits all solution. So we need to consider, like, first, how can we reduce waste generation? How can we promote reuse and recycling? And after we have that, then we consider the treatment options. And then the treatment options can be organics treatment solutions, like composting, like anaerobic digestion. Then it can be heat treatment to produce energy, and then waste disposal. And last but not least, I would say we need to take into consideration the costs involved. Usually, in different regions, to make the investment in waste to energy plants, it's something you need, like a long-term contract. You need a good energy price in order to make the system running. So there are several topics, I wouldn't say barriers, but there are several topics to be considered in a more pragmatic and strategic approach. And it's not only to take the decision, let's say, backwards. You need to plan accordingly. And here is something that we are considering from ISVA. We have in ISVA a waste to energy working group, because ISVA knowledge is constituted by different working groups. We have one dedicated to waste to energy, and this specific working group is preparing a guide about waste to energy in developing countries, which will be released soon, and I will share my contact if you want to have a copy of it when it's released. Thank you very much for your question.
Thanks, Carlos. We're at time now, so I'm gonna wrap us up. It's 6 o'clock. I'm sure everyone wants to get to happy hour or dinner or whatever their next plan is. So
Ben?
Oh yeah.
Could I just make one last statement?
If it's like 30 seconds or less.
Okay,
Yes.
never mind.
Okay. We're at time, so I just thank everyone for joining and those for joining virtually as well. If anyone on the internet or here wants to get a hold of anyone on the panel, you can reach out to Apt, and we're happy to connect you, or find me after, and I'll make sure you get their contact information. So thank you.